2024, yung bilis o yung oras, yung araw ng pag-process ng PhilHealth po. Kung makikita po natin in the year 2021, pababa na po yung trend ng turnaround time. Ibig sabihin po, in the year 2024, as mentioned po, ay nasa 23.35 days po yung ang araw ng pag-process po ng PhilHealth. Now, ito po nagpapakita yung instruction ng PCEO Ledesma po na ayusin yung sistema sa pagbayad na mabilisan po. Ito po ay aggregated po ito nationwide. Ibig sabihin, may mga hospitals, may mga claims na more than 23 days o may mga claims na less than 10 days po. So yung average niya ay nasa 23.35 days po. Ibig sabihin, yung isang buwan po na turnaround time ng pag-receive ng claims, more or less nababayaran na po ng PhilHealth. Now, pwede po sa before that slide po, doon natin makikita yung claims ng status po. Isang slide po. Before that slide po.
Can we flash again the first slide? Pwede po pakibalik yung first slide. I just want to be clarified, Mr. Limshaco.
Yes po.
Ano po yung figures na nandito sa left hand? 50, 45, 40. What do they represent?
Mr. Chair, that dito sa kanan side, kaliwa, that represents the days po. Mr.
So by
Chair,
50, you mean 50 calendar days?
yes po. And nasa batas po, PhilHealth po ay given the 60 days to process the claims. Meaning po, 60 days dapat hindi po siya lumampas ng 60 days. Yung
For one
pag-process
hospital claim.
sa isang claim po. Opo.
Mr. Limshaco, how about the figures at the bottom? Along with national, 41.4 for 2018. What do they represent?
That figure, Mr. Chair, Honorable Luistro, representing the actual average turnaround time ng pag-process ng PhilHealth ng claim po for that particular year. So meaning, in the year 2018, nasa 41.04 po yung processing time, processing day ng PhilHealth po.
So the average number of days for all the claims that were facilitated is 41.04 number of days.
Yes po, Mr. Chair, Honorable Luistro po.
In other words, the one on the left hand is the actual number of days, and the one at the bottom is the average number of days.
Mr. Chair, Honorable Luistro, itong sa baba po, yun na yung pinaka-absolute na average turnaround time po natin. And then dito po sa kaliwa, naka-range po siya ng +5, meaning kung sabihin natin 41, nasa 41.04 in the year 2018, nasa 40 po, nasa 40 po yung bar natin.
But that represent the number of days as well.
Yes po, Mr. Chair, Honorable Luistro po.
Mr. Chair, just a follow-up question po. If,
Congressman Sia, you're
Jinky
recognized.
allows his representation. Can we go back to the slides because we want to understand. I think Congressman Jinky wants to convey to ito pong explanation po to the public as easily as they can understand.
Opo.
So pakibalik po. Ito pong nasa left side, that's clear. Sabi niyo po, yung vertical, yung anyang arrangement is, yan yung number of days. The bottom, 41.04. Ito po, what's the basis for you to arrive at the 41.04? The total of
Yes po.
the total number of payments, the total
average aggregated average po ng claims na
the amount of
pumapasok kay
claims that
PhilHealth,
you need to pay
the
out.
number po and the processing po ng claims po natin. Meaning, ito po, kumbaga naka-range po tayo sa vertical. Ito po yung 41.04, 22.79. Ito na po yung actual na turnaround time po on that particular year. Na umabot sa ng 41.04 and bumaba sa ng 22.79. In the year 2019, that is the pre-COVID stage, And umakyat po siya dahil nasa COVID stage po tayo. And post-COVID po, dahan-dahan na po siya na bumaba naman until sa 2024 po na operation na pinipilit po ng korporasyon na ibaba pa yung turnaround po ng pagbayad ng claims sa ating mga hospitals and facilities po.
One follow-up lang po para maintindihan lang po ng talagang taong
Opo.
bayan. Itong 41.04% is percent ba ito o number of days?
Number of days po. Average number of days po sa pag-process ng claims.
So lahat yan number of days. On the vertical arrangement on the left side, in that of the bottom figures, are all number of days. It does not represent any percentage of an
Yes po.
actual. Okay.
Yes po.
Thank you.
Sa other slide po, makikita natin yung numero at saka yung percentage po, Mr. Chair.
Thank you. Para mas klaro po. Thank you, Mr. Lim Siaco.
Mr. Chair.
Thank you, Kong Jinky.
Mr. Chair,
Yes, PCO man.
just a quick interjection, no. So, lahat po 'yan average number of days, Mr. Chair, no. Now, just to give an idea, PhilHealth kasi sa dami pong claims, we process roughly 10,000 claims daily, no. So that number would be very good kasi at least may sense. Parang average po 'yan per year. So, parang may sense 'yan yung number of days. So, that's just, I hope that explains it better, Mr. Chair. Thank you, Mr. Chair.
Mr. Lim Siaco, tama po
Please.
bang sabihin that your presentation pertains only to those claims which were paid already?
Mr. Chair, Honorable Luistro, tama po, these are paid already claims.
In
Ang
other
napapakita
words,
po natin.
in your presentation, hindi po kasama etong 59.6 na pending claim against PhilHealth.
Yes po. Ang sunod natin na slide po, ipapakita na po namin yung anong ibig sabihin ng 59.6 billion po na binanggit nyo po na mga claims po. Sunod natin.
Can we bring back the slide, please? Can you please educate us? Paano po kayo nag-arrive dun sa 41.04? Please present the actual computation.
Yes po. Ito po, ang 41.06 po ay total aggregate claims po na na-receive po natin.
Understand. Pero ano po yung mga figures na finactor in nyo to be able to arrive at 41.04?
Kinukuha po natin kung kailan ng PhilHealth po na-receive yung claims and kinukuha din po natin kung kailan po na-checkeyan ang claims. So,
Can you please present to us the actual computation of that 41.04?
Mr. Chair, kung Luistro, dito po hindi namin wala kaming data na nadala po, but we can come up with that computation po.
Perhaps we can ask
Yes po.
your technical staff in the office, and before we conclude with our hearing today, Mr. Lim Siaco, you will be able to present to us the computation that you did to be able to come up with that 41.04. Pakibalik po yung first slide. Because only if nasusunod natin itong presentation being shared by PhilHealth with respect to all hospital claims, these are acceptable. 41.04 number of days, 22.7 number of days, 43.8 number of days, 47.5 number of days, 32.4 number of days, 34 and 23, all within the 60 number of days, which is mandated under your charter, correct? Is this correct, Mr. Lim Siaco?
Yes, Mr. Chair.
So if
Honorable Luistro.
only this presentation is being followed really by PhilHealth with respect to all claims, I don't think we will be encountering this 59.6 billion unpaid claims.
Mr. Chair.
Mr. Chair, before
Before I recognize Mandy, the chair would like to recognize the Honorable David J.J. Suarez, Deputy Speaker from the 2nd District of Quezon. The chair would like to recognize also the Honorable Vice Chairperson Romeo Acop from the 2nd District of Antipolo City. Please continue.
Mr. Chair?
Thank you, Mr. Chair.
Mr. Chair, yes. Pardon me, Mr.
Yes.
Chair. Just
With
before we allow-
indulgence of
Yeah, with the indulgence of Kong
Chair
JK,
would like to
pasensya na po.
recognize
Gusto ko lang
Congressman
po
Sia.
maintindihan before we go to another slides, no? Pakibalik lang po yung first slide para we are on the same wavelength, no? Diyan sa baba, pasensya na po sabi niyo po that corresponds to the number of days. My question is, bakit mayroong 0.79? What's 79 and what 04, what 53 represent? Is it hours? 32.44. 34.20. Yeah. Sige po.
Mr. Chair, Honorable Adjong, again, yung calculation po natin dito, kailan po na-receive ng PhilHealth and kailan po na-issue ng cheque ng PhilHealth. Now, ibig sabihin, lahat ng mga claims na yan, kinukuha natin yung number of days and tinototal po, divide by the number of claims po to, and then we can get that 41.04. Meaning, kasama po siya sa calculation natin na talagang may butal po na lumalabas po.
Yung butal kasi in terms of days, this is not an amount to be paid, this is number of days, no? Yung question ko po, yung sabi ni Kong Jinky, kasi gusto natin maintindihan talaga sa mga tao, what does the decimal point represent? Is it number of hours? If 41 is the number of days, what is decimal point represent? Is it hours?
Mr. Chair, Honorable Adjong, meaning that butal po, that will represent a fraction of a day, meaning convert into hour po, pwede rin po natin siya ganun mangyayari po. So, kumbaga, nasa stamp po tayo ng pag-receive ng PhilHealth because automated na po to, and nakikita din po niya yung kailan na-issuean ng cheque po, and then add up and divide based on the number of claims processed on that day. Again po, on that year, I mean. Again po, this slide po, kung makikita nyo po, national good that, meaning these are good claims. Meaning, ibig sabihin nito, yung mga claims na pumapasok po sa PhilHealth na talagang quality niya ay mataas, ibig sabihin free of defects na siya kumaga, na through and through yung processing ng PhilHealth ng pag-process and pagbabayad po, Mr. Chair, Kong Adjong.
I just want to make a comment to what
Ma'am,
you said.
Ma'am, sorry. Can I address first so we don't get too far? Is it okay, ma'am?
With all due respect, Mr. Ledesma, this has something to do with his earlier manifestation. If you are saying that those decimal numbers represent the fraction of day, then I wish to believe that they represent hour. Do you agree?
Yes po naman. Yes po, Kong Honorable Luestro po.
Thank you.
Maraming
Mr.
salamat.
Chair,
Yeah.
Mr. Ledesma wished to manifest something.
Thank you, Mr. Chair. Can I proceed, Mr. Chair?
Please proceed,
Yeah. Thank you.
PCO Mandy.
Mr. Chair, actually, I think one of the reasons, kasi ang gaganda ng mga questioning, no, it's all very excellent, no. But I think why maybe the committee, it's a little misleading yet, because I want to highlight the slide Sernet showed is good claims, no. And the issue, I think what we're trying to discuss, Mr. Chair, is the 59.8 billion. Marami po dyan kasi is what's called denied and RTH, no? And actually, that will be explained in our next slide, no? So, I think, ma'am, medyo, it's a little confusing because, like you were saying kasi, ma'am, if with that amount of days, very good yan. Pero, I want to highlight, ma'am, good claims po yon. Yung 59.8, majority of that are anyway, Sernet will elaborate more, no? Are what's called RTH, returned to hospital, and denied claims, which don't fall under good claims po. Kaya doon medyo may konting, yes po.
I understand, Mr. Ledesma. However, if our intention is to make the presentation chronological, I think you should have started your presentation with the total claims, including both the good and the bad claims. And then
We'll
you
do that, ma'am.
separate the good and the bad.
We will do that. Understood, ma'am. Thank you,
Thank
Mr.
you.
Chair.
Mr. Chair, permission, Mr. Chair, that we will be showing
Yes,
our slide, Mr. Chair.
but before you proceed with your presentation, may I know, ang sinasabi po ni Congressman Luistro na 29 billion, yun po yung nabayaran natin.
Mr. Chair, the
Tama
one
ba?
mentioned 59.6.
Parang 59.8 ata, Mr. Chair,
Hindi, yung sinasabi niya yung unpaid 59
Oh, 59.6.
Tama ba?
Oo.
Unpaid Yung pinakikita ninyo,
59.6 billion unpaid.
So yung pinakikita po ninyo, magkakano po yun? Yung nabayaran ninyo ng 23 days, ilan po yun?
Mr. Chair, sa
29?
presentation makita po natin dito po.
Okay, sige.
Kung magkanong amount po dyan for year 2024 po.
Okay, sige, please.
Initially po, before inaayos nila po yung ating slide, that 59.6 billion, Mr. Chair, as discussed in our previous hearing, ay denied and returned to hospital claims. So, 37.1 billion are denied claims. When we say denied, talagang may reason tayo, and we will be showing that one, Mr. Chair. And 22.5 billion representing return to hospital. Ito ay for compliance, kulang mga dokumento. Of course, meron din tayong presentation slide. Ano yung mga rason po nito? So meaning, these are claims already in the hospital, binalik po ng PhilHealth. Kumbaga, because these are denied, these are returned to hospital. Mr. Chair, let me proceed to my presentation already. This one is the claims processing flow of good claims, Mr. Chair. So, hospital or health facility submitting claims to PhilHealth to our regional office, and I would like to highlight, Mr. Chair, that we are using the e-claims already, meaning automated po yung submission of claims to PhilHealth. And it will pass through the medical prepayment review, adjudication review, payment preparation, and auto-credit payment to Land Bank, Mr. Chair. Now, as mentioned, in the year 2024, our processing time for the good claims is 23.35. And we have the definition of what is a good claim, what is a paid claim, and we have the turnaround time, Mr. Chair. Next slide, please. Of course, there are some instances, Mr. Chair, that there are defects in the claims submitted to us, Mr. Chair. So, pag adjudication, nakikita na may kakulangan, so return to hospital, and talagang pag hindi siya sumunod sa palisiya, bigger, kumbaga, ang kanyang defects to the return to hospital claims, i-denied siya kaagad. So, Mr. Chair, binabalik po natin sa hospital for them to comply relative to the return to hospital claims na maproprocess nila, makompleto nila, Mr. Chair, yung mga requirement ng PhilHealth. And on the part naman po ng denied claims, they can submit naman ng motion of reconsideration for them, for PhilHealth to process that one and then i-review if pumasa na, okay na yung claims batay sa requirement ng ating mga adjudicator at the regional office, ay ibabalik sa claims processing po natin para mababayaran. Pag hindi po, yung ating CRC at the regional office, pag hindi po siya pumasok o hindi siya inalaw, ibalik sa hospital, and our hospital or health facilities, pwede po sila mag-appeal at our protest appeal review department. And if it will be allowed, ibalik sa hospital and ma-file sa regional office po natin, it will be processed and paid. Pero pag hindi po siya pumasok sa quality o sa qualification ng PhilHealth, talagang final denied na po yung claims na ito. So yun po yung proseso po natin. Next slide po. Sa next slide po, makikita na po natin dito yung availment and utilization.
If I may interrupt,
Yes,
Mr.
po.
Limshaco, so just so we don't get lost, you mentioned about denial of claims.
Opo.
Can you please give us a quick rundown? Ano bang nagiging cause ng denial of claims?
Mr. Chair, Honorable Luistro, mayroon po tayo reason po dito sa slide po natin.
The succeeding slide.
Mga succeeding slides po.
Alright.
Maraming salamat po. In this slide, Mr. Chair, this is the processing po ng PhilHealth for the past year 2017 hanggang sa 2024 po. And makikita po natin that average of 93-94% po of claims received by PhilHealth nababayaran po natin. Year 2024, mababa lang po siya sa 85% because ito po ay yung claims ng November and December na babayaran, pinaprocess po ng PhilHealth sa January. Ganun po ang scenario po natin. So meaning, 94% of the claims makikita po natin, talagang nababayaran po na binayaran ng PhilHealth sa ating mga health facilities po. Yun ang ibig sabihin nito po. Next slide, please.
and Mr. Limshaco.
Yes po.
Since ang ganda nung average ng payment of claims mo, I just wish to be clarified. Ito bang 59.6 billion unpaid? What year does this represent?
Yes po, ma'am. Mr. Chair, it will be shown on the next slide po.
All
Meron
the
pa po.
answers are on the next slide.
Yes po. Nandyan
Thank
po
you.
siya. Bilisan ko lang ng konti po para more or less maabot natin yung slide na yun po. Next slide please. Ito naman po ay national din po yung datos natin, 2017 to 2024, of claims po na binayaran ng PhilHealth on that particular year. No? So 2017, 102 billion pesos. And of course, makikita po natin na tumaas siya ng 146 billion in the year 2024. These are claims received in 2024 and paid in the year 2024 po. So tumaas na po siya dahil sa ating 30% na increase that was implemented by the corporation in February 2024 po. Next slide please. Ito naman po yung claims lang po ng 2024 po natin, received in process, meaning 85% of the claims bayad na po tayo and in process po ay 9.3% representing 19.9 billion. And we have that RTH of 2% and denied of 3.3%, Mr. Chair. So meaning, again, as I mentioned, 85% of the claims received in the year 2024, nabayaran po in the year 2024, Mr. Chair, Honorable Luistro. Next slide, please. Ito po yung ang figure as mentioned kanina po na 59.6 ay 2018 to 2024 po siya. Pero ito po yung slide po natin, dahil meron na kaming available slides na 2017, in-add up na po namin dito. And ito po yung status of the claims po. We receive a total of 101 million claims from 2017 to 2024. Meaning, in the year 2024, we have 16 million claims po. And out of that 16 million claims, 176 million ay ang katumbas na pera ng claims po na yan. Now, out of that 16 million, 13.7 million or 85% na bayaran po as presented a while ago, 146 billion po siya, yung amount, money value of that 13.7 claims. Now, on the next sa ilalim po, that is the RTH po natin. Kung makikita po natin, isama po yung 2017, that's 2.1 billion po, million claims po na return to hospital representing 23.5 billion pesos. Again, ito po yung claims na binalik ng PhilHealth sa hospital for them to process, to comply, in ibalik dapat sa PhilHealth. Now, that represents 2% po of the total. Now, we have the denied. Ito naman po yung mga claims na talagang outright dininay na po ng korporasyon, but of course again they have still the chance to request for appeal. May proseso din po tayo sa pag-appeal po nito. So that's 3.8 million pesos, that's 39.8 million pesos. So ito po yung 23.5 at saka yung 39.8, again 2018 to 2024 po yung 59.6 billion natin. Now, dinagdag natin, again, may available kaming slide po na to para mapresenta po natin dito na isama namin po yung 2017, kaya po yung total na yan. Meaning, yung dalawa ng account po na ito, the RTS and denied, nasa hospital po to, hindi po siya considered namin na utang dahil po yung claims ay nasa kanila po. Ang aming kinoconsidered na utang po dito, ito yung in process. Meaning, we received that one, but pagdating ng December 31, 2024, naabutan po kami ng cut-off date and nasa position po ng korporasyon yung claims na ito and umaabot po siya ng 19.9 billion sa year 2024. And kung kukunin pa po natin, may mga previous years pa na mga maliliit po na claims ay umabot siya ng 22 billion, Mr. Chair. Again, bulto ito or more than 99%, 98% of the claims nasa in process po ng PhilHealth ay nasa 2024 po. And for the information of everyone, Mr. Chair, marami po na-receive si PCO Ledesma na letter of commendation, including the PHA, dahil na-experiensyahan po nila, obserbahan po nila ang bilis ng pagbayad ng claims under sa leadership ni PCO Ledesma, Mr. Chair. Next slide, please.
Mr. Limsiaco, before you proceed to your presentation,
Yes po, ma'am.
I'm not a number person. So, the data you are presenting, the table below, are they representing also data from 2017 to 2024?
Mr. Chair, yes po, Honorable Loistro.
I believe that these are the data which are responsive to my question. The question, what year does 59.6 billion represent?
Yes po.
However, I could not tally the amount. Can you please illustrate to us where is 59.6 billion in your data below?
Yes po. As I mentioned kanina, Mr. Chair, Honorable Loistro, that 59.6 billion representing 2018 to 2024. 2018 to 2024 po na RTS.
Can you please cite the
and
amount?
denied. Kung sa 2018 to 2024, ang ating denied ay nasa 37.1 billion. Again, Mr. Chair, naisama namin yung 2017 po dito. That's the reason why naging 39.8 po siya. Now, ang sa RTS naman po, ang figure po natin sa RTS ng 2018 to 2024 ay 22.5 billion. Ang dito po ay nasa 23.5 because naisama po yung 2017, year 2017
Mr.
po.
Limsiaco, paano mo kaya palalabasin yung 59.6 billion from those figures? I tried adding
Miss-
the totals of RTH denied and in process, remove in process, or remove RTH and denied. Still, they do not tally with 59.6 billion. And this figure is indicated in your audited financial statement. So please illustrate to us.
Mr.
Nasaan
Chair,
po dyan yung 59.6 billion?
Mr. Chair, Honorable Luistro, ang 59.6 billion again composed of RTH and denied minus the year 2017. So kay 2018 to 2024 po yung datos po natin na ibigay last time. Kaya nagtotal lang siya ng 59.6 billion, Mr. Chair.
Mr. Limsiaco, kanina po tinanong ko kayo if the data below likewise represent the data for 2017 to 2024, similar to the table above. Sabi niyo po, yes.
Yes po.
You still confirm that?
Yes po. Kukunin lang po natin ang 2017 po. Kung titingnan po natin sa RTS po, may 119,000 po. Kung kukunin natin ang 2017
Wait, where's
po,
119,000?
RTS column po, Mr. Chair.
RTH?
Opo. Yung column po na yan, na 2017 po, kung tatanggalin po natin yan, ay 2018.
Sandali po, Mr. Limsiaco. Help us understand. Gusto ko po makita itong 59.6 billion because this amount is indicated in your audited financial statement. We are now discussing return to hospital, denied and in process. I believe that this should be reconciled to the data which are being presented right now.
Mr. Chair, Mr. Chair.
Yes, PCO Mandy.
Yeah. Thank you, Mr. Chair. Mr. Chair, I think there's a slight confusion, no, if I can clarify. No? Yes, Sir Net mentioned that the 59.8 is in the data. No? But ma'am, I think we should be clear that the 59.8 is from 2018 to 2024. The data in the screen includes 2017, ma'am. So, yes, it is correct. The data is all there. Pero ma'am, para hindi nakakalito, kailangan bawasan yung 2017. Dahil 2018 to 2024 lang po. Kaya atap po kayo nalilito kasi pati yung 2017 nadagdagan nyo po. No? Just wanted to clarify that po. Thank you, Mr. Chair.
Are you referring to the total amount of RTH, total amount of denied? Ganun po ba yun?
Mr. Chair, kung Luestro, tama po, ma'am. So that 59.6...
So which amount should I deduct from the total of 23 billion and the total of 39 billion to come up with 59.6 billion.
Mr. Chair, interjection, most respectfully.
Yes, Congressman Gutierrez.
Mr. Chair, just to clarify po, I think I understand the point ni Congresswoman Luistro and also the point of Senior Vice President Lim Shaco. So you're saying ito 2017 to 2024.
Yes po.
However, the cited data is 2018, but to 2024 also. But I agree po siguro po kasi if we take a look at the chart again, please, the table. So I think the tallying would be you get the total of yung denied plus yung total of the RTH, deduct 2017 RTH and deduct 2017 denied. Tama po. So if you'd follow that, 23,521,711,694 na total RTH plus the denied of 39,871,703,000 minus yung sa 2017 for the denied, which is 2,447,728, 447,728,348 minus also for 2017 na RTH 897,558,734. Tama po ba that would be the formula to deduct 2017? The total is still 60 billion po. It's close to 59.8, but you have to understand, pag hindi po nagtatali, it does not inspire confidence in the numbers po, no?
Mr. Chair, Congo Chairs, tama po, because again, as I mentioned, this data po, ang extraction date ay iba po siya, but nevertheless, pareho po yung prinsipyo po ng data po nito. Meaning, that 59.6 billion po natin, composed of RTS and composed of denied po. Now, magka-diferensya po siya ng konti na lang immaterial insignificant na po siya. But the composition
I'm
of...
sorry, I refuse to accept that is immaterial and insignificant. When you're presenting numbers, we assume them to be accurate.
Mr. Chair, I can give you the figure, Mr. Chair, in one table that represents already the 59.6 as presented in the
I think
previous
that would be
meeting.
better because that was the point of the good congresswoman from Batangas. She wanted a breakdown. Bakit? It took us, when we finally looked at the table, ngayon nyo lang po linalabas. I hope you understand the frustration po, no? I mean, we can't call this insignificant. When there is kahit minor differences po, it does not inspire confidence in the data presented to this committee.
Duly noted on your comment, Mr. Chair.
Thank you very much, Mr. Chair.
Just for the information of the committee, the exact amount showed in our report is 59.6 billion and not 59.8 billion. So if the Honorable Gutierrez was able to compute the total unpaid to 60 billion, then there's a difference of like 400 million.
Mr. Chair, Honorable Luistro, tama po, as I presented kanina, I provided you with the details of that 59.6 already as presented in the previous hearing. And then our data here ay na-ready po natin for presentation composed of 2017 to 2024 po. So more or less the composition again of 59.6 ay returned to hospital and denied claims po siya. So meaning if looking into the definition of is this payable of PhilHealth to the hospital, again the figure presented a while ago, the in-process claims, these are claims that we considered as talagang utang ng PhilHealth, meaning these are claims received by PhilHealth under process and it will be paid once it will complete the process of the claims processing and of course preparation of the check, Mr. Chair. Again, 19 billion out of that 22 billion ay coming from year 2024 and November, December claims po ito. Ang majority of this one ay November and December claims, Mr. Chair. Thank you po.
Can you please state once more which part are you acknowledging as unpaid or obligation?
Mr. Chair,
Para
Honorable-
kasing the way I heard it, you're trying to distinguish the nature of your obligation
Yes
with
po.
respect to RTH, denied, and in process. May nabanggit po ba kayo na which category do you really consider as obligation and which you do not consider as obligation?
Before you answer that, the Chair would like to recognize the Honorable Janet Garin, Vice Chairperson from the 1st District of Iloilo.
Hindi. 400.
Please respond to the query of Congresswoman Luistro.
Maraming salamat, Mr. Chair, Honorable Luistro. Again, on the part ng PhilHealth, Mr. Chair, we have here the in-process claims. These are claims na received ng korporasyon and pinaprocess po siya. And that's amounting to 22 billion from year 2017 up to year 2024 po. And specifically in the year 2024 po, we have 19.9 or 20 billion na in process po. So, meaning these are claims received ng korporasyon and pinoproseso ng ating mga regional offices hanggang mababayaran po siya. So ito po yung ang payable talaga o kaya claims na talagang inaasikaso ng corporation para mababayaran, Mr. Chair. As I mentioned kanina, the RTS and the denied claims, these are claims that we return to the hospital in the accumulation and from year 2017 hanggang sa 2024 po, Mr. Chair, Honorable Luistro. Thank you po.
Mr. Limsiaco, ito bang RTH na sinasabi mo, return to hospital? Ito ba'y may prescriptive period when they are supposed to comply with the insufficient requirements?
Mr. Chair, Honorable Luistro, ang ating prescriptive period, pag hindi nila na-comply yung 60 days, batay sa existing na palisiya po natin, ay pumapatak siya kaagad as denied claims na siya. Itong return to hospital naman, ito ay may mga kakulangan sa dokumento, kakulangan sa pagpirma ng mga dokumento galing sa ating mga healthcare facilities that na-submit po nila sa corporation po.
So did the PhilHealth bother to identify how many of those claims have prescribed already?
Mr. Chair, Honorable Luistro, on the part of the prescript 160 days at 60 days, mayroon po tayong analysis on this one. And mayroon akong slide dito po, pwede siguro papunta na tayo doon para makita na po natin ang rason.
I felt quite disturbed, Mr. Limsiaco, when you said that the obligation that you consider of PhilHealth is the one in process represented by the figure 19 million. I wish to believe that those in the RTH and the denied, for as long as the period has not prescribed yet, should be considered still as obligation of PhilHealth. In fact, I wish to ask further, after the remedies within the PhilHealth office, what other remedies are available to the hospital in the court, like the Court of Appeals and the Supreme Court? Because my humble submission is, for as long as all these remedies have not yet been exhausted, all these obligations remain as obligations of PhilHealth.
Mr. Chair, Honorable Luistro, again, the RTH and denied claims ay, particularly return to hospital muna tayo. These are claims at the position of the hospital. So nasa kanila po, dahil binalik ng corporation, dahil may kakulangan po siya, and we are expecting that within 60 days, maibalik siya sa corporation para ma-process po. Meaning, Mr. Chair, Honorable Luistro, if makikita po natin in the year 2017 down the line, ito po yung mga claims na naibalik pero hindi na po siya bumalik sa corporation, hindi po siya na-refile sa corporation, hindi po siya na-request for payment ng ating mga health facilities.
So you have a graph presentation as well about the RTH which were never returned to PhilHealth.
ito, Mr. Chair, Honorable Luistro, ito po siya yung mga datos po natin in terms of the RTS po, Mr. Chair, Honorable Luistro. Meaning we are encouraging them actually na ibalik dahil for compliance lang po to.
May we know the reason why they refuse or they fail to return to the corporation? The RTH which are supposed to be returned with compliance with respect to the requirements.
Mr. Chair, Honorable Luistro, may I request our expert in claims processing po. We have here Doc SVP Vargas.
I just find it strange, no? Kasi pera na to ng hospital eh. Coverage ng PhilHealth, all they need to do is to facilitate the claim and they will be able to collect. That is a collection and perhaps revenue of the hospital. What would stop them or discourage them to return the claim with complete requirements?
Quick interjection, Mr. Chair.
Congresswoman Garin.
Para lang po malinawan, yung return to hospital na claims, Mr. Chair, ibinalik sa hospital dahil may mga kulang na papel. And we are referring to 2017. Tama po?
Mr. Chair, Honorable Garin, hindi lang 2017 but hanggang 2024
Yes.
na
Pero
present na datos.
na-delineate ba natin magkano yung 2017 pabalik? Yun na yung sinabi mo.
Opo.
Okay. And from 2017 hanggang sa ngayon, hindi na sila, ano na lang natin, let's make it shorter. Let's say from 2019, hindi na sila nagbalik sa PhilHealth. Ganun ba?
Mr. Chair, Honorable Garin, yes po.
Okay. Pwede ba nating ma-delineate how much or how many hospitals in this pool that you are saying are government and ilan naman yung private? Puro ba pribado or puro ba gobyerno? Because that might, alam mo, we need to see the bigger picture.
Yes, Mr. Chair, Honorable Garin, we can calculate that one and come up with a report po.
At ilan dun yung bukas pa o nagsara na?
Yes po.
And do you also have a slide that will point us to ano yung mga kulang kaya siya binalik?
Yes po.
Yes.
We have, Mr. Chair, Honorable Garin, reason bakit siya na RTH.
Do you have a slide on that? Kasi
Yes po.
siguro para mapabilis tayo, let's move forward. Ano yung reasons ng RTH, or return to hospital? Ano yung reasons ng mga denial? Para makita natin kung doable ba o hindi ba.
Opo. Mayroon
If
po
the
tayo.
Honorable Luistro will be willing, okay, you have the slide now.
Mr. Chair, Honorable Garin, this is the top 10 reasons for return to hospital in current year 2024 po. So, other documentary required, may mga documents po na hiningi ang ating claims processor na isupport doon sa mga claims ng ating mga health facilities po. Of course, discrepancies sa ating nakikita po ng processor po natin.
Mr. Chair, can Mr. Lim Siaco expand more, define, ano po ang ibig sabihin ng discrepancy para po maintindihan?
Mr. Chair, Honorable Garin, may I request Doc Ispot to respond if allow po ng Chair.
Dr.
Pargas, Mr. Chair.
Vargas, you're recognized.
Thank you, Mr. Chair. Yun pong halimbawa po sa discrepancies would be, halimbawa po is, doon po sa isang form, yung age ng pasyente is 15, doon po sa kabilang form ay 17. Or halimbawa po, yun pong name, doon sa claim form 1 is different from that of the claim form 2. So, binabalik po yun para po maayos at maging pareho po yung data, Mr. Chair. As an example lang po.
If the Honorable Luiso is very much willing, Mr. Chair, just another quick interjection. Kasi kung kunyari minor lang, let's say dito sa isang form yung age ganito, dito sa isa yung age ganito, and makikita mo naman sa birth year, if these are really minor discrepancies, kasi minsan yung pasyente, pag tinanong mo, the informant, kunyari yung nanay ang kasama, o ilan yung mga anak mo, Apat, anong year ng birthday? Minsan birthday, hindi na nila matandaan eh. So these minor errors, maybe if we can be a little bit lenient on this will solve the problem. Kasi yung, syempre ibabalik mo, kailangan, yung hospital, baka hindi na matrace yung patient. We need to quantify. I am more concerned on the denied claims. Kasi pag denied claims, ang ibig sabihin nito is the possibility of fraud. Tama ba?
Mr. Chair, that's one of the reasons po for the denial of claims.
Sa denied claims nyo, how many percent yung fraud?
We don't have the data, Mr. Chair, but we can provide.
Yes, yes. So Mr. Chair, in addition to what the Honorable Luis is saying, kunyari konting discrepancy lang sa edad, kasi especially if the patient is not that educated, or minsan if the patient is already old, yung informant, kasi usually hindi pasyente ang ini-interview eh. Maybe we can be lenient on this, unless these are really major errors.
Mr. Chair.
Yes, Mr. Ledesma.
Thank you, Mr. Chair. Mr. Chair, just want to highlight, we hear you, Kong Janet, loud and clear. However, we're really trying to be as lenient as possible. But just want this honorable committee to note that we also have to deal with the other issues, especially like a very, very strict commission at COA, no? Talagang tinitignan nila yan, every little detail, or possible fraud, no? So yes, it's actually a very difficult balancing act for us because we hear all these stories of the hospitals closing, all that. But I think it might be good for the committee to note that we also have to deal with all of these other agencies, no? And ang daming, historically, PhilHealth, ang daming findings, ang daming negative. So we're also, we have to weigh everything, no? I just wanted to mention that, Mr. Chair. Thank you, Mr. Chair.
Quick interjection lang, Mr. Chair, if with the indulgence
Congressman
of...
Lee.
Well, for the information lang of the committee, Mr. Chair, I have filed the House bill giving amnesty to all this return to hospital, yung mga especially yung nabanggit ni Kong Green na maliliit, no? That's why itong House bill sana Congresswoman Green would pave the way, no? Kasi hindi lang po itong mga return to hospital, pati po yung mga denied claims because of late submission, no? I think meron din pong mga denied claim, and gusto ko nga itanong later on kung magkano ba to, no, yung mga denied claims because of late submissions of documents, no? Kasi within 60 days daw kailangan i-claim, no? And useless po itong pinag-uusapang benefits lahat kung itong mga hospitals na to ay lahat po, no, ayaw po serve sa mga PhilHealth members, no? So, yun lang po, Mr. Chair, no? I just would like to give the information to the committee na meron po akong final na ganong House bill, no, giving amnesty to these denied claims because of late submissions and return to hospital because of ito pong mga maliliit na mga discrepancies. Thank you, Mr. Chair.
Thank
Very,
you.
very quick interjection. One minute interjection, Mr.
Yes,
Chair.
with the indulgence of Congresswoman Luis.
Yeah.
Chair
Of
would like
course,
to
we
recognize
laud the
Congressman
proposal
Darin.
of the Honorable Lee, but coming from PhilHealth before, I think it is somehow untenable. Kasi it's okay to give an amnesty if the deficiency is, ang amnesty kasi is meron kang dapat bayaran. Tapos let's say sabihin natin, hindi mo na bayaran, nagkaroon ng mga penalties. Then you can give an amnesty. But in this case, it will be very difficult for PhilHealth to do that because they will now be the subject of a lot of cases. So yan ang magiging problema. I believe the solution is not an amnesty. The solution here is the IT system. Because if you have PhilHealth claims, andun yung birth year, pag hindi naman tugma ang birth date, ang age na nalagay, makakapture ng computer yan eh. So it's the IT system. That's the solution, not the amnesty. Maraming salamat, Mr. Chair.
Sorry, Mr. Chair, just very quick answer to the Honorable.
Yes, with the indulgence of Congresswoman
Yes.
Luis. Please proceed,
Yes,
Congressman Lee.
1 minute. Well, tama po kayo, Honorable Green. No, but ang tinitingnan ko kasi dito sa amnesty yung mga dati, no. Moving forward, of course, the solution is the IT system really, no. So ang tinitingnan ko kasi dito is yung mga denied claims to hospital which affects their services, no. Denied claims because of yun pong late submission, no, of documents, no. Kasi reimbursement daw is within 60 days should be reimbursed, no. Marami po tayong hospital na na-deny yung claim, automatically denied because of late submission, no. That is the information I gathered from the last meeting with the group of PHA, no, and PhilHealth also, no, have confirmed this during the last committee hearing on health, no. So that was one of the reason. And then yung isa pa, ito pong mga small discrepancy that you have mentioned nga, no, na kung maaari itong mga na-return to hospital na tama kayo, hindi na nila mahanap yung mga pasyente, no, hindi na nila matrace kung nasaan na to, no, paano nila ito aayusin, no. So ito po yung sentro, no, nung House Bill natin na yan, no, na sana mabigyan po itong mga hospital kasi totoo namang naibawas nila ito dun sa mga billing ng mga pasyente, no. So yun po ang sinesentro. But again, I submit that tama po kayo na yung pong IT ang talagang solution po dito. Yun lang po, Mr. Chair. Thank you.
Thank you.
Mr.
The chair would
Chair,
like to
very quick
recognize-
input to the denied claims, Mr. Chair. Ang problema kasi nung dati, maraming in-enroll na double or triple na enroll yung isang tao. And there were also situations where names were actually fictitious. So in fairness to the people manning this before, they had to deny the claims, especially if fictitious yung tao. Ibig sabihin, napaka-imposible na yung isang hospital ay magkaroon ng ganitong number of operations. So, granting an amnesty will actually mean relieving them of their responsibility. So, I believe that will apply, your proposal can be considered on RTH, but definitely, Mr. Chair, on denied claims, it will send a wrong signal. Kasi dapat alagaan natin, tama naman, marami ang benepisyo, but it should go to the real people and those in need. No fraudulent claims. Maraming salamat, Mr. Chair.
30 seconds, Mr. Chair.
Congressman,
Mr. Chair.
siguro pwede po natin i-tackle yan once your
Yes.
Mr. Chair,
bill is
hindi ba
filed. Yun na
pwede-
po yung tamang committee po
Mr.
na...
Chair.
Yes, the
Hindi
Vice...
po ba yung issue na yan pwedeng pag-usapan pag nandun na sa proper committee?
Ayun na po. Yun
Thank
na
you,
po
Mr.
yung-
Chair. I submit.
Nagtataas pa ako ng kamay kanina rito pero parang nagdidebate na tayo sa
Kaya
isang
nga po.
issue na hindi dapat nandito.
Yes.
Thank you, Mr. Chair. I submit, Mr.
Thank
Chair.
you. Please proceed, Congresswoman Luistro. But before you proceed, the Chair would like to recognize the Senior Vice Chairperson, the Honorable Bienvenido Abante, Senior from the 6th District of Manila. Please continue,
Can we
Congresswoman
please
Luistro.
put again on the screen the last slide? I will be concluding my interpellation on this slide, Mr. Chair. Going over the top 10 reasons for the cases of return to hospital, I observe that these are mostly documentary. Some are minor discrepancy. And I feel disturbed that the purpose of our universal health care is being defeated because of the issues of documentary requirements or minor discrepancies, when in fact, these claims are legitimate claims, I wish to believe. Now, I wish to ask PhilHealth, ano po bang countermeasures ang inyong ginawa, itinulong sa hospital to facilitate this RTH and in order to give what is due to the hospitals who have rendered the services already to the patients?
Mr. Chair.
Yes, PCEO Mandy.
I will reply, Mr. Chair, and then if I can allow COO Eli Santos to continue answering the query. Ma'am, we hear you loud and clear. What we are doing is we are encouraging, strongly encouraging, actually doing it, face-to-face reconciliation with the different hospitals and doctors, no? We're doing capacity building also. Kasi what we've found out historically after we have these face-to-face reconciliations, palaging very successful. Something good always comes out of the meeting, no? But aside from that, ma'am, to address your query, can I ask CEO to elaborate on the other measures we are taking po to address this?
Yes, Attorney Dino Santos.
Mr. Chairperson, Honorable Representative Luistro, in line with the recommendation earlier of Honorable Representative Garin, PhilHealth is also improving its system. So this system, Mr. Chairperson, Honorable Representative Listro, involves front-end evaluation, meaning the evaluation, the filtering itself is done in the front end. What we are doing right now, the process
You mean
is-
in the hospital?
Yes, Mr. Chairperson, meaning when PhilHealth fully implements that system, the evaluation now is front end. So in that case, all claims that enters PhilHealth will only be good claims, ready for processing and for payment.
And if that happens, there will be no more RTH.
That's correct, Mr.
Because
Chairperson.
no claim will be reaching the PhilHealth if the claim is not compliant with the requirements.
That's correct, Mr. Chairperson.
But I
Honorable
wish to
Representative-
hear also, anong pong assistance ang binibigay nyo sa hospital, sa patient, to avoid non-submission or non-referral of claims to PhilHealth? Kasi yung statement natin na no claims will be reaching the PhilHealth unless they are complete, compliant, medyo disadvantageous po yun sa part ng patient, sa part ng hospital, na baka kaya compliant lahat ng nakakarating sa inyo is because walang assistance naman na nare-receive ang patient at ang hospital to make their claims compliant.
Before I recognize you, the Chair would like to recognize the Honorable Robert Ace Barbers from the 2nd District of Surigao del Norte. Please continue, Attorney Santos.
Mr. Chairperson, Honorable Representative Luistro, at present, we have, in addition to the strategies mentioned by our beloved President and CEO, Sir Manny Ledesma, we also implement this program called Reach Out. So, Mr. Chairperson, Honorable Representative Luistro, we monitor the level of RTH and denied claims of each facility so that when it reaches a level above 3% or even 2%, Mr. Chairperson, we immediately contact the provider or the facility and inform them of that situation. So we reconcile data and immediately implement measures to prevent these from happening again. So we coordinate closely with the providers so that they will correct their practices, Mr. Chairperson. Probably what they need is more orientation, more training, more education on how to prepare and process claims from their end. So that again, the submitted claims will improve, Mr. Chairperson, Honorable Representative Luis.
And if I may add, Attorney Santos, I hope we can provide also a PhilHealth focal person, hospital-based, who can actually and physically assist both the hospital and the patient in accomplishing all your requirements. And for my second point, I hope there are still chances to simplify the requirements in the process. Kasi kamukha po nung sinabi kanina ni Honorable Garin, if the patient is not so educated, it might be very difficult for him or for her filling in all those forms. But if we can simplify them, kung tawagin ng iba, user-friendly ang form, madaling unawain, I think we will be able to avoid itong mga RTH or non-submission of claims. And for my last point, PhilHealth, kanina po may nabanggit kayo, out of the total number of RTH, a significant number were never returned anymore to PhilHealth. May I know the percentage?
Mr. Chair, can I address the question?
Yes, Sir Mandy.
Thank you. Thank you, Mr. Chair. Ma'am, before Sir Renet gives you the figure, no, I just wanted to add to your earlier query. We have what's called PhilHealth Cares. So we have a number of personnel that are nationwide of more than 500 people.
Are they hospital-based?
Who are here to assist all of those in the hospitals, to walk them through and to help them on anything and everything.
Hospital-based po ba sila?
Hospital-based po. And we are planning to, marami na po yan, more than 500, pero i-expand pa namin yan because we understand po the importance of...
Does it include private hospitals?
Yes po. Kasama pong private hospitals po.
I hope you can provide to all, average to big,
Yes po.
both private and government hospitals.
Yes po. We realize the importance po. And like I said, although we currently have more than 500, we will expand it even more
And
po.
I hope you can come up also with the necessary remedy with respect to small hospitals if the number of your field personnel are not sufficient anymore to cater the same service to small hospitals, especially in the provinces.
Yes po. Noted po.
Balikan ko po, Mr. Ledesma, yung question ko. Sabi niyo po kanina, out of the total number of RTH, marami ang hindi na talaga ibinalik sa PhilHealth. May I know the percentage?
Mr. Chair, Honorable Representative Luistro, the figure that we presented kanina, these are mga claims, RTS claims na hindi bumalik sa PhilHealth. Because once it will be refiled, it will now be received by the corporation and will be, it can be nasa in process siya or nasa paid po siya para hindi magdo-double counting po tayo. Meaning,
No, the context of what I heard kanina, hindi na ibinalik sa PhilHealth dahil hindi na ipinursu ang compliance with the requirements. How many of the total number of RTH were not actually returned anymore? Please do not change the context. I understand your point.
Mr. Chair, Honorable Representative Luestro, again, yung figure na pinapakita natin kanina, ito po yung numero ng mga RTH claims na hindi bumalik sa PhilHealth. Because pag ang RTH claims po na ibalik po sa corporation, it will be
In process.
in process pag hindi pa siya bayad or nasa paid na po siya kung nababayaran po natin ng claims para po hindi po magdo-double counting po yung claims po natin.
If that is the case, then that leads me to my next question. Are there cases of RTH pinalik sa hospital, kulang ang requirements, pero hindi na bumalik sa inyo?
Mr. Chair, Honorable Representative Luistro, ito po yung numero na hindi
I
na talaga
understand.
bumalik sa
Please be
PhilHealth.
responsive to my question, Mr. Limsiaco. I understand you were saying na yung figure na present nyo for RTH ay napupunta either in process or paid already. That is very clear to me. But the context of my question is, suppose the reason for the RTH is kulang ang requirements. Reason why you return the claim to the hospital. Mayroon po bang ganyang mga cases ang PhilHealth claim? I believe that the question is answerable by yes or no, Mr. Limsiaco.
Mr. Chair, Honorable Luistro, this figure 2.174 million claims under RTS as presented earlier, ito ang claims na hindi na bumalik sa PhilHealth. Hindi na refile na sa PhilHealth.
Alam mo,
Meaning,
Mr.
sa
Limsiaco,
kanila na po.
medyo confusing yung statement mo kanina. You even asked us to add up RTH and denied. And now you're giving us the impression na itong RTH either dininay, napunta yung figure sa denied. Either in process, napunta yung figure sa in process. Or nabayaran, napunta yung figure doon sa paid. Lalo tayong mawawala doon sa 59.6 billion na ipinapatali namin kanina sa PhilHealth. Are you following me, Mr. Limsiaco?
Mr. Chair, Honorable Luistro, as discuss kanina po as presented po, again, itong figure na napakita po natin dito, these are still return to hospital claims na hindi na bumalik sa corporation, meaning hindi na po siya na-refiled sa PhilHealth as of December 31, 2024 po.
Can we bring back this slide?
Yes po. Please.
If you're saying that, Mr. Lemshaco, then that is my question actually, no? Pakibalik po yung RTH, denied, and in process na slide. You just stated, Mr. Lemshaco, na yung RTH mo, correct me if I'm wrong, hindi na talaga binalik at pre-process sa PhilHealth. Do you confirm that?
Yes, Mr. Chair, Honorable Loistro.
If you're saying hindi na binalik at pre-process sa PhilHealth, then why? Earlier you said, itong RTH, kapag binalik sa ospital, napupunta sa in-process.
Okay.
Or kapag nabayaran na, napupunta sa paid. So which is which?
Mr. Chair, Honorable Loistro, as of December 31, 2024, nasa RTS po siya.
The 4
Binalik-
billion 499 million, the RTH.
Yes
That's
po.
2024.
2024 po. As of December 31, RTS po siya. Now, once the hospital will submit the compliance to PhilHealth, pagdating ng January 2025, that claims, pag-extract po natin, pagkuha natin ng datos ng January 2025, ma-receive ng korporasyon, hindi na siya ma-reflect as part of the return to hospital, but it will be in process po siya. Dahil yan ay may compliance na on the requirement that PhilHealth requested the hospital to submit, Mr. Chair.
Yes, I'm
Honorable
following
po.
you, Mr. Limshaco.
Yes po.
So out of the total of 4,499,000, suppose hindi lahat bumalik sa hospital. Suppose ang bumalik sa hospital is only 4 billion. Where will I see the remaining 499 million? Naka-RTH pa rin. Di ba?
Nasa RTS po siya.
By
Mr.
January
Chair.
2025, the succeeding month after December 2024, ang bumalik sa hospital ay 4 billion lang, nalipat yung 4 billion dun sa in-process, yung 499 million na hindi bumalik, I will be seeing that in January 2025 data. Kasi RTH pa rin ang status niya. Tama?
Tama po.
So, I wish to be confirmed. May mga cases ba talaga, like the one I illustrated, totally hindi na bumalik? And what is the percentage of those cases out of the total number of RTH?
Mr. Chair.
Dr. Pargas.
Yes, Honorable Luistro, I think what SVP Limsiaco said that the first condition is actually the process, wherein we evaluate the claims. If the claims is okay, then it will be paid. Otherwise, it will be returned to the hospital or otherwise denied.
O
And
kaya
then-
nga,
Opo.
I perfectly understand what Mr. Limshaco said, Dr. Pargas, no? Ang tinatanong ko lang, in actual, mayroon ba talagang hindi na bumabalik?
Meron po, and actually...
Ano
I-
pong
sorry.
percentage?
According to the statement of SVP Limsiaco earlier, those numbers are the numbers that were not actually returned to us. They were returned to the hospital but were not refiled.
That 4 billion? 499 million?
I am confirming with the statement of SVP Limsiaco, and he said yes.
That is huge. That is huge. And can you please cite the reason why? Ang laking pera nito para hindi balikan ng mga hospital. Di ba?
Mr. Chair, Honorable Luis.
We are on the same page, Mr.
Yes.
Limsiaco.
Yes po.
As of December 2024, the total of return to hospital is 4,499,000,000. And to laymanize it, ito'y mga ibinalik sa hospital, to this date, hindi pinaprocess sa PhilHealth. Now, what are the reasons bakit hindi sila nagko-comply, hindi nila binabalik sa PhilHealth para makaklaim sila?
Yes po.
Paano sila makakaklaim kung hindi nila aayusin yung kulang at ibabalik sa PhilHealth?
Maraming salamat po, Mr. Chair, Honorable Luistro. As mentioned by PCO Ledesma a while ago, we are engaging the hospital for the claims reconciliation. Now, dito po, inahanap yung mga claims po natin. Dito po nalalaman kung saan yung mga claims. And of course, dito rin po, instances wherein the hospital, nalalaman niya na may mga claims pala na hindi binalik kay PhilHealth. And dito po, there are some hospital owners na nagagalit sa harap ng PhilHealth representative, bakit hindi nyo binalik sa PhilHealth ang claims na ito? Kaya po, that's the project of PhilHealth in the year 2024 po that we continue right now because nalalaman po ng hospital owners during that discussion, during that confirmation, na may mga claims pala na na-denied na hindi naibalik sa PhilHealth. Now, yes sir.
Sorry. Mr. Chair, if I... actually, ma'am, we hear you. The number is very big. Like you said, no, it's a big number. But maybe to put it in context, if you don't mind, Mr. Chair, this honorable committee, the percentage of total claims of RTH is less than 2%. So I know the number is big, ma'am, but if you look at it in percentage terms, that's less po than 2%. But at the same time, ma'am, we hear you.
Can you say it again, Mr. Ledesma?
Because you're saying the RTH number, it's a very huge number. I'm not denying that, ma'am, but I also want to say, just to put things into context, the percentage of total claims of RTH is less than 2%. So the number you mentioned, ma'am, is less than 2% of total claims.
Nonetheless, that's still a huge amount.
Yes, agree, ma'am. We agree.
I just want to share my apprehension in conclusion of my interpellation, Mr. Chair. We have received reports that because of delay in the payment of claims, some hospitals have ceased in continuing the certain services of the same. Some fully closed already. I am apprehensive that perhaps one of the reasons kung bakit hindi sila bumabalik is because the hospital shut down already. And for us to be enlightened, Mr. Limsiaco, I hope you can give us the details of that total amount of RTH. At least for one hospital, I can personally share with you that there is one hospital in my hometown, Mabini, Batangas. I hope I am wrong, but you can verify. I used to be one of the stockholders. The reason why they shut down is because of the delay in the payment of PhilHealth. That's from the point of view of one of the stockholders. Sana wala nang ibang hospital na ganito. Because you know what? That is the lone private hospital in my hometown. And when it closed, it really affected the healthcare system in my hometown. No? And it is hard to understand why the PhilHealth, the partner of the government, in implementing this mandate on healthcare system, is the reason why the hospital institutions will be closing. Thank you, Mr. Chair. That ends my interpellation.
Thank you. Maybe we can request the DOH to provide us with the list of hospitals na mga nag-shutdown due to same reason na sinasabi po ni Congresswoman Luistro.
Mr. Chair,
Yes, the Vice Chairman Abante is right.
payment of PhilHealth to hospitals. I would like to find out what the real problem is. Because look, we could be able to investigate that today. The problem is still there. Oo. Next year, budget hearing na naman. Oo. Ngayong year, budget hearing na naman ng August. Yun na naman ang pag-uusapan. So we would like to find out what the real problem is when you have all the money. Then you have all the money. Ang iniisip ko, are the minds of the PhilHealth officers are all business, or is PhilHealth? PhilHealth is not just business. PhilHealth is healthcare. So we would like to find out what the real problem is. Why until now, some hospitals are not being paid, and that the payment is delayed. Mr. President.
Thank you, Mr. Chair. I think there are a number of reasons, no, Mr. Chair, on honorable committee, no. The first is, I entered PhilHealth around 2.5 years ago, no, and what I found out immediately was, number one, there's a shortage of personnel across the board on all departments. So, Mr. Chair, kulang po.
Personnel saan? Sa inyo o sa hospital?
Sa PhilHealth po.
Sa PhilHealth?
Sa PhilHealth po. So, for example po, kulang po kami ng mga abogado, kulang po kami ng mga finance people, kulang kami ng mga... That's why we have a pending reorg with GCG, which is about to be approved and implemented, wherein we will increase our personnel po by around 30%, no? Ang current personnel ng PhilHealth ngayon, we're around 10,000 employees, no? So may increase yan by 30% po. That's the first. Second po, yung
10,000 employees, lahat na yan, from mula sa presidente hanggang sa baba, o yun lang mga sa baba?
Hindi, lahat na yan po, all 17, we cover 17 regions po.
How many lawyers do you have?
I think, estimate number of lawyers, maybe around 40. All over the regions, more than 50 lawyers po.
How many doctors do you have?
Sa personnel po?
Yes.
Doc-ish? Same po, mga over 50 doctors po, all over the region.
Your offices, do you have separate offices from the hospitals, or your offices are in the hospitals themselves?
We have separate offices po.
Separate hospitals?
Yes po.
Okay,
Yes,
in
Mr.
every region?
Yes po.
Okay, go ahead, continue on, Mr.
So
Chair.
po, another reason po is yung digitalization po ng PhilHealth medyo backward, no? That's why that's one of the advocacies, and talagang tinutulak po kami ni beloved President Marcos, no, to focus on our digitalization, no. Actually, our head of IT, Ma'am Jovi, can update this honorable committee on how far we are going and how fast we are going on our digitalization process. Sir, once that is, Mr. Chair, excuse me, once our digitalization process moves forward, a lot of these issues, especially the payments of claims to hospitals, will be addressed, no? And, excuse me, Mr. Chair, I'd like to think also, like I mentioned earlier, we have improved immensely, no, in our payments of claims to hospitals. Now we average almost more than 15 billion a month in payments, and for the 1 year period, we've increased by more than almost 30 to 35 billion increase in payments of claims to hospitals. So we still have long ways to go, Mr. Chair, pero we can see we are really improving substantially, no? And as Sir Net mentioned earlier, we get a lot of commendations from the different hospitals associations that they are happy with the improvement and the acceleration of our payments of claims to hospitals. Maraming salamat po.
But still, okay, Mr. Chair, we would like to commend you on the improvements, no? But as you have mentioned, there's still a lot to do, di ba? So let me ask the IT about the digitalization of PhilHealth. Find out, kasi digitalization not only speed up the payment, but also it actually checks on the corruption, di ba? So let me ask about the digitalization.
Mr. Chair, may I respond po?
Yes, may I know please identify yourself.
Yeah, I'm Jovi Argona, the SVP.
Jovi
Aragona po.
Aragona, you're
Yes po.
recognized. Okay.
I would like to talk about the digitalization initiative as well as the roadmap of PhilHealth. So right now we have we called legacy systems Some are automated but not fully, evidence from the fact that there are documents still being submitted. For the legacy systems, we have actually identified 4 of that major system. Yung po yung tinatawag na health insurance system, the automating of the core processes po ng PhilHealth, everything about the processes, accreditation, membership, contribution, collection. Then we have also the business intelligence for our data analytics. We have the internal system support services management information system. And as far as the requirement of the UHC, meron pong National Health Data Repository. Now, the strategy for the integrated health insurance systems actually focuses on the following strategies. So meron po tayong tinatawag na process streamlining of the processes operation. Because if we talk of IT, we don't automate what we have in the existing, but there will be some process automation in that. Number 2, we have client-centric applications wherein we have notification and information immediately after a transaction is conducted in PhilHealth, reduction or totally elimination of all the paper transactions in PhilHealth. Yun po yung naka-timeline sa aming automation. Introduction of technological advancements like artificial intelligence and machine learning, and a lot more. So ang status po ngayon, we are in the stage of outsourcing via managed services yung 4 na systems na mention, no, na sinabi ko po, while we are maintaining po yung legacy system. Last year po, we bidded out these projects. Yung health insurance system po, we have 3 bid fail, pero ang status po ngayon, ika-4th bidding na po namin. So there's 1 who passed the technical and financial evaluation already, and hopefully we will come into negotiation and post-qualification. For the business intelligence system, ito po yung mga data analytics na pwede nating maran yung artificial intelligence. So nagkaroon po tayo ng bid fail, no, last time sa support services. Pero ngayon, meron isa pero ongoing technical evaluation. And then yung ating National Health Data Repository, na bid out last year, na bid fail naman ng 1 time, and then it will have to be rebidded out still this year. So, hinihintay po namin, ang timeline po namin, since may mga bidded na projects last year na nag-fail, first quarter of this year, we are pursuing rebidding, negotiation, no, and everything. Second quarter and third quarter of this year, the development po of the projects, no, via those firm na ma-outsource natin. And then beginning fourth quarter of this year, we shall be doing modular deployment. Until by 2016, marireplace na po natin yung ating mga legacy system. By modular deployment, together with the assistance also of the DICT, we shall be migrating na po to the new systems that we have. So those po yung mga key strategies and mechanisms that we have lined up po for our, what we call the Integrated Health Insurance Digital Transformation System. So it will not be totally internal who will be doing it, but we are going to outsource it via the managed services. And technology-wise, so again, example of the technology adoption, we're moving into the cloud implementation, no, and deployment also. Managed services because we need key expert to be introduced, no, and to help po the internal staff of PhilHealth. So those are among po the strategies and mechanisms of the Integrated Health Insurance Digital Transformation System.
Mr. Chairman. Yes, with the indulgence of Congressman Suwan, the Honorable Barbers, Ace Barbers, you are recognized.
Just a short question kasi just following the statement made by Ms. With regards to the digitalization of the whole system, correct? Yung pong cyber security nung I remember that if it's not last year or 2023, there was a hacking that happened in the system of PhilHealth, di ba? What have you done after the incident occurred?
Sir, Madam, After po the Medusa, that's called the Medusa attack, no? Although we are strengthening already the systems, more strengthening happened, and there are different tools, mechanisms that are already lined up for procurement, like the bigger managed security operations center. So we will be procuring and having that for this year. That's one. And then the total data encryption of all the systems and all the data that we have. So we have an office, which is the Information Security Department, which is looking into this one. And they have actually presented the Managed Security Operations Center, which this is a big amount actually. And together with that, and together with the innovative systems that we have, so we have, or we shall be part of those should be part of the digital transformation.
So
Security is a prime consideration, sir. Thank you.
So we will be assured that there will be no more data breach or hacking that will happen in the system of the PhilHealth.
That's the target, sir. That the target in terms of the performance with those innovations that we will be introducing.
Oh, napaka-importante po niyan kasi yung data niyan can be used for other cyber crimes. In fact, it's not just the PhilHealth who's a victim of these hacking. A lot of government agencies which store data related to information to our people have also been breached and have also been hacked. So, dapat pinakamahigpit na sistema ang ating i-implement, no, protect all the data that is being stored in your system. Kasi yun, all walks of life, all members. Practically, you're talking of a significant percentage of the population. So, I think it's not just one of those strategies to PhilHealth. It should be the strategy to protect this data from ano. And if this would entail cost, ang dami nyo naman pera eh. So, kayang-kaya nyo yan. Thank you, Mr. Chair. Thank you, Congressman
Thank you.
Suwan, too.
The Chair would like to recognize the Honorable Warden Suwan.
Thank you, Mr. Chair. Before we proceed, may I just manifest that we should remember that this inquiry is not just about systems, policies, or even institutions. It's about lives, including the sick and vulnerable who are relying totally on our hospitals, and the nurses and doctors who work tirelessly on their behalf. And of course, the dignity of every Filipino who deserves a health system that works. And so I have a few questions regarding the effects of delayed payments by PhilHealth as to our hospitals. And I hope PhilHealth would be able to answer these. Sir, how much on average do you think is the revenue lost by hospitals due to delayed payments from PhilHealth?
Mr.
Sino
Chair,
po sasagot? Yes, PCE Omandi.
can I ask Sir Net to address the question?
Mr. Chair.
Mr. Lim Siaco, you're
Yes po,
recognized.
Mr. Chair. Honorable Suwan, we do not have the data as of this time, Mr. Chair, on the study, on the loss of the hospital for the delayed payment. What we have, Mr. Chair, as presented kanina, that in the year 2024, upon the instruction of PCO Ledesma, somehow PhilHealth finds ways to address this one, and again, as presented, 23.35 days turnaround time posted or recorded in the year 2024 po, Honorable Suwan, sir.
So you're saying that there's only 23 days delayed? Or
That's the number of days that we
That-
are processing the claims, Honorable Chair, Honorable Suwan, sir.
But do you consider those, for example, those returned to hospitals as delayed payments?
Mr. Chair, Honorable Suwan, these are claims returned to hospital because of the claims defect or may mga kailangan i-comply. Now, these are claims in the hospital that we are expecting them to return to PhilHealth within 60 days so that PhilHealth can process immediately. we are always expecting or informing the hospital that they should submit these claims to us so that we can process and pay on these particular claims, Mr. Chair, Honorable Suwan.
Yes, Mr. Limsiaco, but that already has an effect on the revenue of our hospitals. Is that correct?
Yes, Mr. Chair, we understand that one very well, Mr. Chair, and it's now the instruction of PCEO to further fast-track the claims processing and look for ways in order for us to address this one. Fast-track the claims processing, reduce the turnaround time, reduce the RTS, and reduce the denied, meaning strengthen the information drive, capability building sa ating mga hospital, and of course, with the relationship of PhilHealth and the Philippine Hospital Association, and of course, we have the Philippine Private Association and other organization. Ito po ay pinag-uusapan and ina-address po ng korporasyon in collaboration with our major stakeholders of the corporation po, Mr. Chair, Honorable Suwan.
Mr. Limsiaco, do you think there are other financial effects on the hospitals because they were not able to process the return to hospitals, which they were supposed to return to you after they were denied due to the grounds?
Yes, Mr. Chair, Honorable Suwan, we understand that one very well. That's the reason why we are requesting the hospital, Mr. Chair, Honorable Suwan, two things po. To submit the claims quality, meaning as much as possible compliant to the requirement, and pangalawa, mas mabilis po. As the hospital has also 60 days, we are encouraging them to submit the claims in less number of days so that pagdating sa PhilHealth, maipaprocess din po natin ng mabilis, Mr. Chair, Honorable Suwan, sir.
Do you think that smaller or rural hospitals are more affected compared to hospitals in larger cities due to these return to hospitals or delayed payments?
Mr. Chair, the way we see it, tama po kayo. As ang ating mga big hospital has the information system, then may mga tao sila to process the claims and make sure that the submitted claims are free, more or less free of defects, Mr. Chair. Of course, that's the target of the corporation right now, particularly our LG Hospital, Provincial District Hospital, Mr. Chair, that kailangan po natin matulungan and mapapaayos po yung claim submission po sa atin. Again, on the part of PhilHealth, the submission of claims is automated na rin po. In other words, through system na rin siya. That's the reason why somehow na-address yung mga submission ng claims natin na dati nakamano-mano pa ang pagpapadala sa korporasyon po. Mr. Chair, Honorable Suwan, sir.
So you're confirming that the return to hospitals and those that we consider as delayed payments really have a huge impact on those in rural hospitals?
Yes, Mr. Chair, Honorable Suwan, sir.
And especially in rural areas where the nearest hospital may be hours away. So what does a financial crisis mean for the availability of basic medical services for such hospitals?
Mr. Chair, Honorable Suwan, of course, it will redound to, even though mayroon silang budget, sabihin natin, district hospital, provincial hospital sa probinsya, but of course, the money coming from PhilHealth is very critical as well in their operation as mas malaking huge part of their cash flow ay manggagaling sa corporation po. Kaya klaro po sa amin, sa corporation po, with the instruction of PCEO, na babayaran po natin ang claims ng mas mabilis at saka maayos po yung claims processing po natin. Mr. Chair, Honorable Suwan.
So you understand that the payment of claims to rural hospitals is very important?
Yes po, very clear po on the part of PhilHealth, Mr. Chair, Honorable Suwan, sir.
Do you have any idea how many rural hospitals are on the brink of closure because of this issue?
Mr. Chair,
Do you have
Honorable
any
Suwan,
data?
we do not have that information right now, Mr. Chair, Honorable Suwan, sir.
Mr. Chair, do we have any representative from the associations of hospitals? I think they may have more information or data regarding these questions that I am asking.
COMSEC, do we have any representative? Except from the DOH,
Non-invited, Your Honor.
not invited.
Mr. Chair, may I request that we invite someone from the Association of Hospitals so that we may be able to determine the real effect of return to hospital and late payments of PhilHealth as to the operations of these hospitals.
COMSEC, please take note of the manifestation of the Honorable Suwan.
Noted, Chair.
Mr. Chair. Mr. Chair.
Yes, PCO
Yes.
Ledesma.
Yeah. We like the very, very good suggestion of Your Honor. At the same time, Mr. Chair, we will try to furnish the data ourselves on the percentage of rural hospitals. And as soon as we put it together, I'm confident we'll be able to get the data. We will submit it to your honorable committee, Mr. Chair. Thank you.
Thank you, PCSO. Another question. What percentage of a hospital's budget relies on reimbursements from PhilHealth? And how does this dependency impact their ability to provide continuous services?
Mr. Chair, can I address the question?
Yes, please.
Apologies, sir. Mr. Chair, I don't think we have that data. Doc Ish, do we have the data? I don't think we have that data available, Mr. Chair.
Yes, all the more importance for us to have.
If I may, mag-interject lang po ako ng tanong. I've noticed since 2017, medyo marami po yata yung counts ng RTH. 2017, we have 119,286. 2018, 277,499, so forth and so on, until 2024, 316,557. Now, my question is, ano po ang ginagawa ninyo para maiwasan po natin itong RTH? Considering na alam naman po natin na napakahirap po ng sitwasyon, lalong-lalo na po ng binabanggit ni Congressman Suwan, na yung mga nasa rural halos nagsasara na because of this. Ano pong mga remedies na ginagawa ninyo para maiwasan itong RTH?
Mr. Chair, ako muna. Thank you for the question, Mr. Chair. No? It's a very, very valid, interesting question. First of all, Mr. Chair, once our digitalization improves, vastly improves, most of these issues, turnaround time, RTH, and I, will be addressed, no? Including fraudulent claims. So we are working as fast as we can on that, no? Led by Ma'am Jovi Aragona of our IT, our head of IT, no? And we feel that once we get these things moving fast, it will, the effects will be immediately improved, no? There are even some companies who are presenting the AI, artificial intelligence, on claims payments. No, again, once we can start using these, I think the effect will be felt immediately. No, and talagang mag-improve lahat yan. No, turnaround time, RTH, denied, all of these. No, number of claims processing, fraudulent claims, all of them.
Sir, I think computerization is being implemented already in some other hospitals. So doon po sa mga iba, tingin ko, po pwedeng connect na lang po sa inyo. Tama po ba yun?
Correct, sir.
Okay.
Mr.
But
Chair.
in some other hospitals na medyo backward pa, let's say sa mga rural, sa mga far-flung areas, if I may recommend, pwede naman tayo magpalagay ng tao dun or mag-training tayo. Para hindi na po dadalhin sa inyo. Lahat po ng mga dinadala sa inyo, dapat na-check na verify na ayos na. So, may iwasan natin yung RTH. Kasi na-inspection na
Agree, Mr. Chair. In fact, as I mentioned earlier, we are sinabi ni Kong Janet yung PhilHealth Cares. So we have more than 500 already, and dadamihan pa namin po yan. We hear you loud and clear,
Kasi
Mr.
po
Chair.
pwede naman po i-prioritize natin yung mga hospital na, let's say, alam natin na mga nasa far-flung areas. So doon talaga i-prioritize. Kasi sa Metro Manila, halos lahat naman po yata yung mga hospital dito nasa computer na kailangan lang siguro i-connect doon sa like what you've said, more than 2 years na po kayo, but this problem has been going on since 2017 or mas matagal pa.
Even further.
So,
Yes, Mr.
for 8 years, medyo ang tagal na po yata na itong problema to. And yet, hanggang ngayon, di pa nasusolusyonan. Samantalang simpleng-simple lang. Kung kulang kayo sa tao, mag-training kayo ng mga staff ng ospital para i-check lahat yung mga pinipilapan. 2 lang ang pipilapan, may Tagalog, may English. Pag marunong mag-Tagalog, pag hindi makaintindi ng English, Tagalog na forms, yun po ang pipilapan. Pag medyo maalam naman po, English. So, ganun lang naman po kasimple yun eh. Hindi ko po alam kung ba't kailangan pa natin ipa-complicate.
Yes, Mr. Chair.
Tama po ba yun?
Yes, Mr. Chair. Correct, Mr. Chair. In fact, Mr. Chair, if I may add, what you mentioned, as I mentioned earlier, we're doing a lot of capacity training and capacity building aside from increasing the number of PhilHealth cares people. So you hit it on the dot, Mr. Chair. Gagawin po namin yan. We will even move more aggressively on that, Mr. Chair.
Yes, kasi sa totoo lang, ang laki po na itong count natin, kahit sinasabi po natin 2% lang, but still, malaki pa rin po. At siguro mostly po dito, baka mga nasa far-flung areas.
Noted, Mr. Chair.
Okay. Please,
Thank you, Mr. Chair.
please continue, Congressman Suwan.
Thank you, Mr. Chair. I still have other questions as to the effect of the RTH and other delayed payments and even denied payments as to all kinds of hospitals, but I think they would be better answered by the representative of the Association of Hospitals. So, may I move to my next set of questions, which are addressed to the representative of the Department of Health? ASEC, I think the situation is getting untenable. Hospitals are struggling to keep their doors open and healthcare workers are unpaid. And some patients are even being turned away. So how has the DOH stepped up to help these hospitals and even these patients? What measures have you taken in order to address this situation?
Asek Domingo, you are recognized.
Thank you, Mr. Chair and Honorable Suan. In the health financing of our healthcare, sa pagbayad po ng singil ng mga ospital sa pasyente, ayon po sa ating datos, simula 2014 hanggang 2023, ang pinanggagalingan ng bayad ay ang mga sumusunod. Yung out-of-pocket, meaning yung ating sariling kabayaran, yung national government, which is the DOH, ang PhilHealth po, ang National Health Insurance Agency, ang local government, tapos ang mga health maintenance organizations or private healthcare institutions. Sa pinakahuling datos na available, 2023, ang binabayaran po ng ating mga kababayan ay sa bawat ₱100, 44 pesos. Ang binabayaran po ng Department of Health ay 23 pesos sa bawat ₱100 or 23%. Ang binabayaran po ng PhilHealth ay 10 pesos, 10%. Ang binabayaran ng mga local governments ay 9 pesos. At ang binabayaran po ng mga HMOs ay 13 pesos. Para masagot po ang katanungan ng ating butihing Congressman na Suan, yung tulong po ng DOH ay nasa mga sumusunod. Una po yung tinatawag na quantified free service. Madali pong makuha ang no balance billing sa DOH kasi pag sinabi po ng ospital, lalo na po sa mga ward nito na hindi nasisingilin yung pasyente, nakakarga po yun sa budget ng ospital. Ang binibigay po ng Kongreso, salamat po sa Kongreso, yung ating GAA for the hospitals. Kung kulang naman po yun, pwede namin siyang punan ng ating tinatawag ngayon na medical assistance for indigent and financially incapacitated patients. At meron rin pong tulong kung yari pag sa mga local government hospitals, yung kanila po namang mga local government budgets. Depende ho sa local government. Pag mataas po yung antas ng syudad or munisipyo, nakakayanan po nilang punan yung bill. Tapos sa ating pong mga may kaya, yung mga middle class pataas na nakakabili ng HMO, yun po yung tinasabing 13 pesos out of 100. So matotal, Mr. Chair, Congressman, ang tulong po ng DOH ay dun sa aming budget na galing rin po sa Kongreso, ang GAA line item, ang MAIFIP na galing rin po sa Kongreso, Tapos, syempre, meron rin po naman tayong kinukuha sa PhilHealth. Yun nga lang ho, sa ngayon, yung performance, kailangan pataasin kasi yung pinakahuling datos, 10% lamang po.
Thank you. Are these measures that you have just mentioned, do they apply to private hospitals also, or are they only applicable to public hospitals?
Yun pong, Mr. Chair, Honorable Suan, the share of the DOH may not be applicable to the private hospitals kasi wala naman po silang direct access sa ating line item budget. They are private entities. But because of the special provisions of the General Appropriations Act allowing for a memorandum of agreement between the DOH and private hospitals, yun pong maifip or maip na itatawid po natin sa private. Basta po sila ay mag-agree sa memorandum of agreement ng DOH.
Okay. So from the perspective of the Department of Health, what do you think are the most glaring failures in PhilHealth's reimbursement system?
Thank you, Mr. Chair, Honorable Suan. Yun pong reimbursement system, actually, I was keenly listening to your Honor's line of questions, and we do agree na malaki yung financial impact kapag hindi nakabayad ka agad. There is cost of money. So kahit sabihin natin na maliit na hospital, and I'm quickly just keying up PhilHealth data, mula po sa stats and charts ng PhilHealth, there are 332 level 1 government hospitals, 449 private level 1 hospitals. Ito po yata yung hinahanap ng Your Honor kanina na data. Mula rin po ito sa website ng PhilHealth, Stats and Charts as of June 30, 2024. Having said that po, the larger hospitals, the tertiary ones, especially the urban large hospitals, merong yung revolving capital, if I may use the term loosely. So kaya nilang maghanap ng financing and they do charge a lot of out-of-pocket, kaya nagfo-float sila. Pero kung yari...
What do you mean by out-of-pocket and then nagfo-float?
Kaya po nilang mag-antay na hindi sila mabayaran agad ng PhilHealth kasi yung mga pasyente nila kaya magbayad.
Okay.
So doon sila kumukuha ng main income source nila. Pero para sa isang maliit na rural hospital, kabilang dun sa 332 na accredited ng PhilHealth, level 1 government hospitals.
What do you mean by level 1 government hospitals? Are these the lowest ranked hospitals?
Yes, Mr. Chair, Honorable Suan, sa licensing system kasi natin, yung pinaka-basic na hospital is level 1. Yung pinaka-mataas, I'm sorry, there is an infirmary pa pala, if I may supplement the data. Level 1 hospitals are 332. Yung mas mababa pa is yung infirmary, 337. So if we add 332 plus 337, that's roughly 669. Yun yung sabihin na nating mga rural na hospitals. So yun po yung pinakamababa na level, Mr. Chair, Honorable Suan. And to answer the question, a lot of them rely on, shall we say, mga routine na procedures and cases. Like example, nagpapaanak. So yung maternity care package, kung mabilis yung bayad doon, nabubuhay po sila. Sa private sector naman...
Mabilis ang bayad ng PhilHealth?
Opo, ng PhilHealth. Kasi po, because of the nature of their patients na karamihan ay nagre-rely talaga sa PhilHealth, hindi kaya magbayad ng out-of-pocket eh. So talagang kung anong sabihin ng PhilHealth na case rate, yun na lang yung aasahan nila. Kung maganda, and to answer His Honor's question, ano yung mga possible kumbaga points for improvement, kung maganda kasi yung costing, yung pag-estima nung package, maganda yung bayad eh. Case in point, dialysis. There is no perfect case rate. There will always be...
What do you mean by case rate?
Case rate. Ang case rate po, Your Honor, is yung pinaka-package rate na ibabayad ng PhilHealth for a defined disease.
Okay.
So for hemodialysis, right now, the case rate is roughly 6,350 per session.
That is uniform all over the country?
Yes, Mr. Chair, Honorable Suan, that is uniform across the country. So, yun pong dialysis, konti lang ang nagrereklamo, mas marami ang satisfied at mas maraming pasyente, dialysis patients ang kayang no balance. Talagang lumalabas ng dialysis center na walang singil kasi tama yung pagka-cost ng PhilHealth. Extensive yung consultation, sinulat nila na ito yung mga kasama malinaw sa pasyente at sa ospital kung anong babayaran at anong hindi. For the other case rates, and there are roughly 9,000 of them, some of them are costed properly and the corporation is catching up. Umaayos na po, kakalabas lang ng mga sa acute myocardial infarction, sa heart attack, yung sa mga iba pang heart procedures. But there are still arguably a lot na kailangan pang ayusin yung costing.
And why do you say that the fixing of this case rate will have a huge impact on the rural hospitals?
Thank you, Mr. Chair, Honorable Suan. Because for the rural hospitals, this is most, if not their only source of income, PhilHealth. So if, for example, they will determine that a certain disease costs 100 pesos, for example, and then PhilHealth costing is only at 10 pesos, which is the rough average right now, then malulugi ng 90 pesos yung ospital. Or gagawin niya, sisingilin niya yung ating kababayan, kaya umiiyak ang ating kababayan. And then DOH steps in through our MAIFIP or the line item. So if the 10 pesos costing of PhilHealth for a 100 peso disease is increased to example 50 or even 60 pesos, then yung kukunin dun sa DOH mas maliit. And also yung kukunin lalo na sa ating kababayan mas maliit pa. Yun yung dapat mangyayari sa universal healthcare.
Okay, salamat po. So, yung DOH ba, have you tried to engage with PhilHealth to try to fix these issues?
Yes, Mr. Chair, Honorable Suan, we are very happy to work with PhilHealth. In fact, yun pong, so organizational arrangement, the Secretary, two committees now, yung Governance Committee and yung Committee on Appealed Administrative Cases. Yun pong Benefits Committee, which is the key committee na nag-handle nung pag-costing, nung pag-check ng mga case rates. It is the Secretary himself, Secretary Erbosa, who has been sharing for almost 3/4 of a year, halos 1 year na rin. So siya yung nag-chair mismo nun, and it is through that interface, and also informally, they will ask us, or maybe the PhilHealth technical staff will get in touch with us, will convene meetings, we will attend the meetings. Yun po yung nangyari dun sa mga recent packages na magaganda yung costing.
Okay, so at least the DOH is already doing something para maano tong sinasabi yung case rate na problem, tapos yung costing of package. Meron na kayong mechanism ngayon.
Yes, Mr. Chair.
Very, very quick interjection,
Yes,
Mr. Chair.
with
due courtesy
kind
to
indulgence,
our representative
Congressman
from
Suwan.
the DOH.
Yes, Congresswoman Garin is
The
recognized.
review of the case rates has been initiated in 2016. This is not something new. In fact, there was a body created. The DOH was represented by Undersecretary Lilibeth David, and PhilHealth also had a representative officer. And the officers that we are seeing here now are very much aware of that, except, of course, President Mandi and Attorney Santos. In other words, yung pinagsasabi po ni ASEC Albert Domingo has long been instructed and implemented years ago. Hindi po ito bago. I believe the problem started when that coordinating body was collapsed. Diba? Let's call a spade, ASEC Albert. Hindi kasi natin pwedeng paasahin yung mga tao sa salita lamang. You have to walk the talk. If you remember during the APRO oversight hearings, this was also discussed. And the DOH promised that in 1 month's time, there will be proposed solutions. Pero walang nangyari. And these were pre-budget deliberations. Now, Mr. Chair, I don't want to prick the bubble of ASEC Domingo, but to be factual about it, yes, you are saying that Secretary Herbosa is the chair of the board at doon na pag-uusapan. But mind you, Mr. Chair, again, let's be factual about the real situation. Yung walang maraming icing. Because I cannot swallow the responses to our dear colleague, Congressman Suwan, na tila pinapalabas natin na hindi masusolusyonan yung problema ng case rates kasi ang chairman is the Secretary of Health. No, Mr. Chair, that does not happen. Why? The board of PhilHealth will discuss an agenda related to resolutions. They do not discuss step by step, one by one, the case rates. Apologies for this, Mr. Chair. I have to correct that. Being former chair of PhilHealth, hindi na kaya ng Secretary of Health yan. Huwag nating lagyan ng icing na hindi ka panipaniwala ang mga pangyayari. The immediate solution here is first, to stop the internal fighting between PhilHealth and DOH. Kasi kaming mga pasyente at yung mga tao ang nagiging kawawa sa walang hintong bangayan ng DOH at PhilHealth. Let's call that situation a fact. Kasi dun sa board meeting nyo, nagkakaroon ng awayan ang chairman, the Secretary of Health, and the President of PhilHealth. And I think that is injustice to the Filipino people. The first solution there is, yung mga nag-aaway, di wag i-involve. Let's put back the career officials who were supposed to examine the case rates. First question, why was that collapsed? Second question, yung case rates na yan, napalpak ang pagpagawa, alam na alam niya ni Dr. Pargas. Kasi dalawang tao lang yung umupo sa mesa at nag-drawing. Kaya nga, ginawan yan ng amendments and I did issued order to invite all representatives from patients, stakeholders, hospitals, and medical professionals and specialists. Pero sa dami-dami ng mga meeting, nasan yung output? Because expenditures of government on meetings, travels, and hotels and anything should have output. So I just want to make that clear, Mr. Chair, na hindi po totoo na during the board meeting, iniisa-isa yung mga case rates. This can be done by a technical working group that was initiated already before, unfortunately collapsed, and inviting stakeholders kasi hindi pwede na yung isang tao may expertise ng lahat. Hindi na kaya ng Secretary of Health yan. That is why the liaison of DOH to PhilHealth should be a person that can work together with PhilHealth, not fight with PhilHealth. I hope I said my piece, Mr. Chair.
Yes, please continue, Congressman Suwan.
Thank you for that enlightenment, Congressman Garin.
Mr. Chair,
With the indulgence of Congressman Suwan.
yes, Mr.
Yes,
Chair.
the chair would like to recognize the Honorable Congressman Acop.
Narinig po natin yung mga sinabi ni Honorable Garin. May I ask Phil, totoo po ba? Yung mga sinabi ni Honorable Garin.
PhilHealth po ba? PCEO Mandy, would you like to respond?
Pwede ba, Mr. Chair? No comment muna ako.
Or maybe we can ask the ASEC from the DOH if he wants to respond.
Mr. Chair,
Yes, Congressman Acop.
basahin ko man yung minutes in the previous meeting. Yung statements ni Asek Domingo ba yung kwanon? Kontra rin dun sa mga sinasabi ng PhilHealth eh. Kababasa ko lang dito sa mga dokumento na nasa harapan ko. That is why I'm asking kung totoo po yung sinabi ni Kwan, ni Honorable Garin. Kasi how can we solve a problem if we do not know the real score? Di po ba? Basic yan sa problem solving. Now, if we do not accept that there are problems, how can we solve that problem? Siguro mag-conduct tayo ng inquiry in aid of legislation para ma-contempt natin yung ayaw sumagot. Di po ba, Mr. Chair?
Yes, Congressman Ako.
If they're not going to answer that, I will file a resolution, Mr. Chair.
The chair would like to recognize the Honorable Stella Kimbo.
Mr. Chair. Mr. Chair.
Yes, PCO Ledesma.
With your permission, Mr. Chair, can I go back to the issue being addressed by Kong Suan on the rural hospitals?
Mr. Chair, point of order.
Yes,
Has my
Congressman
concern
Ako.
been addressed already?
One minute recess declared by the chair. Committee hearing resumes. The chair would like to recognize PCO Mandy Ledesma.
Thank you, Mr. Chair. So going back to the question of Honorable Congressman Akop, I think like any normal, happy family, PhilHealth as an attached agency of the DOH, no? So we are like one family po, no? Like any happy family, we have disagreements, we have issues, we have different points of view. And I'd like to think, since we have very close coordination with the DOH and PhilHealth, no? I think both sides, no, both parties.
Point of order, Mr. Chair.
What is the point of order of the Honorable Abante?
I don't think it's a happy family. It's an arguing, quarreling family. Actually.
Please continue, Honorable Ledesma.
So, what I wanted to mention, Mr. Chair, is that yes, we have differences in policy direction. Yes, maybe we have differences in personalities, but I'd like to think, no, since we all work for, we all have the same boss, no? We all work for the beloved President Marcos. I think we have learned both of us, no, have learned to find ways to work together and to try to put as much harmony and courteousness in our dealings with each other, no, and also our dealings between PhilHealth and DOH and vice versa, no. So we are working hand in hand with Secretary Herbosa, no, and again, I will not deny that there were policy differences, maybe also personality differences.
Mr. Chair, while I still have word, no, I'd like to say this. Your boss is not the president. Your boss are the contributors of PhilHealth. I am contributing 2,500 a month for PhilHealth. That is your boss.
Correction,
It's the president.
correction,
and
sir.
Chief
So-
Executive Officer.
Yeah, so it's the Filipino people. Correction, Your Honor.
Therefore, iwasan na natin yung mga happy family niyo. I mean, tinan nyo na ang pangangailangan ng contributors ng PhilHealth more than anything else. My goodness, why would you always have this argument in the board meeting when the Filipino people are actually suffering? Di ba?
Yes, Your Honor.
Yes,
Again,
please continue.
again, my apologies, Your Honor. It's the Filipino people who we are working for. So that's basically it, Your Honor. Again, I categorically I will not deny that there have been differences, policy differences, and like I said, maybe a difference in personality. But I think both sides have found ways to work together, no. And I think I'm speaking not just in behalf of myself, also in behalf of Honorable Secretary Ted Herbosa. Thank you, Mr. Chair.
Well, I think we have a representative here from the DOH. Maybe we can also get the side of the DOH. Would you like to give your brief comment? Thank you. Dr. Domingo.
Thank you, Mr. Chair. I cannot speak on the person of Secretary Urbosa, but I am witness to the healthy debate in the board meetings. There are a lot of questions and answers. Tagalogin ko po, nagkakaroon po ng sagutan. Ngunit ito po ay para rin sa mga debate na naririnig natin kapag hinahanap po natin yung pinakamagandang benepisyo, pinakamagandang solusyon sa mga problema. And at the end of each board meeting, nagkakaroon naman po ng resolution. Kaya lumabas po yung ating mga bagong benefits, Mr. Chair.
Okay, Congressman Akop, does that satisfy you? Or
Mr. Chair,
yes, Congressman Akop.
I asked that question when I heard the comments of the Honorable Garin. Kasi nandito po sa akin, may constituent ako na nagsabi, nagre-request lang. Also, is it possible that they align with DOH when it comes to providing a license to operate from DOH and accreditation from PhilHealth, given that the two institutions should be working hand in hand and not adding another layer to it? Marami pong duplicity na nagaganap which could be addressed more effectively if only both look at their objectives and align with one another. Magaling yung nagsabi sa akin nito. And that is why this is proof na hindi kayo nagkakaugma ng kilos.
Mr. Chair.
Kasi yung tao nagre-request na nga na mag-align kayo towards your objectives. That is the reason why I asked that question, Mr. Chair. Marami pong salamat.
Mr. Chair.
Yes, Honorable Ledesma.
Yeah. Thank you very much, Mr. Chair. Thank you very much, Honorable Akop. I would also want to add, yes, we do have policy differences. Nagde-debate po kami sa board. Pero I think if we also look at the good things that has happened in PhilHealth in the last 2 years, or even in the last year, since Secretary Herbosa has been secretary for a little over a year, marami po kaming nagagawang positive accomplishments, no? So, yes, there are debates. Yes, there are disagreements, differences in policy. But the fact that we're able to increase the case rates by 95%, we are able to enhance so many of the benefit packages. We've been able to increase the payments of claims to hospitals. We've been able to move forward in our digitalization process. We have done so many positive things. So there are always two sides to a coin po. No? Pwede natin tignan yung hindi masyadong maganda, pero marami rin po tayong magandang accomplishments. No? But thank you very much for all of your inputs po, Honorable Acop. Thank you, Mr. Chair.
But could you imagine what you could accomplish kung align kayong dalawa? Eh, yan pala, hindi pa kayo meron pa kayong konting misunderstanding, and yet, you are telling us na marami kayong nagiging accomplishment. So, could you imagine kung lalob na kung align pa kayo? Diba?
Duly noted, Mr. Chair.
Mr. Chair.
Total, bagong taon na naman na po. Magcha-Chinese New Year na. Yes, the Honorable Janet
Mr. Chair,
Guerrero recognized.
again, with due courtesy to Kong Suwan, because I can see Congresswoman Stella Kimbo, who was actually one of the referees when Secretary Herbosa erupted and was saying all words, and President Mandi also was somehow responding, but later on apologized. Parang siya na nga ang nag-give way. Pero ganyan talaga eh. But then, Mr. Chair, let me reiterate the question addressed to DOH. Are you sincere and bent on having a ceasefire against your personal tirades against PhilHealth? On your personal tirades against PhilHealth?
Mr. Chair, it's not a personal tirade, but yes, we will work to our
Then
best
what it
with
is if
PhilHealth.
it's not personal? Kasi ang nakikita namin, I believe, wala kaming pakialam kung gusto nyong magpalitan ng opisyal or whatever, pero ang trabaho. Dapat nakaseparate yung politika doon sa trabaho. And while the President is still there and the President is still Mandi Ledesma, kung pwede sana magtrabaho muna. Kasi sayang yung oras eh. Every hour, every day should be dedicated to the Filipino people. And I don't want to see our Senior Vice Chair again being, sa dami-dami ng ginagawa niya, yung oras niya nauubos dun sa pagre-referee. So, Mr. Chair, may I repeat the question? Can the Honorable ASEC relate to the whole department to have a ceasefire on these nuances between DOH and PhilHealth?
Mr. Chair, just a very, very germane to the question
Honorable
of,
C. Adjong, you
yes,
are recognized.
Vice Chair Janet Garin. I think the good lady from Iloilo wanted to know exactly categorical answer from DOH. So just to put the perspective into its right context, right? Currently, we have ASEC Domingo, which, by the way, when he responded to the question, already intimated to the committee that he cannot or he is not authorized to speak on behalf of Secretary Herbosa, because the question really delves around the issue on personal dynamics between Secretary Herbosa and President Mandi. So just to be fair to our resource person, if he answers the question, his capacity as an assistant secretary, is he authorized to speak on behalf of the entire department? Or if he answers positively to the question of Vice Chairman Janet Garin, is he answering only sa kanyang sariling opinion? Kasi ang alam ko, kanina, there was a reference on there was a sort of like hindi pagkakaintindihan during the budget hearing. And Chairman Stella Kimbo was witness to that. Na-trauma ata na victim siya. But it was not ASEC Domingo who was involved in that scuffle. It was Herbosa. So in reference to the particular happenings during the budget hearing, can he speak on behalf of Secretary Herbosa para at least ma-tone down at saka mapanalig itong committee na to na hindi makaka-apekto sa magiging direksyon ng PhilHealth at DOH. Just to be fair to our guest right now, si Asek Domingo, just to put things into its right perspective po. Thank you, Mr. Chairman.
Asik Domingo.
Thank you, Mr. Chair. Thank you, Honorable Alonto. When it comes to the personal dynamics, I cannot speak, Mr. Chair, because it is between the two individuals. But I am fully authorized to speak on behalf of the department, and I wish to assure the Honorable Committee, Honorable Garin, that moving forward, we are very much going to work as we are working now with PhilHealth. And the proof po is the release of new benefits and acceleration in payments. Thank you, Mr. Chair.
Mr. Chair.
Before I recognize the Vice Chairman, the Chair would like to recognize Congressman J. Konghun. Yes, Honorable Vice Chairman.
Unless we invite the Secretary here in this committee, I don't think that we're going to have a real answer to the query that have been put into. So I would like to make a motion that in the next hearing, we should invite the Secretary of Health to be present in this committee. I move, therefore.
Thank you. Is there any objection? Duly seconded. Is there any objection? Hearing none, the motion is carried. The COMSEC is requested to invite the Honorable Secretary Herbosa in the next scheduled hearing. Yes. You still have some more
Mr. Chair,
query?
in relation to the question of Congressman Suwan, so may we ask now, kasi yung question niya kanina is on the case rates and there was a long answer from Asek Domingo citing praising the good secretary. But the question has not been answered. Has the committee dealing with this, the one that was created before, aligning DOH and PhilHealth, has it been revived or not yet? When do you intend to revive it? Para masagot yung tanong ni Congressman Suwan.
Yes, Asek Domingo, you are recognized.
Thank you, Mr. Chair. I am sorry, Honorable Green, Honorable Chair, that was before I came into the department. I am not aware of the specific coordination committee. To my knowledge, current operations, the Benefits Committee is the one that coordinates PhilHealth and the DOH, Mr. Chair. Honorable Green.
And who in DOH, Mr. Chair, who is the representative of DOH, Mr. Chair, in this case?
It is the Secretary himself who has been sitting since July or August, Mr. Chair.
With that, Mr. Chair, again, in relation to the question of Congressman Suwan, let me just, for the enlightenment of the Honorable Committee, the purpose why a committee was created, represented by a USEC, is that we know how busy the Secretary is. That time, it was represented by USEC Lilibeth David, who also heads policy in the department, who has been a long career officer of the department, and who also is very much aware of the stakeholders, hospitals, patients, and specialists. Yung committee po na yun, ang tumutok na i-review isa-isa yung case rates. Yan din ang tumutok ng no duplication. Because for the information of this August body, marami ring mga gamot, commodities, devices, ang binibili ng DOH, pinamimigay sa hospitals, including chemotherapeutic drugs, at yung mga hospitals na nabigyan nito ay clinic claims sa PhilHealth, which should not be the case. So that committee actually aligned things. Ang binibili ng DOH, hindi dapat nire-refund ng PhilHealth. Ang packages ng PhilHealth ay hindi nagdodoble sa packages ng DOH. Just if we go back to COVID testing, Mr. Chair, bumili ng bilyones na testing kits ang PSDBM. Pinamigay sa pribado at government hospital. Pero napakamahal naman ng singil at nire-reimburse din ito ng mga hospital papuntang PhilHealth. Sino ang kawawa? Taong bayan. So with that, Mr. Chair, let me reiterate what was mentioned during the preliminary budget briefings and budget hearings with the DOH. Revive that committee. Kasi maski sa pinag-uusapan dito, ang dami kaninang mga proposal on wheelchairs, walkers, pero binibili rin kasi ito ng DOH. How sure are we na yung binibili ng DOH na pinamimigay sa hospitals at pinapa-reimburse naman doon sa PhilHealth ay hindi ulit mangyari? We were able to trace that, Mr. Chair, specifically on chemotherapeutic drugs, on some antibiotics, and even on supplies being used for dialysis treatments. That's why, habang dinidiscuss natin dito na palawakin ng PhilHealth yung kanilang mga ginagawa, hindi natin maipagkaila na kapag binalik yung malaking gap dun sa dalawa, magkakaroon ng waste of resources and waste of money. Maraming salamat, Mr. Chair.
Thank you. Yes, Asek Domingo.
Thank you, Mr. Chair, Honorable Green. We gladly accept, and I will personally look into the nature of this coordination committee because, Mr. Chair, Honorable Green, it happened before my time, so I will get an update po from the historic.
You admit that the case rates are still up for review, di ba?
They are continuously being reviewed.
Okay, and
ma'am.
who is reviewing it?
It begins at the technical level of PhilHealth, the HFPS, the Health Finance Policy Sector, and then elevated to the board for approval.
Yeah, Mr. Chair, balikan lang natin yon. Yung doon kasi sa board, ina-approve, and Congresswoman Stella Kimbo is very much aware of this. Ang nandoon na kasi sa mga resolution, saan ba nagkamali? Nung ginawa ang case rates na ikinalugi ng maraming pampublikong hospital under the LGUs. We have colleagues here who are former mayors and governors. Nung ginawa kasi yun, warang consultation. So kung bumabalik kayo again, doon na finance lang ang titingin, hindi kasi kinausap yung specialty society, yung doktor at yung stereotype. You have to balance. Yung sinasabi mo kasi, Asek Domingo, na sinasubmit sa board, yan na yung final. And sometimes it becomes ministerial kasi if you craft the packages, you call the specialist commensurate to the topic being discussed. Kunyari, nag-opera, dun sa case rate nyo, tinanggal yung anesthesiologist. Sa lahat ng case rates, walang anesthesiologist. So, sino ang magbabayad ng anesthesiologist? Di ba kaya yung ibang mga ospital na sinasabi nilang nagsara, kunyari, case rate ng pneumonia, isang kaso lang dun, hindi naman quinantify, mild ba ito, moderate ba ito, severe ba ito? Andun yun ang pinaka-importante. That's the heart of the case rate. Yung tinanong nyo yung specialty society, kung sa pagpanganak ba yan, o kung cesarean yan, may pedya ka, may OB ka, may anesthesiologist ka, ano yung mga kailangan gastusin? Ito naman yung ospital, ito naman yung pasyente, ito naman yung DOH. Ano yung binibigay ng libre, ano yung binibigay na may bayad. So walang duplication. So when you submit it to the board, it's a done deal. We have to stop all the nuances. Hindi pwedeng may gap ang DOH at yung PhilHealth dahil ang sambayan ng Pilipino ang nagiging kawawa. So again, Mr. Chair, to reiterate, let us bring back the joint committee between DOH and PhilHealth, not only to address the case rates, but to also avoid duplication. Na yung pinamimili ng PhilHealth at ng iba pang ahensya ng gobyerno on health-related medicines, vaccines, and devices will not be charged to PhilHealth. Kasi uulitin natin, bilyones na test kits na inutang at ngayon binabayaran ng sambayan ng Pilipino na binibili through PSDBM ay pinamigay sa private and government hospitals. Ang tanong, ni-reimburse ba ito sa PhilHealth? Yes. Bakit babayaran ng PhilHealth yung mga bagay na bilhin ng gobyerno, na binili ng DOH? So that's a very important committee to bring back that was removed by the previous administration for a reason that we cannot explain. At kaya nga nagkaroon ng problema, nagkaroon ng interim reimbursement mechanism, yung illegal na IRM that Attorney D.L.E. Santos is very much aware of. Ibig sabihin yung pera ng PhilHealth nung nakaraang administrasyon, pinanggawang kapital. Bumili ng mga sasakyan, nagpagawa ng mga building. Bakit natin bakit ang PhilHealth magiging kapitalista ng mga pribadong ospital at pribadong clinics? That's why this happened. Kaya nga, the solution here is not to sweet talk the legislators. And I'm referring this to DOH. The solution here is to put back concrete measures that will really address the problem. And let's stop blaming PhilHealth, let's stop blaming DOH, let's buckle down to work because that's our obligation to the Filipino people, Mr. Chair.
Thank you. Congressman Suwan, please continue with your interpellation.
Thank you, Mr. Chair. So going back to the measures that the Department of Health is taking up to try to help these hospitals survive, as we are still on the determination of the impact of delayed payments of PhilHealth as to the hospitals. So what else is the Department of Health doing in order to help these hospitals stay afloat, aside from the MAIP and aside from this benefits board regarding the case rates?
Mr. Chair, Honorable Suan, so those are the levers. The way that we approach it is, kung kailangan pong taasan yung budget as Congress has given for the hospitals operations in GEA 2025, yun po yung financial intervention. Kasi yung tinatawag po na yung line item, we call it internally quantified free service, yung sweldo ng mga doktor, yung pagbili ng mga commodities. Another one I'd like to add to the discussion, Mr. Chair, Honorable Suan, and also this is where Congress can help us. Yun pong Philippine National Drug Formulary. Yung Philippine National Drug Formulary po, it was established by the Generics Act of 1988. But there is a 1993 executive order. The number escapes me now, Mr. Chair, but we can provide it a specific EO number. It's a 1993 EO that requires that all government procurement of medicines has to be found inside the Philippine National Drug Formulary. That is a sound concept, Mr. Chair, Honorable Suan, except that the speed by which new molecules are included, mga bagong gamot po, new molecules are included into the formulary, yun po yung nagiging challenge. So the approach that Secretary Erbosa, this current administration is doing, yun pong Formulary Executive Council na nawala for quite some time, nire-reconstitute na po para bumilis yung pagpasok ng mga new molecules. The reason being, Mr. Chair, the current interpretation of the Health Technology Assessment Council is everything has to pass through them, which the department respectfully disagrees with. And we think there is a role for the Formulary Executive Council to accelerate inclusion. So matotal, Mr. Chair, Honorable Suan, pag wala kasi sa formulary, hindi siya mabayaran ng PhilHealth, hindi siya pwedeng i-procure ng DOH hospital yung gamot. Kaya ang nangyayari po yung pasyente, bumibilis sa labas. Nagkakaroon ng out-of-pocket charge.
Okay. Thank you for that. So I guess that what the Department of Health is doing is there is not much that the Department of Health is doing right now to help these hospitals, aside from your suggestions of increasing the budget of the DOH through Congress and through this formulary. Mr. Chair, just a couple more questions which I would like to address to PhilHealth. Sir Ledesma, do you know how many hospitals have shut down because of the RTH or delayed payment or failure to pay?
Mr. Chair, we'll try to get a copy. We don't have the data currently, but we'll try to furnish the data and then submit it to this honorable committee.
Okay, sir. I will ask for that during the next hearing.
Yes. Mr. Chair, sorry. Mr. Chair,
Yes, President Ledesma, you're recognized.
in relation to Honorable Kong Suwan's earlier queries on the rural hospital, if I may be allowed, Mr. Chair, I have with me a copy of a General Assembly resolution which was signed by the League of Provinces of the Philippines, mainly Governor Dax Cua and Governor Ray Tamayo. With your permission, Mr. Chair, it's related to your queries. It's a little wordy. Is it okay if I read it very quickly?
Can you summarize?
Basically, okay. It's congratulating and recognizing the performance of the Philippine Health Insurance Corporation under the leadership of its President and Chief Executive Officer Emmanuel Ledesma and all its current officials. And then there are 7 or 8 whereases, no? Maybe if I can read the first few ones. So the first one is, whereas PhilHealth has long been a partner of the LGUs in ensuring that all their constituents have access to basic and quality healthcare services as mandated by Section 17 of Republic Act Number 7160 or the Local Government Code of 1991. Second one, whereas over the past year, PhilHealth has accomplished a lot in terms of improving its services and increasing the benefit packages of its members under the leadership of its President and CEO, Emmanuel Ledesma, and all its current officials. The third whereas is last year, PhilHealth launched the Primary Care Provider Network, PCPN, contracting arrangement through their Consulta package in selected sandbox sites to prepare LGUs for the implementation of the Special Health Fund under the Universal Health Care Act. And I'll read one more whereas. The next one is PhilHealth has also started the digitalization of its key processes to ensure more efficient delivery of services such as accreditation of healthcare providers, premium collection, and members registration. So basically, what it's saying, and it's signed by all of the national officers, sir, Mr. Chair, is that PhilHealth is trying its best to do its part in improving the healthcare of the rural services. Thank you very much, Mr. Chair. Thank you.
One last question, Mr. Chair. I would like to thank you for that information, PCO. Yung mga concerns ng mga hospitals when they say that they have not been paid or yung mga RTH, dumadating po ba yan sa inyo na may mga hospitals na in dire straits because they have not been paid or because of delayed payments from PhilHealth?
Yes po, marami. In fact, a lot of them, I get straight by an SMS messages or actually a phone call. No? Yes po.
And how do you help them? Do you provide immediate solutions?
We do, yes po, we provide immediate solutions and we try our best to go through whatever we can do to help them. No? Talagang tinatrabaho namin yan po. And,
Specifically, how?
Mr. Chair, if I can ask our COO, Eli Santos, to elaborate, Mr. Chair.
Mr. Chairperson.
Yes, please.
Mr. Chairperson.
Tony Santos.
Honorable Representative Suwan, so when the Office of the President and CEO directs us to coordinate immediately with these hospitals, we schedule a meeting immediately and reconcile whatever data we have regarding the status of the claims that they have submitted to PhilHealth. Most of the time, Mr. Chairperson, Honorable Representative Suwan, we are able to resolve these issues on payment. If there's a need to accelerate the payment, then we inform and even direct the regional offices to fast track, not only for a particular hospital, but everything, all of facilities, Mr. Chairperson, Honorable Representative Suwan.
So how do these hospitals reach PhilHealth? Sino yung tinatawagan nila? Paano yung mga tao na, yung mga hospital owners na walang direct contact kay PCO?
Usually, sorry, Mr. Chair, usually, Kong, they go to the 17 regions yung PhilHealth. Each region has a regional vice president who oversees the region, no? So usually po, yan yung first point of ano nila. Kumokontakt nila sa RVP ng region nila.
So,
or the LEO head po.
okay. So there are cases where hospitals who are on the verge of closing are being helped by PhilHealth. So mga ilang percentage po yung mga hospitals na yung nangangailangan ng tulong and you are able to help them, help prevent them from closing?
Mr.
Yes, Attorney Santos.
Mr. Chairperson, Honorable Representative Suwan, when on a yearly basis, the providers, partner providers, apply for accreditation. So for a given year, if we do not receive any application for renewal of accreditation, we contact these providers, partner providers, as to the reason why they have not submitted. So if the issue is on the PhilHealth side with respect to compliance to requirements, we help them comply with these requirements, Mr. Chairperson. So on our side, we proactively communicate and meet with our providers, especially those that...
What about those cases where yung hindi sila nabayaran or late payments from PhilHealth tapos nag-close sila? Paano nyo sila tinutulungan?
Mr. Chairperson, Honorable Representative Suwan, when we are not immediately informed or given information that the reason for their non-submission of application, probably for renewal, is due to non-payment of claims or probably delayed payment. What we usually receive, Mr. Chairperson, Honorable Representative Suwan, are non-availability yet of requirements before they submit their application. As to this reason that they do not submit their application for renewal on a given year because of non-payment, personally, I have not yet received such information or such reason for non-submission. Usually, the reason that, but I'm not saying, Mr. Chairperson, that it's not happening. Probably it happens. The situation is probably true. But usually, the reason for non-submission of application for renewal is the non-availability yet or incompleteness of the requirements, Mr. Chairperson.
So you're saying that these hospitals closed not because of the non-payment of PhilHealth, but because of the lack of requirements?
Mr. Chairperson, Honorable Representative Suwan, no, I'm not saying that. But what I'm saying is I have not received such reason yet that the hospitals did not submit their application for renewal. Usually, the reason that I receive is that they have not yet completed their requirements. Probably I do not have that information. Probably I need to dig deeper.
Because what you're saying is basically there are no hospitals which are closing or on the verge of closing because of the late payments from PhilHealth. That's what you're saying right now.
Mr. Chairperson, Honorable Representative Suwan, I apologize for probably conveying that message, but I do not, that's not my message. Mr. Chairperson, Honorable Representative Suwan, it's just that I have not received any information that the reason for closure or non-submission is the late payments. Yes, we admit that there are late payments, there are claims that are returned to hospitals, there are denied claims, but insofar as their application for renewal on a daily basis, I have not received the reason, that particular reason of non-payment. Mostly the reason is that they have not yet completed the documentary requirements for their application. But I'm sure that there are hospitals that are suffering from delayed payments or probably denied claims. It's just that the reason for non-submission is because of the lacking documents. Mr. Chairperson, Honorable Representative Suwan.
What if they are no longer interested in submitting an application for renewal because they no longer exist due to the lack of payments? Paano nyo tinutulungan yun?
Mr. Chairperson, Honorable Representative Suwan, that's why earlier I said that we do our best to help the providers. If the issue is on the claims, then we assist them, Mr. Chairperson, on how to, if it's denied claims, then we address the reasons for denial. If it's returned to hospital claims, then we address the reason for the return to hospital. So, based on my experience, Mr. Chairperson, we usually have meetings with these providers and address their problems and the reasons why they do not submit their application for renewal. Mr. Chairperson, Honorable Representative Suwan.
Thank you, Mr. Chair. No more questions.
Thank you. The next interpolator
Mr.
is
Chair,
the...
before that, I just would like to make a manifestation here that
Yes,
I
Vice
filed-
Chairman Abante.
I filed a resolution on October 17, 2023, House Resolution number 1389, to conduct an inquiry in aid of legislation, especially on the data breach of Philippine Health Insurance Corporation. Just would like to make that manifestation, Mr. Chair.
Thank you. The chair would like
May
to...
I also submit to you the resolution?
Thank you. The next interpellator is the Honorable Z. Alonto Adjong.
Thank you, Mr. Chairman. Magandang hapon po sa ating lahat. Isang mapayapang bagong taon sa ating mga bisita from PhilHealth and DOH. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wa barakatuh. Mr. Chair, perhaps this question that I am about to ask PhilHealth were already discussed extensively in the previous committee hearings. But just allow me, Mr. Chair, to lay the premises of my questions on the investment strategies of PhilHealth, because this would speak out the financial vitality of PhilHealth in order to be fitting to respond quite fitting to the medical demands of the public, no? Especially the members of the PhilHealth. So these are just basic questions, and I'm sure President Mandy can accurately respond to. No? Para lang po sa ating mga kababayan, tagalugin ko na lang po, Mr. Chairman, President Mangy, ang aking mga katanungan. No? Meron po tayong tinatawag sa PhilHealth na reserve funds. No? Ito po yung isang portion doon sa hindi nagagamit na pondo na yung nakokolekta po ng PhilHealth diretso po sa ating mga mga members, no, mga contributors, at yung mga ibang na-identify na po na pwedeng pagkunan ng koleksyon ng PhilHealth. Tama po ba yun, President Mandy?
Yes po, Mr. Chair.
Yes, okay. Ito pong reserve funds na ito, asan po normally ito ginagamit at may limit po ito? Paano po natin madetermina yung isang amount na nakolekta ng PhilHealth para masabi po natin ito ay reserve funds? Ito ba ay excess doon sa yung costing nung for example, expenditure or costing ng PhilHealth sa buong isang taon, tapos kung meron po siyang sobra, ito po ay magiging reserve funds? Tama po ba ang aking assessment?
Tama po, Mr. Chair. It's basically accumulated revenue minus expenditures. Mr. Chair, if it's okay, pasa ko na lang kay Sir Renet. Kasi siya yung finance para mas mabilis, Mr. Chair. Thank you, Mr. Chair.
Yes, before I recognize Mr. Lim Siaco, the chair would like to recognize the Honorable Bosita from the One Rider Party List.
Okay.
Yes, please proceed.
So, yes, may dadagdag pa po ba kayo doon sa kasagutan ni President Mandy?
Yes, Mr. Chair. Honorable Representative Adjong, tama po yung sinabi ni PCO Ledesma. Our reserve fund is nasa 280 billion pesos, Mr. Chair. This is the 2 years reserve fund as provided in Section 11 of the UHC Act or Republic Act 11223, Mr. Chair, Honorable Representative Adjong.
Okay. So, ibig po sabihin, Mr. Chair, ang pagdidetermine na po dito sa reserve funds, meron na pong provided na po ito or nailalahad na po, no, nailahad na po dito sa batas na inyo pong ni-refer, no? Itong Universal Healthcare Act. Tama po ba?
Yes po.
So magkano po yung pagdidetermina nitong reserve funds? Sino po yung nagdidetermina dito? At anong amount po yung pwedeng sabihin natin na pwede na ma-set aside for the reserve funds?
Mr. Chair, batay po sa Department of course, General Appropriations Act ng 2024 po, and mayroon silang provision doon, special provision, that the Department of Finance will issue the guidelines on how to determine the reserve fund, Mr. Chair. As ito po ay kasama ang Department of Finance, na-determine po natin ang 280.57 billion. As ibig sabihin po nito, ito po ang pangangailangan ng korporasyon sa 2 taon po na kanyang pag-ooperate, both sa benefit po natin at saka sa admin cost po ng corporation. So that is 140 billion kada taon, so multiplied by 2, so nagiging 280 280.57 po ang computation dito. But of course, mayroon po siyang calculation po dito na weighted po ang kanyang average weighted yung ginamit ng Department of Finance po dito na nakaabot po tayo sa figure po na 280.57. Ito po ay reserve po na again in compliance sa 11223 po, section 11 po.
Okay.
Mr. Chair.
So, bigyan lang po ng halimbawa, Mr. Chairman, para po maintindihan ng ating mga taon bayan. Tinatagalog ko po, Mr. Chairman, dahil pinag-usapan po natin ang pera ng ating mga members and direct contributors, no? Para po maintindihan nila. Sa makatwid po, Mr. Chairman, magbibigay lang po ako ng halimbawa. Halimbawa, kung ang medyo babaan ko lang po yung yung amount na iseset ko na example para maintindihan po. Halimbawa, merong kailangan ng PhilHealth sa kanyang pangangailangan sa loob ng isang taon ng 10 million. You multiply that into 2 years kasi yung actuarial estimate niya is for 2 years. Tama po ba?
Opo.
So kung halimbawa, pumasok po na revenue is 12 million, tapos ang pangangailangan ng PhilHealth is 10 million lang sa isang taon, yung 2 million, yun po yung reserve funds. Tama po ba?
Mr. Chair, Honorable Representative Adjong, papasok po siya sa reserve fund pag hindi po siya nagagamit po natin.
Tama.
Po.
Yun nga yung sinasabi ko. 10 million halimbawa yung pangangailangan ng PhilHealth, tapos ang pumasok po na revenue, yung nakolekta ay 12 million, may 2 million na reserve funds na po pwedeng iset aside. Tama po ba yun?
Tama po.
Okay.
Tama po, Kong Adjong.
So meron po din po tayong tinatawag, Mr. Chairman, na investable funds. Tama po yun. Paano po natin ito ikumpara doon sa reserve funds para maintindihan po ng ating mga members at direct contributors?
Mr. Chair, Honorable Representative Adjong, ang ating reserve fund ay ang kanyang cash backup. Kumbaga, ano ba ang nagko-cover sa ating reserve fund na ito na asset, na pera, because reserve fund na siya, may corresponding siya na pera. So ito po yung investment portfolio po natin. Ito po yung investment fund po natin. So itong investment fund natin po ay as of December 31, 2024 ay umabot sa 492 billion pesos po. Ito ay mayroon ho tayo special savings deposit na isang 100.7 billion. Mayroon tayong government securities, meaning pumasok po ito sa ating treasury bills, treasury bonds, na umabot ng...
Mr. Chair, para po maintindihan natin, simplihin na lang po natin, Mr. Lim Siangco, yung sabi nga ni Congressman Janet Garin kanina, laymanize po natin kasi ang purpose po ng pagtatanong ko ay para maintindihan po ng ating mga members. So, sa makatuwid po, may reserve fund, halimbawa, paano po i-compute yung sinasabi nating investable funds? Mula doon sa sinasabi po nating reserve funds na yun. Natanggal muna yung pangangailangan ng PhilHealth, yung kanyang gastusin sa loob ng isang taon, tapos meron pong sobra, yun na sinasabi nating reserve funds, iset aside natin yon. Paano po naman natin po makakadetermina kung alin doon sa porsyon nung pera na iyon, na reserve funds, na excess, ang po pwede nating sabihin, partly pwedeng gamitin as investable funds. Ibig sabihin, yung gagamitin ng PhilHealth para ilagay niya kung saan-saan mang po pwede niyang ipalago itong pera na ito.
Yes, Mr. Chair, Honorable Representative Adjong. Meaning, ang ating reserve fund, as mentioned kanina, na 280.5 billion, Mr. Chair, Honorable Adjong, ay may nakaakibat na investment po, na nakatago po siya sa ating government securities. Sabihin natin po, because 375 billion po yung ating pera po, naka-reserve po siya and ready po siya in the event may pangangailangan po tayo na gagamitin ang korporasyon in the benefit expenses o pambayad natin po sa ating mga hospital.
Nakatala din po yan sa Universal Healthcare Act o sa IRR po ng PhilHealth, doon sa computation ng investable funds.
Kasama din po siya, kasi nakasaad po sa ating batas, lahat na pera na hindi gagamitin ng korporasyon sa kanyang operation ay ilagak niya po sa investment para naman po kumita kahit papano po yung ating investment na comparable sa merkado po.
Okay. Base po, Mr. Chairman, Mr. Lim Siangco, base po doon sa nakaraang September 2024 po na budget hearing po natin, lumalabas po na may excess funds ang PhilHealth. Kasama po doon sa funds na ito yung investment, no, na umaabot na 700 billion. Tama po ba yung figure ko? Sa notes ko?
Ang lumalabas po sa ating datos po, Mr. Chair, Honorable Representative Adjong, again, mayroon po tayong reserve fund na 280.5 billion, more or less 281 billion. Mayroon ho tayong surplus na 150 billion, that is October financial report po. That's 430 billion pesos, Mr. Chair.
Ano yung 430 billion pesos? Ito yung...
The investment, the 280.5 billion na reserve fund plus the surplus of 150 billion pesos po. So we have 430 billion pesos po na kumbaga investable fund, Mr. Chair, Honorable Adjong. That is part of our members' equity actually, pero masyado technical siyang na terminology.
Po, gusto natin simplihin ko po, no ba? Pero kanina po na nag-refer po kayo sa Universal Health Act. Actually, yung section na yun na binasa niyo po kanina sa amin, yung sinasabi po dito sa Universal Care Act, ang natitira pong parte ng reserve fund, and please correct me if I'm wrong, I'm just basing it on my records based on also the previous discussion that you had with this committee. Yung reserve fund na hindi kailangan sa current expenditure obligation ng PhilHealth, no? Tama po, in-explain niyo po kanina, ay pwede ngang i-invest. This is the investable funds na sinasabi ninyo. Out of the 700 billion, magkano po yung calculation niyo for the investable funds?
Ang ating investment portfolio po, again, as of December 31 po, ay 492.2 billion pesos po, Mr. Chair, Honorable Representative Adjong.
Okay, ano ba yung meron ba kayong terms din na yung sinasabing investment reserve fund, or are we talking of the same thing? When you say investment fund, it's just the same thing it's just the same thing with investment reserve fund. Anong pagkakaiba nito?
Ito na po yung ating investment fund po na minimension po natin, sir.
So yung sinasabi po nating investable funds, ito po yung mga possible na category na po pwede nating sabihin na iyon yung pwedeng pero pag sinabi pong investment reserve funds, yun yung actual kung ano po ang hawak natin.
Yes po.
Tama po yung aking... Okay.
Yes po, investment portfolio po natin, Mr. Chair, Honorable Representative Adjong.
Okay. Gusto ko lang pong malaman, Mr. Chair, kasi kanina, ang sabi ko, nais ko pong ipa-explain sa PhilHealth kung ano po yung mga investment strategies na ginagawa po ng PhilHealth ngayon para makita natin kung gaano ka husay, halimbawa, mag-respende at maka-accumulate at magpalago ang pera ng PhilHealth, no? So nais ko lang pong malaman, Mr. Chair, kung ano po yung mga sektor na ayon sa PhilHealth ay naaayon para doon po nila i-invest ang kanilang investable funds sa ngayon, currently.
Yes po.
Mr. Chair, thank you, Sir Net. We're very strict po yung investments ng PhilHealth, so we're only allowed to invest in AAA bonds. So AAA bonds or better, no? So lahat po ng investments namin, the Honorable Committee and the Filipino public can be confident and comfortable that we will not risk the money, no? Kasi AAA bonds or better lang po.
We will not expect less from PhilHealth, no?
Yes,
but I have here the list of all those possible sectors that you may be required, or again, probably part of a part of the areas where you can invest your funds. Nag-invest po tayo, are we allowed to invest in this following, no? Interest-bearing bonds, sinabi niya nga po yun kanina, securities or other evidence on debt net of the government, debt securities and corporate bonds. Sa makatuwid, yung mga nilagyan niyo po doon, pakiulit nga po, Mr. Mandy, ano po yung tatlong areas na ito na sa ngayon, currently, no, na nila pinaglagyan po ng pondo ng ating ng PhilHealth?
So, Mr. Chair, there are three areas, no? Basically, the first is special savings deposits. The second area is government securities po, further broken down into either treasury bills or treasury bonds. And then the third one is corporate bonds po, which is broken down to either property sector or banking sector. Yun lang po.
Sa itong tatlong areas po ito, President Mandy, kung i-identify po natin itong pondo, lahat po ba yan in one sector na ininvest natin or meron pong sa tatlong area na to spread across all these three areas kung saan po natin ininvest yung ating pondo? At magkano po ngayon pondo currently ngayon na na-invest natin?
Ito muna yung, yung total investment funds, roughly na lang po, 500 billion.
Okay.
Mga 492 to be exact. Gawin na nating 500 po, no? Now, ang breakdown po sa tatlo na sinabi ko po, special savings deposits, 70% land bank, 30% DBP is roughly, Mr. Chair, 20% of the total. And then 76% is roughly in government securities, that's treasury bills and treasury bonds. And then the remaining 3% is in corporate bonds, broken down 75% property sector, 25% banking sector po. So to make a total of 100% po.
Okay. Yung basis po ninyo to determine kung yung how much is to be invested in this area, meron po kayong adopted, like for example, a portfolio guidelines on how you invest these funds, this money? Mr. Chair, gusto ko lang pong malaman, alinsunod ba ito sa anong particular na polisiya?
Yes po, we follow to the letter po the policy on Section 11 of the Universal Healthcare Act. With your permission, Mr. Chair,
Yes,
you want me
please.
to read the provision?
No, I just would like to ask, perhaps just in the interest of time, baka meron po kayong kopya dyan, no? Doon sa breakdown po ng na-mention ninyo, maybe we can also request, Mr. Chair, the PhilHealth, kung I'm sure you already have an investment portfolio and plan on where did you invest all the funds and the breakdown in which areas
Yes.
have you invested?
Actually, meron kami. We can submit to you
Yes, please.
within the day po. Complete breakdown po.
Okay.
So, yung ilang percent sa treasury bonds and then sa government securities, lahat po yan.
Magkakapare-pareho ba ito ng interest, commercial interest rate doon sa lahat po ng pinag-investan ninyo?
Hindi po. Just to give you an idea po. So, ito yung yield percentage to return on investment, no? For the special savings deposits, again po, roughly, Mr. Chair, if you don't mind, mga 6%, no? Yung sa government securities, treasury bills, also 6%. And then yung sa treasury bonds, 4.7%, no? So yung days to maturity sa treasury bills is roughly 78 to 100 days po. And then the treasury bonds, the days to maturity is around 1 to 6 years po, no? And then sa corporate bonds, the yield percentage to the return on investment is 6.2% po, slightly higher. And the yield days to maturity is ranging from anywhere from 0 to 6 years po. So, ang total investment portfolio yield percentage to return on investment is around 5.13% po.
5.1.
5.13.
Of what, how much amount?
Of the total amount is 25 investment, no, the total amount invested is 492 billion po. To be exact po, 492,205,964,751.74 po.
Okay, thank you. Mr. Chair, Pres Mandy, tama po ba ang aking notes? Noong July 6, 2015, nagkaroon po ba kayo ng investment management agreement with the Banco de Oro, BDO, Unibank? Tama po ba based on I'm sure you were not still the president at that you were not the president at that time, but in 2016, based on my records, there was a investment management agreement entered into between PhilHealth and Banco de Oro, Unibank.
Mr. Chair, for smoother flow, if I can allow
Please.
kasi
thank
they
you.
were
Yeah, I
allowed,
know,
no?
you
Para
were
mas
not part
madali,
of-
Mr. Chair, if
Yeah,
it's okay.
you were not part of PhilHealth that time. So just I would like to ask anybody from PhilHealth.
Mr. Chair, Honorable Adjong, mayroon po fund manager na pinocure si PhilHealth and then na-implement po siya. And eventually, nasara din siya, na-close din siya. May, of course, isang provider lang po to. And hindi na po siya tinuloy. Mr. Chair.
Ilang providers po ba yung pinurchase ni PhilHealth dun, under the itong IMA?
Isa lang po, Mr. Chair, Honorable Representative Adjong.
Ano yung gusto ko lang pong maintindihan. So what was the result of this? Kasi ang pagkakaalam ko po, you procure yung manage under the under po dito sa investment management agreement, the BDO would be acting as the one who would instruct, for example, or plan out your investment portfolio. Tama po ba akong pagkaintindi?
Mr. Chair, very sorry kung Representative Adjong, during the time wala pa ho ako sa fund management sector and hindi ho kami preparado sa report na hinihingi niyo po.
Can you
submit the report if possible po?
Yeah, Mr. Chair. I think it's important, Mr. Chair, that we request PhilHealth to provide us with this document. This was done. It was entered. Perhaps si Attorney Eli Santos, can you provide us an information on what has been achieved or what has been accomplished or what were the benefits that PhilHealth get from entering into this IMA with the Banco de Oro on July 6, 2015?
Mr. Chairperson, Honorable Representative Adjong,
Yes.
I returned to PhilHealth only in 2020. In 2015, I resigned from PhilHealth Regional Office 11, Mr. Chairperson. So at that time, I was not yet with the PhilHealth Central Office. But as to reiterate the manifestation of SVP Renette Lim Siaco Jr., we will submit the required documents, Mr. Chairperson, Honorable Representative Adjong.
Okay, thank you very much, Attorney Eli Santos. It's important, Mr. Chair, that we get the documents that I am requesting kasi nakaala naman din po ito doon sa under section 11.7 po doon sa ayun po doon sa Universal Health Act, yung implementing rules and regulation po ng Universal Healthcare Act, no? That the PhilHealth, maaari naman pong kumuha ang PhilHealth ng institution na may valid trust license bilang external local fund managers, no? And I think that's the basis, legal basis for the PhilHealth to enter. But we just want to know exactly what was the result of that agreement, no? Why do you need to come up? Why did PhilHealth need to come up with hiring or purchasing these services from BDO? Gusto ko lang po malaman, Mr. Chair, Your Honors. So let me proceed po. Again, meron po bang investment guidelines o rules na naging gabay sa pag-invest nitong current funds na to, Mr. Chair? What
Yes,
are the
Mr.
guidelines?
Chair.
Kasi I was asking earlier which areas that you have invested your money into. But I just want to know exactly kasi when we talk about investment portfolio, it covers many things, including those guidelines. Mr. Chair, gusto ko lang pong malaman.
Actually, Mr. Chair, yes, we do have. In fact, we can furnish this honorable committee a copy of the investment guidelines within the day po.
Can you explain maybe briefly on what are the salient points
Yes.
under these guidelines that may require the attention for us to understand correctly? Kung
Sure
ano
po,
yun?
Mr.
Yes,
Chair.
Thank you.
Sure po.
Mr. Chair,
Yes, Mr. Lim Siaco.
maraming salamat, Mr. Chair. Honorable Representative Adjong, again, PhilHealth is following Section 11 of the Universal Healthcare Law, kung saan po tayo papasok ng ating investment po. Again, it's defined here, interest-bearing bonds, debt securities, interest-bearing deposits and loans, prepared stocks of any solvent corporation, common stocks, in bond securities and in debt securities. May mga nakaakibat din po dito na maximum amount of money na po pwede po natin ilagak sa mga investment windows po natin, kagaya po ng government securities. Hindi po siya not less, shall be at least 50% of the reserve fund. Ibig sabihin, hindi po siya bababa sa 50%, and we are complying this one because ang ating investments sa government securities ay umabot ng 76.26%.
Ano po yung 76 point?
76.26% of our investment portfolio ay pinapasok po natin sa government securities because ang sinasabi ng guidance po natin ay dapat hindi bababa sa 50% ang ilagay po natin sa government securities po.
Okay. But this guidelines that you're talking about, investment guidelines, dumadaan naman ito ng approval ng board, I'm sure of that. No?
Yes po, Mr. Chair, Honorable Representative Adjong. May
Yeah.
detalye pa po itong specific guidelines kada
Okay,
bawat isa po.
Pwede
Mr.
po.
Chair, yeah.
Yes, Press Mandy.
Sorry. Mr. Chair, just quickly, no, just wanted to add. So, kanina diba binigay ko yung breakdown. Nung binabasa po ni SVP Renet, we are also allowed to invest in equities and stocks, no, common stocks. Pero because of the riskiness of those investments, hindi po namin ginagalaw yung equities and stocks, even if we are allowed to, para lang mas safe yung investments, less risky. So lahat naka-treasury bonds or corporate bonds.
So wala pong investment ang PhilHealth ngayon sa mga stock exchange?
Wala po. Hindi namin po ginagalaw yan kasi mas risky po yun pera ng taong bayan. So just wanted to highlight that to this honorable committee po.
So
Thank you.
I guess there's no need for PhilHealth to hire for brokers, no? Wala naman po sa mga investment transactions ninyo.
Actually po, when I just joined, a year after I joined, there was a proposal for PhilHealth to invest a certain amount in common stocks and at the same time to hire a fund manager who we will be paying 5% to choose which stocks to invest in. So sinuggest ko, well, hire pa tayo ng manager and then mag-invest pa tayo, riskier investments, baka mawala pa yung pera. So I just suggested that we just stick to the plain investments of corporate bonds and
So time lock ito ng mga investments ng PhilHealth sa ngayon?
sorry po.
Time lock ito. You don't need to hire any brokers whatsoever. Because
Wala
it
po.
never changes. Wala.
Wala.
So you categorically say that there's no investment of PhilHealth in the stock exchange?
Wala po, wala po. At saka yung maturity, as I mentioned earlier, Mr. Chair, around up to 5 to 6 years, 0 to 6 years maturity po. Naka-time lock, yes po.
Naka-time lock nga siya,
Yes
di
po.
ba?
Yes po, yes, Mr. Chair.
So yung sinasabi niyo po, can we go back to your response kanina lang, just what you just said earlier, just now? Yung fund managers, ito po yung isa sa mga dinidiscuss ninyo or was it discussed in the board?
It was discussed in the EXECOM po.
In the EXECOM?
EXECOM, yes.
Okay.
Among internal PhilHealth EXECOM.
Would this be a same replica of the one that I just mentioned and asked you about the Banco de Oro?
No po. Sorry. I thought kasi po, remember I mentioned that PhilHealth is allowed also to invest in equities and stocks.
Yeah.
No? So sorry, nothing related to the Banco de Oro po. Kasi all three of us were not around when that happened po. So we will look into it po and just furnish your good office with a copy po of our findings.
Okay. Gusto ko po lang pong tanungin, and let me go straight to your audited financial statement, no, in 2023. Meron pong 580 million pesos which is lodged under identified as expenses for other professional services. May we know, would this be connected with hiring or procuring services for PhilHealth to invest its reserve investable funds?
Mr. Chair, Honorable Representative
Because you said
Adjong,
there's no need for PhilHealth to hire a middleman or broker in anything like that because you've never invested in a stock exchange, diba? Time
Yes,
lock naman yun eh. So
yes po,
can yes.
we gonna check our record, Mr. Chair. Tingnan
We have
po
now?
namin.
Meron po kayo?
Tingnan namin
sige
kung
po.
meron kaming dala po dito.
Okay.
Mr. Chair, if I can suggest, Mr. Chair, pwede balikan lang po natin. Pinapahanap ko lang yung record po namin.
Hindi, because that's material to my next question, Mr. Chair. I just want, let's give him time, Mr. Chair, to perhaps we can also may request for a 1-minute suspension. So para ano po,
1 minute suspension,
Thank
declared
you.
by the chair.
We are ready, Mr. Chair.
Committee hearing resumes.
Again, may I again ask if there's a copy of that, the one that I requested. Para ibangga ko lang po, Mr. Chair, dito sa notes na meron ako, sa datos na meron po ako. Yes, Mr. Chair, pwede po natin kilalanin si ano? Limsiaco. Okay.
Mr. Chair?
Yes, Mr. Limsiaco.
Opo, nakita po natin yung figure that Honorable Representative Adjong mentioned. Mr. Chair, this is the other professional services. Breakdown po siya ng MOE in the year 2023 in the amount of 580 million pesos, I mean. So ito po ay ang expenses po na incurred ng corporation in the hiring of job orders po,
Okay.
JO po,
Okay.
personnel
Okay.
na tumutulong sa ating corporation, our regional offices at sa head office in delivering the services po.
Gusto ko lang malaman, so this has nothing to do with how we manage our investment funds, no?
Yes
Just
po.
categorical lang po. Gusto ko
Yes
po
po.
malaman. We don't hire other extra service personnel to help us with how do we manage our investment funds. Tama po ba?
Yes
Tama
po,
ba yan?
Mr. Chair, Honorable Adjong.
Gusto ko yun lang
PhilHealth
po yung-
lang po,
Okay.
Treasury Department po ang mahawak po.
Okay. Kanina po, Press Mandy, you also mentioned about the investment po dun sa ano, no? Sa, I'm sorry, Ed, na-disrupt ko po ata yung ano nyo. Yung pag-invest niya sa time deposits, no? Nag-invest po tayo sa mga time deposits or dun lang po sa mga,
Yes po, Mr. Chair.
yeah.
We have, to give you the complete details, so we have special savings deposits sa land bank po, roughly around 64 billion. That comprises around 20% of our total investments. And the time, days to maturity ranges from 2 to 155 days po.
Mr. Chair, kasi meron din po ako ng kopya. Gusto ko lang po ipa-confirm sa PhilHealth.
Yes
no?
po.
Kasi basically, ang purpose naman ng hearing na ito is to brief us, no? So we would like to know the exact amount of each of the PhilHealth's funds, no? Yung investment funds. Gusto ko lang po malaman if it really coincides with the figures that I have. Anyway, ito naman po ay galing po naman sa audited financial statements po ng PhilHealth noong 2023. May na-invest po ang PhilHealth, no? Dito po sa datos ko, sa time deposits, no? Foreign time deposits po yung ano natin, bangko ang na-investan natin, nagkakalaga, I don't know kung asan dito, 135,604,790,55,000 pesos. I don't know if this is a deposit, time deposit. Yes.
Sorry, Mr. Chair. No, pinapako ko kasi, Mr. Chair,
These are all, I think these are both foreign in
Yeah.
foreign currency. And
No, understood,
currency.
Mr. Chair. The thing is, what the figures I'm giving you kasi, Mr. Chair, is as of December 31, 2024.
So
Kaya
that's
kaya hindi
more-
tayo nagmamatch eh. Oo.
Kaya that's
Hindi-
a more updated.
More updated,
Okay,
more
sige.
recent po.
Better.
Yes.
Oo.
Actually, maybe, Mr. Chair, we can give you a copy.
Yeah, please. Oo,
We'll give
para
you a
mas-
copy now, Mr. Chair, kasi this is more recent naman. And
Yes,
it's all
okay.
explained. It's just a one-pager.
Yeah. Paano po yung ano nyo, yung how do you arrive into deciding how much percent of the reserve funds that you will invest? May nagkakaroon po yan ng bidding in terms of which one offers a much higher rate, because I guess magmamatter po yung rate niyan eh, 'di ba? Kung sa may bidding din po yan kung sino po pwede mag-offer the best na magbe-benefit ng PhilHealth. So in terms of rates, how do you decide on that and how do you arrive into putting up this certain amount? Meron po kayong guidelines dyan or is it
Yes po.
decided by the
Meron
by
po.
the board? Sige po.
Yes po, number one, yung guidelines po, Mr. Chair, kung Representative Adjong, ay set up po siya and approved by the board yung ating palisiya. And ang pinalagakan po ng ating investment ay government securities. Kung may available po na po pwede po natin papasukan na investment sa government securities, yun ang pinapasok po natin because number one, sigurado po tayo because gobyerno yung pinapasukan po natin. On the part naman ng special savings deposit po, araw-araw po kumukuha kami ng quotation sa bangko. So dalawang bangko po to, government man ito, Land Bank at saka DBP, kung saan ang mas mataas na offer po sa atin, doon po natin pinapasok yung ating pondo. Yung special savings deposit po ay ang importante po to because any time of the day, kung may pangangailangan tayo
pwedeng
magbabayad, automatically yun po yung pambayad natin sa ating benefit payment po. Sa information po ng lahat po, this week po, 4.8 billion pesos po ang ating pinapalabas na pondo. Last week po, nasa 4.6 billion po yung pondo na pinapalabas po natin pambayad sa ating mga health facilities po.
Okay, ganito na lang po, Mr. Chair, para mapapabilis na po ang ating hearing. No? Anyway, briefing naman po ito. Nais ko lang pong mag-request nung nasabing mga dokumento. I think mas updated po yung kanila dahil kaysa may datos ng hawak ko po ngayon. Yung sa investment and time deposits, pwede pong paki-furnish ang committee na ito. Meron din po kayong investment securities, no? At yung sinabi niyo po kanina, Mandy, yung mga stock, yung bonds, treasury bonds, do you have also in the corresponding amount that you have invested?
Yes. I can give you the corresponding amount now, then we can give you to follow the breakdown of
Yes,
each
please.
specific bond. No?
Okay.
Sa corporate bonds, Mr. Chair, the total investment amount is roughly 16 billion. That represents 3.28% of total. No? And that's broken down to roughly 50% into properties and 50% into banking. Now, the breakdown of the specific company names, we can furnish you within the day po a copy, no? And how much per name, how much investment per name.
You also identified the Press Mandy at 3 areas, no? Sabi, mayroon pang pa yung banking,
So, Mr. Chair, special savings deposits, yan yung unang
Yes.
area. So, Land Bank tsaka DBP po. And then the second topic is the government securities po, broken down into treasury bills and treasury bonds po. Then the third one is corporate bonds, broken down into properties and banking po.
Okay. So, thank you very much. Expect lang po namin itong mga documents
Yes
na
po,
ito.
within the day po, Your Honor.
Okay. Now, let me go to another topic po, Mr. Chairman, Press Mandy. Kanina po nakikinig po ako sa pinag-usapan kanina. Yung questions ni Congressman Suan. Hindi lang ho ito limited yung kanyang issue within his district, but it is being felt all over the country. In fact, yung na-mention yung out-of-pocket expenses ng mga ating mga pasyente, talagang gusto natin ang PhilHealth ay maging responsive. Meaning to say, pag responsive ay yung talagang intensyon ng batas ng Universal Care Act ay maibigay natin. That's why napag-usapan nga po, nagkaroon ng medyo apprehension or yung fear ng ating mga publiko nung napag-usapan about the zero-subsidy. Tama ho ba? And I thank President Mandy for coming up with this statement na tama po ba yung pagkabasa ko dun sa statement ninyo na may enough funding naman ang PhilHealth despite the zero-subsidy para tugunan yung mga pangangailangan ng ating mga members at contributors at ating mga kababayan. Tama po ba?
Yes, Mr. Chair, that is correct. And just to add to that, we are financially healthy.
Yeah. That's the reason why I was premising my questions on how you manage the funds of all the members, no? Saan nyo nilalagay yung mga pondo? Kasi that would also spell out how financially, yung financial vitality ng PhilHealth para mag-responde po sa pangangailangan. Now, I'd just like to ask, connect ko lang po kanina sa questions po kanina ni Congressman Suan. Aware po ang PhilHealth ng mga cases where ang patient, kasi nangyayari po ito and I have talked with several of my constituents, pag sila po ay lalabas ng hospital and ask for a billing, pag hindi nila sinabi na PhilHealth, mababa yung medical bills. The moment that they mention that they are a member of PhilHealth, nag-iiba yung billing medical bills. Are you aware of this? Because this is something controversial. I'm
Mr.
talking
Chair.
about yung out 10%. Is that correct? Let me ask again, ASEC. Meron kang na-breakdown na percentage yung sinishell out ng government assistance doon sa ating mga pasyente, yung MAIP, etc. 10%, kumbaga kung 100, PhilHealth will be is paying 10 pesos.
Yes, Mr. Chair.
Yeah. So, if that would be the case, and with all these complaints that I'm receiving from my constituents, is PhilHealth aware of this? That once they request for a billing, for discharge, pag di-discharge po nila, pag sinabi nilang members sila ng PhilHealth, medyo tataas daw. I just want to know from PhilHealth, kung are they aware of these complaints? Do they know that there's some, I would call this exploitation ng ating mga pasyente? Can we hear from PhilHealth? What's the response?
Mr. Chairperson.
Mr. Attorney Santos.
Mr. Chairperson, Honorable Representative Adjong, I have heard reports, similar reports as manifested even before the effectivity of the universal health care, because at that time we have certain requirements for premium contribution before a member can avail of PhilHealth benefits. But at present, those similar reports are very rare, considering that everyone, all Filipinos, are already considered members and can avail anytime of PhilHealth benefits, Mr. Chairperson. But before the effectivity of the universal health care, there were reports. In fact, I received similar reports before, Mr. Chairperson. Honorable
So what did you
Representative
do with that?
So we
Complaints.
conducted investigation, Mr. Chairperson, Honorable Representative Adjong, but the reports turned out that indeed there was a difference, but still the patient or member was able to avail of PhilHealth benefits, Mr. Chairperson. Upon submission to the provider.
When did you hear about this complaint? How long ago?
Mr. Chairperson, Honorable Representative Adjong, I was investigator of PhilHealth Regional Office 11 until 2015. So there were reports, similar reports during that time. Again, before the effectivity of the universal health care. At present, I have not received similar reports, Mr. Chairperson, Honorable Representative Adjong, because of the universality of the UHC right now. All Filipinos are considered
But
members.
apparently, Mr. Chair, the same problems, ngayon lang sinabi mo in 2015, the same complaints and the same problems have reached the attention of this representation. That's why it's very alarming. I think the PhilHealth needs to do something about this. And maybe in the next committee hearing, I would require, Mr. Chair, a assessment or report on this, no? Kasi sabi mo, this has been happening ever nung panahon pa, pero Attorney Santos, nangyayari pa hanggang ngayon. So gusto ko lang po magkaroon ng konkreto na measures. Pina-investigate niyo po ba ito?
Mr. Chairperson, Honorable Representative Adjong, yes, sir. We conduct investigation on all complaints filed in PhilHealth, Mr. Chairperson.
Okay.
Honorable Representative Adjong.
Thank you. I think for my last two lang, Mr. Chair, just wanna, again, gusto ko lang po din tanungin kanina, yung...
In PhilHealth, Mr. Chairperson.
Okay.
Honorable Representative Adjong.
Thank you. I think for my last two lang, Mr. Chair, just wanna, again, gusto ko lang po din tanungin kanina, yung case rate po na sinasabi ni Congressman Suan at saka ni Congressman Janet Garin. Yung determination po, yung pagbabayad po nung klaseng medical services, base po doon sa, halimbawa, sa disease or sakit, no? Flat rate po ba ito? Halimbawa, kung pneumonia, tapos nag-avail ka ng isang medical assistance, first, yung based on yung licensing accreditation level ng hospital ay na-acquire lang niya is level 1. And then, kung halimbawa, yung packages na binibigay natin sa ibang levels of hospitals, flat rate lang ba ito halimbawa? Halimbawa sa pneumonia, kung halimbawa, for example, 15,000, the same lang din sa level 1, level 2, level 3 na hospitals, flat rate ito?
Mr. Chair, before I allow Doc Ish to give you the details of your query, I just want to highlight to this committee yung case rates. So there are total of around 9,000 case packages. Now, we did last year on February 14, we did a 30% increase almost across the board. And then last month, we did an additional 50% to the 30% increase almost across the board. Dahil compounded yan, that's a total of 95% increase on almost all of the 9,000 case rate packages. Now, with regards to your query, Mr. Chair, if I can ask Doc Ish to...
Maybe, yes, President Mandy, ang gusto ko lang pong malaman, I'm not asking you about the person. Kasi yung ibabangga ko ito dun sa out-of-pocket expenses ng sariling tao, pasyente. Halimbawa, tertiary level hospitals. Of course, we expect a more advanced in medical care, mas mahal kasi meron silang equipments, etc. Tapos, kung flat rate lang, halimbawa, pneumonia, 15,000, example lang. And then I availed of other services because tertiary level hospitals are more equipped with other services. They have far more advanced compared to the secondary, tertiary. Naturally, mas mahal yung ibabayad ng pasyente. Ang tanong ko lang, kung flat rate siya, at kailangan kung mas malaki yung out-of-pocket expenses na isang pasyente, hindi naman ako po pwedeng, or kung doon naman ako sa primary, yung pangangailangan na kailangan kong medical attention, hindi naman nila may bibigay. So wala akong choice but to go to a more tertiary level hospital. So gusto ko lang po malaman, what determines, for example, PhilHealth to decide on having a flat rate case? Kasi ang sa akin, naiisip ko, maybe we can rationalize it depending on the level of hospitals and the capacity of health facilities, so that hindi masyadong malaki. Halimbawa, kung pupunta ako ng isang tertiary hospitals, di ba? Para maramdaman na yung ating mga members, yung pinibigay talaga na serbisyo ng PhilHealth, para ma-cover nila. Kasi kung ang sakit ko requires me to avail of a more advanced medical, say for example, assistance, kung kailangan ko ng mga oxygen, halimbawa, etc. Dahil hindi naman yan available sa primary, sa infirmary, sa secondary. Natural, doon ako pupunta. Pero flat rate yung kanyang pagbabayad sa mga hospital, regardless whether you're primary, secondary, tertiary. So, kumbaga, have you ever decided maybe rationalizing the case, the expenses and the subsidies and the packages that you are shouldering for these patients according to the capacity of medical facilities?
Actually, Mr. Chair, that's an excellent question. Dr. Ish heads our health finance policy sector. He's in charge of all of these case packages. Doc Ish, can you address the query?
Yes, Mr. Chair. Yes, Representative Adyong. Our case rates po right now, as we rationalize, review, and expand, ang main dependency po natin would be the standard protocol and the standard treatment for any illness. Like what we did, for example, with the pneumonia, when we rationalized the rates for high-risk pneumonia, nakabase po siya doon po sa standard treatment and treatment protocols, kung ano po yung mga gamot na kinakailangan, kung ano yung mga laboratories na kinakailangan, at yun po yung kinost natin, and the costing came from the hospitals. Kung kaya't yun pong ating high-risk pneumonia right now is increased from 32,000 to 90,100.
So what you're telling me Doc, what you're telling me is that yung pag-subsidize nyo, pagbigay ng mga packages nito para sa mga pasyente, ay hindi siya flat rate?
Flat rate po siya, but ang basis po natin in coming out the rate
but that's the
is
point,
the treatment guidelines.
Yes, but that's the point that I'm trying to drive at. And kasi medyo mahal nga yung ibabayad na ating mga pasyente kung mag-avail sila ng services. Sino ba naman ang may sakit ng ayaw na mas magandang serbisyo, hindi ba? Kaya ka nga kaya ka nga pupunta kasi some patients have no choice but to avail of the services offered by the tertiary level hospitals simply because infirmary and first level I cannot afford that. They don't have the necessary equipments and the medicines na kinakailangan ng pasyente. So that's why they have no choice but to avail of the services in tertiary hospitals. If it's flat rate, then go back to the question of out-of-pocket expenses. Mas mahal ang binabayad na ating mga pasyente. Hindi yun yung ma-rationalize na lang yun to also include possibly yung consideration ng mga capability ng mga health facilities natin para naman maibsan yung out-of-pocket expenses ng ating mga pasyente. Maybe you can, this is a recommendation. Maybe you can decide on that. Is that a fair assessment? Or is that a bad suggestion?
Mr. Chair, it's not a bad suggestion. However, one of the principles under the social health insurance is, of course, the equity. And nakalagay din po sa batas that we should be paying for the minimum standards of care, of quality of
Anong
healthcare.
batas po ito?
Nasa atin pong UHC po.
Okay, which specific provisions in the end so that we can review?
I will provide, Mr. Chair, sorry.
I don't think the Universal Care Act wants to at least
Yun nga, hindi ko alam sa minimum standards. Check mo lang kayo.
limit the packages or to kasi that would tantamount in that's the opposite. I think what you're saying is the opposite of the intention of the UHC. Kung if I get what you're driving at, yung point po. Kasi ang intention talaga ng Universal Healthcare Act is para matulungan ang karamihan sa ating mga, nilang matulungan pero at least maibsan yung out-of-pocket expenses po niya. Hindi ba yun ang pinakaspirito ng Universal Healthcare Act? Hindi ba?
Yes, Mr. Chair. That's why po, yung katulad po dun sa binabanggit ko sa pneumonia, ang atin pong magiging case rates is based on the treatment protocols. At yun pong ating costing na ginawa po is coming from the secondary and tertiary hospitals na kung saan sila po yung naging basis ng coming out with our healthcare cost. Kaya po lumabas na ngayon na 90,100 yung ating benefit.
I'll give you a specific example po, President Manny, para po ma-consider ninyo itong suggestion ko. Galing po ako sa isang rural area sa Mindanao. Karamihan po dyan, baserte po kami, may Pakpak Medical Center, but I'm talking about 39 municipalities. Ilan lang po mga first level hospitals dyan. The tendency is that, minsan, yung flat rate kasi, yung mga first level hospitals, hindi na ho sila mag-avail ng accreditation for second level because pare-pareho naman ang bayad natin eh. Pare-pareho naman yung package na binabayad. So sometimes it becomes a deterrent for this hospital to upgrade its services, which is detrimental to the health requirement and demand of those yung mga constituents. Yun po yung nangyayari sa akin. That's why I'm suggesting to PhilHealth, maybe you can also explore more on how we can assist the patients doon sa issue ng out-of-pocket expenses. I don't know how you can go about with this, but I think this is not a bad suggestion. Would you consider this as a fair assessment?
Actually, Mr. Chair, it's not a bad suggestion. In fact, it's actually a good suggestion. So, Mr. Chair, maybe we can discuss this internally. We'll take a closer look into it. Actually, we welcome all inputs and suggestions and comments. No, so we hear you. We hear your suggestion. It sounds, to me personally, it sounds like a good suggestion. So maybe we will discuss it with the team and look into it and see how we can move forward with your suggestion, Mr. Chair.
Thank you very much, President Mandy. Paki-ano lang po, paki-cite po yung specific provisions under Universal Healthcare Act po para ma-review natin. Baka naman din may limit din ng batas, di natin alam kung paano natin ma-explore yung possibility na ganun. Thank you po, Mr. Chairman. Thank you po, PhilHealth, for
We look into it, sir. Mr.
Thank you
Chair.
very much.
Thank you. The next interpellator is Congressman Ortega.
Thank you, Mr. Chair. Magandang hapon po sa ating lahat. Alam naman po natin na kahit ano pong preparasyon ng budget, syempre, it takes good fiscal management po. No? So, naiintindihan po natin na importante po yung paggamit ng pondo, yung utilization rate / yung burn rate po natin, naiintindihan po natin. Sir, Mr. Chair, with the indulgence of our chairman, maaari po ba natin na i-request po para sa isi-schedule po natin na committee hearing natin na makuha po natin yung comparative na utilization rates po for the past 6 years, Sir Mandy, yung previous administration saka yung current administration for the past 3 years para ma-compare po natin at saka makita po yung utilization rate po ng bawat taon. Kasi nga po, if I may read lang po, yung sa deliberasyon po ng proposed 2025 budget po under DOF Secretary Ralph Recto ay nasabi po na pati yung past administration opted to utilize the PhilHealth funds opted na imbis na gamitin po ay humiram po tayo ng pera ng previous administration. So parang ang unutilized funds po ng previous was amounting to 89.9 billion. So maganda po na makita to. Siguro when we present this during the hearing, parang table lang naman po, comparative lang po siya na table. Kasi I think that's where the problem was nung nag-decide po na hindi mabigyan po ng pondo itong PhilHealth for the next year. Siyempre, titignan mo po kahit anong budget pa po yan, kahit anong pondo naman po yan. Kung hindi nagpe-perform o nagamit ng maigi, doon po talaga nagkakaproblema kasi nagdadalawang isip sila kung kailangan pa bang bigyan ng pondo itong organisasyon na to o itong department na to, hindi naman nila magamit na maigi yung mga pondo. Sir, hindi ko na po dadagdagan yung mga questions ko kasi some were already taken up kanina. But again, may I request po sa COMSEC na rin na ma-prepare po yung documents na yun so that we can see. Parang may matrix po para mas madali pong ma-appreciate yung susunod po na hearing natin.
Yeah. Mr. Chair?
Yes.
Yeah. Thank you, Mr. Chair.
President Ledesma.
Yes, we will be prepared to present it in the next committee hearing. And also in line with that, Mr. Chair, we can submit already to the this honorable committee. For the next hearing po, submit na namin. So basically, just to clarify, Mr. Chair, it's 6 years utilization rate, no? So during the 4 years of PRRD and then the 2 years of PBBM, no? We will comply, Mr. Chair. Thank you, Mr. Chair.
Yes, sir. Thank you, Mr. Chair. That's all.
Thank you. The next interpolator is the Honorable Rodriguez. Gutierrez, sorry.
Thank you, Chair.
Honorable Gutierrez.
If I had the charisma of the good congressman from CDO, okay na rin po sana. But good afternoon po, PCO Ledesma and of course our SVPs together with our COO. Just a few questions lang po, no? I was hoping to ask our COA representatives because of course we're going throughout although this is not budget review anymore, but it was stemmed from the removal of the subsidy po, no? So we really wanted to get into the finances. But unfortunately, wala pa tayong representative COA. So I'll just make this very brief. Just a few points lang po siguro. First and foremost, coming from where Kong Adyong was coming from, I'd just like to ask, from the options, you've selected only 3 areas po. And I'm sure they're very competitive. You wouldn't settle for anything less. These are all tax-free po ba?
Mr. Chair, to answer your question, yes on all. However, on the corporate bond side, we're just double checking. But definitely on the special savings deposits, on the government securities, treasury bills, lahat po yan tax-free. Kaklarify po lang namin yung sa corporate bonds.
Maybe we'll just find,
Yes.
if you could ask your people po siguro, and you can
Yes.
just update us later.
Yes.
We'll move on to another
Will
point.
do, Mr. Chair. Thank you.
PCO, so tax-free naman po mostly. And tama ba the percentages that you mentioned earlier was that for the savings? So yung savings pa natin yung parang time deposit. And yet this is, I'm quite confused because under the UHCA, we have our reserved funds. Tama po. And anything, this is supposed to be for the 2 years reservation. Anything that is not spent, yun na po dapat yung investment fund. Now, based on our contributions, it's around 200 plus billion, tama po, no? And the expenses we're basing po kasi on 2023, that's what I have. So I hope you'll bear with us, it's not the 2024 AFS that you have. So for 2023, it was around 180 billion yung cost. At that time po, ano po yung 2-year reserve fund estimate po natin for 2023? Tama po, no? The UHCA, the Universal Healthcare Act was already in place. 2018 pa lang po, that was signed into law,
Yes,
no?
Mr. Chair. Yes.
So by then, we should already have had an estimate kung magkano po yung reserve fund
Yes, Mr.
at the
Chair.
time. Okay.
Mr. Chair, our reserve fund actually December 31, 2023, we are using the provision of Section 11 sa UHC that the reserve fund is based on projection, 2 years projection.
2024, 2025. Tama po.
If this is 2023, 2024, 2025.
Correct.
Now, the projection of our actuary, we have here our actuary, that's 560 billion pesos. So,
Okay.
560 billion. So, our reserve fund na naka-reflect sa FS ay 464.3 billion pesos, Mr. Chair, Kong Representative Gutierrez.
Apo. So 560 yung actuarial estimate nyo na 2 years. Yung reserve fund is 464.
Yes po.
Shouldn't it be equal to yung 2-year estimate po ninyo?
Hindi pa
I mean,
po kami-
although without granting that we agree with the 560 billion, kasi I remember very vehement reactions na mali po yung estimate po natin. We shouldn't treat this as life insurance. This is a pay and go, if I understand the terms last time correctly. So without assuming yet na correct yung actuarial, if 560 po yung estimate natin, the reserve fund should also be 560 po, no?
Yes po, kulang pa ho kami, hindi pa kami umabot sa 560
Di kayo umabot. So, your premium collections did not exceed the reserve fund. So, hanggang 464 lang yung, the reserve fund would come from premium collections only, or this also includes from investment,
premium income and investment income minus the benefit payout, benefit expense, admin expense, ay ang sobra natira, that would be go to our reserve po.
so you deduct po muna before pegging kung magkano pa yung reserve fund.
Yes po.
But yung ceiling would have been 560 billion if
Yes
the
po.
actuarial was considered accurate.
Yes po.
So at the time po, for 2023, for 464, this was already premiums plus investment. May we know po magkano yung premiums na pumasok and magkano po yung investment? How do you call them? Profit po ba or return?
Mr. Chair, for year 2023, our premium income amounting to 236.2 billion and our investment amounting to 21.5 billion pesos, Mr. Chair.
And at the time po in 2023, were you also adopting a, how do we call it, conservative approach? This was all, what did you call it? The first savings? You had a term for that, no? It's out of the three po. No?
This one, Mr. Chair, because this is income statement, we are adopting the accrual basis of accounting, Mr. Chair.
I mean,
the
at the
term, sorry, Mr. Chair, the term is special savings.
Special.
Depo.
There we go. Thank you. Thank you, PCO. He understood exactly what I was going for. So, yung at that time po in 2023, yun pa rin yung strategy natin. It was special savings, T-bills, and then yung corporate bonds.
Yes po,
Tama po.
Mr.
And it
Chair.
was roughly around the same percentage, no? It was 20%, 76%, 3%.
Yes, more or less similar, Mr. Chair. And during that time, our investment portfolio ay 498 billion, Mr. Chair.
Okay. So this has been the strategy of the administration of PCEO Ledesma, which I personally appreciate. I'd rather that we have a conservative approach to this. But and you see for the foreseeable future, for as long as during your tenure, you think we will be adopting a conservative approach?
Most definitely, Mr. Chair.
Okay. So with that conservative approach at this rate, 21 billion yung nakuha po natin for investment plus yung premiums of 236. am I missing an income there? Because 236 billion premium contribution and 21 billion investment is only 277.
Mr. Chair, the net income ng 2023 is amounting to 174 billion. This 174 billion, because we have the adjustment in our benefit expense due to the IBNR calculation ng PhilHealth. So supposed to be our benefit expense amounting to 116 billion, but due to the calculation and adjustment in the year 2024, batay rin sa calculation of our external actuary, we recorded the benefit expense of 74 billion, Mr. Chair. That's the reason why net income natin ay 174. This 174, pumasok po siya as part of our reserve fund, Mr. Chair.
So you mean to tell me the reserve fund is ongoing?
Yes,
Kapag
po,
meron na
continuing po.
pumasok na reserve fund for this year, next year may ibang calculation for reserve fund, you will add them together?
Yes po, this would be accumulated, Mr. Chair, Honorable Representative Gutierrez. Ano po siya, nagko-accumulate po siya, depende on the results of the operation of the corporation.
Perhaps I was mistaken. We'd have to review the intent of the legislation. But my understanding was if you have the 2-year actuarial for this year, that would be just a ceiling po, no? Then whatever you don't spend will be used in investment. I assumed it would be short-term investments, which come the next year would now be applied to the fund that you already have. Hindi na siya reservation. You have to apply under the ceiling ulit. That isn't what we're doing.
Mr. Chair,
At this point,
Gutierrez.
sorry, before I may train of thought is lost, this means eventually magsusnowball lang po yung investment po natin.
Sir, ang sistema, year 2024, because of the special provision of JAA, we recompute our reserve fund to 280.5 billion pesos. So mayroon na siyang surplus ngayon that we are saying at 150 billion pesos by October. Now, on the side po ng investment po natin, meaning ang 280 na reserve fund, mayroon na siyang nakatapat na investment portfolio dito, same amount, and then the surplus natin na 150, mayroon rin siyang katapat na investment po dito because our investment as of December 31 nga, nasa 492 billion po. So now, kung with this calculation of our reserve fund, papasok po yung sobra ng income to our expenses to the surplus. Not anymore 150, but as of December 31, we are just completing our financial report. Doon po siya papasok ngayon.
And the surplus beyond the reserve fund is supposedly what would be used to either reduce contributions or expand
Increase.
our packages, which,
Yes.
to be fair with this administration, is what you're doing.
Yes po.
This year, I heard you have expanded packages as
Yes
early as
po.
this month pa lang po, no?
Yes po.
Or January. So to be fair with it, but I think this was the point that was disagreed upon during our last hearing, no? With the computation po, no, ni Congresswoman Kimbo. But we'll leave that for next time once we have the actual numbers. Kasi ako rin po nalilito doon. But anyway, going back na lang to the principles po, no? So, the decision-making process of PhilHealth, you've already cut out the brokers. Although in principle, you can employ brokers. Tama po.
Yes po.
And brokers are purely for stock or do they apply for are there brokers rin po for these other 3 areas? For example, sa T-bills, sa corporate bonds?
Actually po, for corporate bonds, if we were investing even in lower, kasi we only invest in AAA bonds or better. If there were lower than that, maybe we could hire brokers. But for AAA bonds and higher, it's not necessary, Mr. Chair.
So this is purely, this is just a direct investment by the board, I suppose. You decide on this?
Yes, Mr. Chair.
And do they, I'm not sure if it's the proper thing, do they go through bidding or they just give competitive offers? Do you solicit to all AAA?
Yes, like what Sir SVP Renette mentioned earlier, we accept proposals from all of them, and then we determine it based on who gives the highest rate of return, sir. So both, whether it's deposits or bonds, yung pinakamataas na rate, dun po namin binibigay po.
And so how many groups of companies? I know the different proposals might come from different corporations, but at least if we group them into their conglomerates po, no? So we have the general conglomerates, we know that naman po, no? How many have participated po by submitting proposals to PhilHealth?
So I know we have, well, 2 categories is banking and properties. So Sir Renette, for banking and properties, roughly how many conglomerates or companies, please?
Mr. Chair, Sir PCO, maraming salamat. Mr. Chair, on the part of our corporate bonds, we have DBP, we have SM Prime, and I'm not mistaken, Mr. Chair, Robinsons. I'm not mistaken kung nandiyan pa yung Robinson, but sigurado ako SM Prime is part of that schedules of ours on the corporate bonds. I'll check, Mr. Chair.
Yes, please. Apologies, I meant to ask po yung nag-propose po, no? Not just yung accepted offers. Because if I'm not mistaken, in your AFS for 2020, AFS, yung COA report for 2023, you even had Ayala. You had some Ayala, I think it was real estate pa nga po eh. So we'd like to know po how many conglomerates have participated by giving you proposals since the start of your term. Perhaps we'll just ask this as a document na lang po, no?
Actually, Mr. Chair, we will, sorry.
Yes.
Actually, Mr. Chair, yes, we will furnish with you that. But I just want to let you know, we have very good relationships with most of these conglomerates. So actually, the number is a huge number. But we will give you the exact number, Mr. Chair.
Thank you, PCO Ledesma. We just want to make sure po na we have an idea now. There are some perceptions po, no, that there are favored conglomerates, there are favored personalities, and we'd like to debunk that if, you know. So we'd like to see po talaga how many proposals have we received, what rates were offered, and being an attached agency, being a GOCC, I'm sure this should be available to the public naman po. No? So we'd like to request that po for this committee na lang. No?
Duly noted, Mr. Chair.
Thank you.
We will comply.
My next question naman po would be in relation po na, a question by Congressman Adyong was yung investment guidelines as required by the UHCA. I understand we don't have it on hand with us now and that you will be submitting to this committee. I likewise would second that request that we be furnished. Is this the same as yung ating PhilHealth CO number 2023-0050? Is that the investment guidelines po?
Mr. Chair, Honorable Gutierrez, sorry po, wala kaming dalang reference. Maybe we can see the document po so that we can confirm po.
Sige, I'll quote it to you na lang po, no?
Yes
Because
po,
I'm
sir.
reading from the COA report. So
Yes
for
po.
2023, which I believe your office received, it was addressed to PCO Ledesma in September 11, 2024. So tapos na po to. This is talking about 2023.
Yes po.
And I was going to go into yung recommendations. And one of them was to revise or amend the PhilHealth CO number 2023-0050 and any other related PhilHealth issuances to ensure that the investment of the unused portion of the reserve fund occurs only after prioritizing the projected program expenditures, expanding benefit programs, or decreasing of the premium contribution. So I wanted to know po if itong binanggit na PhilHealth CO number 2023-0050 is yung investment guidelines po natin, or is this some other internal document?
Mr. Chair, Honorable Gutierrez, this corporate order number 2023-005, this is PhilHealth guidelines po. This omnibus guidelines on fund investment po, revision 2, Mr. Chair.
So this is what the UHCA was referring to as yung mandated na investment guidelines.
Yes po, Mr. Chair.
Okay. May we ask for this specific version also for this committee? Because I'd like to look into what the COA found. They did not agree with the PhilHealth in terms of the prioritization before the expenditures that came before the reserve fund. If I understand correctly, that was one of the recommendations po. No? So we'd like to request that document.
Noted, Mr. Chair.
Thank you. Thank you, SVP Limsiaco. And again, as I mentioned, wala po yung representatives natin from COA. We were going to ask, but what kind of coordination do you have po with COA in relation to? Because, do I understand this correctly? The pinaka-top official, of course, is the PCEO, but you answer to the board. There you have the chairman, which is the Secretary of Health. And how many members do we have in that board?
It's a 13-member board. I sit as vice chairman, and then DOH Herbosa, Sec Herbosa, sits as chairman.
Thank you, PCEO.
Then we have like six ex officios, and then sectoral and expert panel. Thank you, Mr. Chair.
Thank you. So it's a large board, but when you have board meetings, you don't go into the nitty-gritty of the financials po, no? This is mostly executive level. Your decisions on which bonds to invest in, the percentages that you would deem acceptable returns, this is usually in the executive level.
Yes, sir. Yes, Mr. Chair.
Who reviews your decisions po? is there a governing body? Is the GCG involved, for example, in vetting your decisions on where?
Mr. Chair, Honorable Gutierrez, our investment portfolio is one of the largest, biggest account in our balance sheet. Mr. Chair, this one is being reviewed by the Commission on Audit, Mr. Chair.
So it's directly to the COA lang
Yes,
po. There's no intervening body, wala kayong special committee to review. So, yes.
On the part ng investment po natin, we have the risk committee, of course, on the part of the board. But on the part ng implementation po, we have the Treasury Department, the fund management sector, reviewing our investment document every day. May mapasok po tayo na place natin, particularly for the SSD po, Special Savings Deposit po.
I see. So, despite being GOCC, you're still answerable ultimately to the COA.
Yes,
There's no intervening body. And your coordination with COA, is this only yung yearly report po natin, or do you have quarterly meetings or quarterly reportorial requirements?
Mr. Chair, Honorable Gutierrez, I am happy to inform the body, Mr. Chair, that with PCO Ledesma, we have the strong relationship with the Commission on Audit po. Set up parati po yung meeting para po ma-trace out yung mga accounts po natin, maayos po yung preparation, including the system audit findings of COA, ay in-address po ng corporation. And we have the sharing of information, Mr. Chair, particularly yung mga bagong palisiya na in-implementar ng corporation so that we have the same level of understanding on the part of the Commission on Audit that conducting the verification, the audit of PhilHealth accounts, Mr. Chair, not only at the central level, but including, Mr. Chair, at the regional level, Mr. Chair, Honorable Gutierrez po.
Thank you, SVP. While I do appreciate yung real-time coordination po ninyo with COA, I'm just curious about yung effects of that supposed coordination. Because I'm sure you're well aware in 2023 COA report, there were some recommendations. I just wanted to highlight 3. If you could please update this committee on your actions po, no? So the first is to prioritize the projected program expenditures for the next 2 years before investing the unused portion of the reserve fund pursuant to Section 11 of the UHC. Number 2, revise or amend, this is what I read earlier, revise or amend PhilHealth CO number 2023-0050 and any other related PhilHealth issuances to ensure that the investment of the unused portion of the reserve fund occurs only after prioritizing the projected program expenditures, expanding benefit programs, or decreasing the premium contributions. And the third is directs the Actuarial Services and Risk Management Sector, ASRMS, to coordinate properly with the Treasury Department by regularly providing a report which includes the actuarially estimated 2-year program expenditures to ensure that PhilHealth's investment transactions strictly adhere to the UHC. I would assume that there was some result of this because binago niya nga po ninyo yung original 500 plus billion reserve fund, you've lowered it now to 260 plus, no? So maybe just have an update on these findings.
Yes, Mr. Chair. Of course, we are following the Commission on Audit and our Treasury Department doing the compliance of this one, Mr. Chair, so that it can be addressed by the corporation. Of course, we are prioritizing, Mr. Chair, yung mga pangangailangan ng korporasyon para sa kanyang benefit payment, Mr. Chair. That's the reason why our money, we put 20% of our money to the special savings deposit because any time of the day na pangangailangan natin pambayad ay readily available po siya, Mr. Chair. And of course, on the coordination with the risk management, the actuarial office, Mr. Chair, we are closely coordinating with the Office of Mabneri on the risk management, Mr. Chair, so that maayos po ang ating pagtrabaho in terms of putting the money na ma-secured po siya as this is the direction of the board, direction of the PCO Ledesma, Mr. Chair. Thank you.
Thank you, SVP Limsiaco. While I do appreciate that, not just sentiment po, no, but I'm sure those have concrete actions. I don't think they answer po, no, point per point, the recommendations of the COA. We'd just like to ask po na lang a submission of a report siguro from from PCO, please, to the committee, yung point by point. Kasi I think this is especially it's a special area of special concern po sa amin, yung reserve fund, because this is really goes into the meat of the Universal Healthcare Act and how do we interpret it. I understand, of course, to an extent, PhilHealth would prefer a larger reserve fund, Not naman to say that you would prefer higher investments, but I'm sure you'd like to, more safety po, no? But on the other hand, sa amin po as representatives of our different constituencies, we would prefer a lower reserve fund kasi po hindi po nararamdaman yung benepisyo. We'd like either better packages or we put into act po, no, Section 11 of the UHC to really either expand benefit coverages or to lower yung premiums po natin. Para at least maramdaman po ng taong bayan yung mga ginagawa po ninyo sa PhilHealth. But in addition to that, just as a last point na lang po, no?
We will comply, Mr. Chair. With
Thank
your
you,
request.
PCO. Just the last point po, no? Just reading yung letter to PCO Ledesma from the Commission Audit. This is by Attorney Hanaban. One of the things po that's troubling, at least for this representation, is yung consent finding. Although it does not, it still is a qualified opinion. Pero yung palaging yung inaccuracy daw po ng data na nakikita. There are many paragraphs here that consistently say that that put into doubt the completeness and accuracy of the contributions in premium receivables, that they doubt the faithful representation of premium contributions, cannot be ascertained due to different deficiencies. They also made mention here of the premium receivable from direct contributors were overstated. And I think we've had an example earlier today when si Congresswoman Luistro pointed out po, no, the table that you presented us on how you came up with the previous report of 56.8 billion po ba? 59.8 billion po ba yun? Na, 0.6 na RTH plus denied, when in fact, when we took a look at the table that you presented to us today, even if we try to match it, there was a difference of 400 million or so. And that 400 million, I'm sorry, I know you didn't mean it, SVP Limsiaco, but we can't just attribute this to just minor differences. Kasi po, that's 400 million of services that we're talking about. 400 million in medicine, 400 million in other aid that we could afford to our contributors, both direct and indirect. So, although it might seem small when you compare it to your investments, buhay ng tao po yung pinag-uusapan dito. So I hope we can present a more accurate picture of what is going on in PhilHealth po, no? So with that, Mr. Chair, I'd like to yield to the next interpolator. Thank you very much po, PCO and the PhilHealth family.
Thank you, Mr. Chair.
Thank you. The next interpolator is the Honorable Janet Garin.
Thank you, Mr. Chair. I believe the essence of this hearing is actually the briefing on the zero subsidy in the 2025 national budget. May I inquire, Mr. Chair, to PhilHealth, in the previous years, let's say if we backtrack the past 15 years, nagkaroon po ba, di po ba ang subsidy na binibigay ng national government is for the payment of premium ng mga members na hindi nakakabayad? Tama po ba?
Yes, Mr. Chair.
And this will cover sino-sino po, Mr. Chair?
Mr. Chair, it will cover senior citizens, indigents, NHTS, and hindi ko makita.
Pamana?
Pamana, sorry, ang liit ng font.
Yes.
Pamana, ma'am, and what is this? Wala. Pamana would be the last one, Mr. Chair.
Yes, so it's seniors, indigents, NHTS, at saka Pamana.
Pamana, yes, Mr. Chair.
When we say indigents, are these the 4Ps and the NHTS? Ito bang NHTS at indigents? Ito rin po ba yung mga 4Ps under DSWD?
Mr. Chair, can I ask Sir Lem, our head of MMS membership, to address the questions, please? Sir Lem, can you?
Mr. Chair, Madam. Yes po. Ito
Please
po
state your name.
I'm Lemon Untalan. I'm the Vice President for the Member Management Group. So ako po yung charge sa enrollment sa
Okay.
National Health Insurance Program.
Okay, Mr. Untalan, you are recognized.
Thank you very much pa. Yes po. Lahat po ng listahan coming from the DSWD, lahat yung listahanan, ito po yung National Health based on the National Household Targeting System.
So the indigents, the NHTS, is based on the DSWD listing, Mr.
Yes,
Chair.
pa. Kasama
Will
po-
you agree with me in saying that this is a moving list? Ibig sabihin, kung may namatay, natatanggal sila sa lista. Tama po ba?
Yes, yun pong yung listahanan po is snapshot po as we have learned. It is conducted every 4 years. Ang moving po dito ay yung pantawid beneficiaries. And yes po, na yung list po, possibility kasi affected po yung list for 4 years. So possibly po, within 4 years, meron po namatay doon sa listahan binigay po sa amin.
So ibig sabihin, Mr. Chair, kapag merong namatay at hindi na siya, syempre, tatanggalin siya dun sa 4Ps. Ibig sabihin din, yung premium nung taong yon, ang kasama yung kanyang pamilya, ay natatanggal din, supposedly, sa lista ng PhilHealth.
Tama po kayo.
Okay. Kapag naman pantawid ka, at ikaw ay nakatawid na, I believe there's like a certain number of years where you are allocated the monthly subsidy. Yung iba naman pag may anak na nag-aaral, kapag na-graduate na yung anak, or nalagpasan mo na ito, di po ba natatanggal ka rin dun sa lista? Tama po ba?
Honorable Chair, tama po. Sa pantawid po, because of that conditionalities na hindi na po siya, yung kunyari po, this year, meron po siyang isang pantawid beneficiary, may below 5, pero next year's nag-upgrade na, tumanda na po. So, possible po na mawala na po sa listahan.
At di po ba, Mr. Chair, merong iba, kunyari 4Ps ka, tapos nalaman na meron ka na palang magandang trabaho, or nalaman na marami kang bisyo, umiinom ka, nagsusugal ka, di po ba natatanggal sa listahan? Tama po ba?
Tama po kayo kasi every year po, nagbibigay po ng
Meron
panibago.
silang evaluation.
Opo.
So kapag natatanggal sila dun sa list, paano po yung kanilang premium sa PhilHealth?
Dahil po every year, binibigay po nila yung updated list of pantawid beneficiaries. So hindi po siya...
So in simpler terms, pasensya na po kasi may iba pang magtatanong, paano po ang kanilang bayad sa premium? Kung wala na sila sa listahanan o sa pantawid, ibig po sabihin ay natatanggal na rin sila dun sa lista na binabayaran ng national government in terms of premium payment.
Tama po yun, Mr.
Okay.
Chair.
Just to laymanize, Mr. Chair, yung premium hindi po ba yan ay bayad sa enrollment?
Tama po yun.
Okay. So moving forward, how about the senior citizens? Hindi po ba na ang senior citizens, merong iba dyan, syempre nagtatrabaho, may sariling negosyo, o yung mga lifetime members sila, kasi marami naman tayong working senior citizens. O yung iba, let's say, nagiging elected official, or kagaya ng ating mga kongresista na senior citizen, di po ba yung premium nila ay sariling nagbabayad ang kumpanya, o yung employer, or sila mismo kapag self-employed? Tama po ba?
Mr. Chair, tama po yun until they have reached the age of retirement. Kagaya po ako, 63 years old, I'm already a senior citizen, so I continually pay my premium. Hati po
From your employer
Yes po.
and you.
Yes
So
po.
ibig sabihin, kunyari, ilan ba yung senior citizens ngayon based sa PSA? It's 7.7 or is it 8 million?
Based po doon sa
More?
recent po na census na binigay po sa amin, roughly umaabot po ata ng 11 million yung Filipinos who are 60 years old and above.
Okay, so we have 11 million senior citizens. Tama po ba ang sinasabi ko na kapag pinag-uusapan ang subsidy na galing sa national government, kapag pinipresenta po ng PhilHealth, ang presentation po ay based sa number of senior citizens, kagaya niyan, 11 million. Number of indigents, kung ilan yan. Number of pantawid members, listahanan, at yung mga nasa NHTS, at yung pamana. Tama po ba?
Tama po, Mr. Chair.
In other words, it is an estimated number.
Tama po.
Kapag naibigay na yung subsidy ng national government through the Department of Health, nagsisimula na po yung enrollment ng PhilHealth by using actual names and actual people. Tama po ba?
Tama po kayo.
Kunyari, meron kang senior citizen. Let's say sa 11 million, meron dong 5 million na nagtatrabaho pa. or may sariling negosyo at sila ay amo at nagbabayad din, ano po ang nangyayari doon sa kanilang subsidy? Yung pong subsidy ng gobyerno na dapat gagamitin sa pag-enroll sa kanila.
Mr. Chair, usually po yung gainfully employed, existing policy po na sa IRR na kinoconsider kahit senior citizen, they continually to pay. So po yung kanilang dapat allocation ay, kunyari, for the 11 million less the gainfully employed, pati po yung mga lifetime member, yun na lang po yung hinihingi namin for sa subsidies.
So let's simplify it. No? Ulitin ko po yung tanong, Mr. Chair. Nagbigay ng subsidy ang national government para sa 11 million na senior citizens. Subalit, meron dong working, meron dong self-employed, meron dong lifetime members, yung bang subsidy na para sa kanila. Ang tanong ko, ibinabayad ba ulit yung ginagamit ba yon pag-enroll sa kanila o hindi na? Kasi meron naman silang sariling enrollment.
Mr. Chair, hindi na po ginagamit sa kanila because it is a lump sum.
Ibig sabihin, eto si Juan, senior siya, pero nagtatrabaho siya. Yung employer niya nagbayad ng PhilHealth premium, pero kabilang siya doon sa sinisingil supposedly ng PhilHealth na enrollment naman na government subsidy kasi senior citizen siya. Hindi po ba nabawal ang double enrollment? Ibig sabihin isang tao i-enroll 2 times or 3 times?
Yes po.
Okay. Bawal po yun.
Bawal po yun kasi sa proposal po namin, ito po kunyari 11 million po yung senior citizens, tinatanggal na po namin yung mayroong gainful employed during a cut-off. Kunyari, last year...
When did this start na tinanggal mo?
Basically po, during our proposal to DBM, for Filipinos who are already senior citizen, yung proposal ho namin, tinatanggal na po namin yung base sa database namin na gainfully employed tsaka lifetime.
But when did this start? Anong taon po ito nasimulan na medyo nalinis na yung datos? Is it not that it was just recently?
Apparently po, mga past 3 years po.
Okay. Pero, nagsimula po ang ating Senior Citizens Law, correct me if I'm wrong, was it sometime in 2014?
Na-approve po siya way back 2015 po. Late December po yun.
2015,
2014 po, tama kayo.
Okay.
2014, last quarter po, signed into law po yung...
So, napirmahan yung batas ng senior citizens 2014. Pero di po ba, Mr. Chair, maski may batas na, kailangan ng IRR or Implementing Rules and Regulations. Kailan po nagsimula ang IRR ng Senior Citizens Law?
If I remember po, mga early 2015 po yun.
Tapos na siya? Or was it in 2000?
Kasi po, it was signed into law in late 2014, last quarter
September
po.
of 2014, to be
Tapos
exact.
may IRR po yun. Ang lumabas po sa amin na circular is about late that year din po.
2015. Okay. And when we talk about the budgetary processes, Mr. Chair, hindi po ba kapag pinag-uusapan ang budgetary process, kapag ginagawa mo ang budget, ay that's for the succeeding year. At ito ay sinisimulan between the months of March and April. Usually March nagsisimula. Ibig sabihin kung yung IRR ay nagawa noong 2015, pero napag-usapan na yung batas. Kasi 2014, inapprove yung batas. 2015, may RRR. Hinabol. O, lagay na natin 2015 para umatras, although it was 2016. So, dahil may IRR na, dun ka papapasok sa budgetary requirements. So, magpro-propose ka pa sa DBM at dun pa dadaan hanggang kabinete, hanggang Kongreso at Senado. Subalit, kung kunyari nangyari ito, natapos na yung proposed budget or yung tinatawag natin na NEP or National Expenditure Program at hindi siya nasama doon, so maghihintay na siya sa next year. Hindi po ba ganon? And that's very basic to the members of Congress who are actually involved in the budgetary process. Ang tanong, Mr. Chair, kung kunyari na pondohan yan, sa taon na napag-usapan na at napasok na ng DBM, pwede ba yung retroactive membership? And maybe I can address that to Dr. Ish Pargas, who was active during those times.
Dr. Pargas.
Mr. Chair, I am not so sure membership.
Pakiulit po, Mr. Chair.
Mr. Chair, I am not so sure if there is a retroactive membership.
Because, Mr. Chair, definitely there is none. No, para lang po malinawan. Ang nangyari po kasi sa PhilHealth, nung inapprove pa lang yung batas, inapprove pa lang on third reading sa Kongreso at sa Senado, nag-start na silang magbilang. And I'm not referring to the leadership of PhilHealth now, but I'm referring to the officials of PhilHealth who were already there at that time. And I can clearly remember Dr. Pargas was one of them. He was there. At kasama rin siya dun sa mga gumawa ng ganitong kwento na sa pananaw ko na personal, Mr. Chair, ay mali. Bakit? Nagkaroon siya ng subsidy, let's say 2016. I believe that was 2015 or 2016. Pero ang ginawa nila, parang ni-retroactive. Chinarge ng retroactive yung 2014 kasi ang point of reckoning nila na-approved na daw sa Kongreso. So ang tanong ko, Mr. Chair, para ang nangyari niyan, ito si Juan na senior citizen. Ang budget na pinag-uusapan ay 2016. So ini-enroll siya. Pero ang ginawa ng mga PhilHealth na ibang opisyal doon, chinarge pa sa 2016 yung enrollment niya raw ng 2015 at 2014. So my question, Mr. Chair, is that legal or is that illegal? Pwede ka bang i-enroll 3 times sa same year? So anybody from PhilHealth who can answer
Sino
this?
pong po pwedeng sumagot?
Maybe our COO? They were already there at the time, or maybe Dr. Pargas himself. Kasi ando doon na rin siya noon. Kaya Mr. Chair, tinatanong ko ito. Dahil nung ipinaglalaban ko nga ito, not that I don't want the senior citizens to be members. Pero ang nangyayari kasi, medyo parang naging daya on the side of the government. Kasi pinapabayaran mo yung 3 taon na membership na alam mo naman, 1 year lang yung maa-avail. And yung pondo na yan ay ginagawa ng PhilHealth na collectible. Kaya nga pinapalinis ko yung record na yun. In other words, hindi tama yung sinasabi nilang utang ng national government sa PhilHealth.
Mr. Chair.
Yes, President Ledesma.
Thank you, Mr. Chair. We understand the comments and the query, Mr. Chair. Maybe if I can suggest, Mr. Chair, we will, well, number one, it's been, 10 years ago or a little less. So we will try to see all the relevant documents related to this. And number two, Mr. Chair, maybe we can conduct an inquiry, an internal inquiry into this, and then we will keep you posted. We'll keep this honorable committee posted, Mr. Chair, if that's okay.
Yes, that will be very fine with me, Mr. Chair. And the reason why I am asking this, kasi pumupunta ako nga, tutumbukin natin yung tinatawag na zero-subsidy in 2025. Kasi tila naunahan ng mga maling impormasyon na magko-collapse ang PhilHealth kasi wala na yung subsidy. What am I pointing at, Mr. Chair? The fact that I am referring to was that in 2015, nung nagkaroon ng subsidy for the payment of senior citizens and indigents, sobra-sobra po yung pera. Kasi hindi actual people. Parang kumbaga, nagkaroon ng double or triple enrollment per person, not all, but quite a substantial number. At hindi mo naman pwedeng gawin yun. Medyo technical lang, Mr. Chair. Pero that's why I'm explaining this. Kasi over the years, patuloy pa rin itong sinisingil. Kung makatiming na lenient ang DBM, nagre-release sila. Pero kung makatiming naman, naalala ng DBM, yung napag-usapan nga nung chine-check namin at tino-audit ng PhilHealth, hindi nare-release. But if you check over the years, and this was, I believe, also the basis of the 90 billion, medyo nagkaroon lang ng a little confusion on the fund source. Hindi naman ibig sabihin na dapat yung gagamitin ay yung pera na in-enroll na sa PhilHealth. Kasi PhilHealth money na yan, members money na yan. But we are talking about yung pera binigay ng national government para gamitin i-enroll yung mga kababayan natin na NHTS, senior at pamana. At kasama sa NHTS at indigent, yung pantawid, 4Ps at listahanan. Now, kung wala doon yung tao, let's say may iba dyan, may namatay na, or nagkasakit, or nag-abroad, or nagkatrabaho, supposedly, hindi na yon binabayaran ng PhilHealth. Can Mr. Untalan confirm this, Mr. Chair? It's a yes or a no?
Yes po.
Tama. Can the PhilHealth President confirm this, Mr. Chair?
Yes, Mr. Chair.
In other words, Mr. Chair, and the CSVP for Finance, Mr. Lim Shaco, can he confirm this?
Mr. Chair,
Yeah.
kung Honorable Garin,
To reiterate,
reiterate po yung
yes,
sinasabi po.
yung subsidy na binigay ng national government para sa senior, pamana, indigent, and HTS, yung nasa listahanan at pantawid, ito yung number of people. Pero kung walang actual na tao na in-enroll, ang ibig ba sabihin nito ay excess money siya?
Mr. Chair, ang pera na binigay ng national government sa
The
atin,
subsidy of the national government
the
is
subsidy.
intended to pay for the premium or enrollment ng mga hindi na magbabayad. Tama
pag
po
hindi-
ba?
Tama po.
Kunyari, namatay na siya, pero nasa senior siya. Nagkatrabaho siya, nasa senior siya.
Nasa atin pa rin yung pera.
Listahanan siya. Yes. So the money is still lodged in PhilHealth, but no actual person enrolled. Tama po ba?
Tama po.
In other words, yung pinag-usapan na zero subsidy in the 2025 national budget, Mr. Chair, is not meant to crush or make or collapse PhilHealth. It is meant to use that unutilized fund na ilang taon na dina-download ng DBM pero wala ka nang in-enroll kasi namatay na, nagkatrabaho na, or meron ng ibang nangyari. Tama po ba?
Yes, Mr. Chair.
Okay. Let's say, let me dig deeper. Yung isang taon ay 12 months. Let's say natin si Juan de la Cruz ay namatay nung taong March. How do you reconcile that? Do you enroll them commensurate to the 3 months that that person was living, or kailangan buong taon yung babayaran?
Mr. Chair. Yes, ang
Yes, Mr.
application po namin for the annual premium po. So hindi po siya, kunyari namatay po siya ng March, because kasama po siya sa listahan, hindi naman po
So, yung 3/4 na patay na yung tao, covered pa rin siya.
Yes po. And mayroon ho kasi possibility din kahit yung senior citizen ay namatay, pero siguro meron po siyang mga anak o asawa na buhay.
Yung
So,
dependents.
Yes po.
Okay, so at least that's clarified. But will you agree with me in saying na usually yung subsidy na binibigay, may computed na tao, merong mga hindi na na-i-enroll at hindi na na-trace, at yan ay nagiging parang standby fund. Para siyang savings. And part of those funds ay ini-invest nyo. Tama po ba?
Yeah, but Mr. Chair, yes po. Yun po yung possibility.
So in other words, hindi totoo yung mga malisyosong comment na magko-collapse yung PhilHealth dahil dun sa zero subsidy. Inaayos lang siya dahil marami ang advance payment pero walang na-enroll. Pero of course, kapag mga ilangan naman ng pera ang PhilHealth, ay may sources na pagkukunan, especially the automatic allocations coming and mandated by various laws. That's clear, Mr. Chair. Tama po ba?
Yes, Mr. Chair.
Okay. So moving forward, Mr. Chair, just last one concern. Ito kasi hindi na pag-uusapan. Just for the record, Mr. Chair, I was actually the proponent and the author of the Medical Assistance Program. We started that, I believe, in 2014. I was then Undersecretary of the Department of Health. And coming from Congress, we realized na yung ibang packages ng PhilHealth, maski ini-increase mo, yung impact sa pasyente ay hindi ganun kalaki. So the purpose of PhilHealth is actually to reduce the out-of-pocket expenditures of the patients. Mabawasan, maibsan yung gastusin sa kalusugan, lalo na't kapag yung sakit mo ay makakapagpapulubi sa'yo. And these are, what do you call the term? Ano po bang tawag doon sa mga sakit na yan?
Mr. Chair, catastrophic diseases.
Catastrophic illnesses. Ibig sabihin, dun po dapat ang concentration ng PhilHealth. Subalit, meron po kasing nakita. And just to reiterate why I propose the Medical Assistance Program, first, yung deduction ng PhilHealth hindi ganun kamalaki. Kasi nga marami akong nakita na mali ang ibang case rates. Maraming mali dun sa case rates. Second, it was very surprising, Mr. Chair, but a very clear realization. Tuwing mag-aakyat ng coverage ang PhilHealth, example, noong time na yon, I believe the coverage of medicines was 2,400 pesos, no, sa isang admission. In-increase ngayon ng PhilHealth, example, to 3,500 pesos. So in effect, supposed to be, meron kang 1,100 pesos na dagdag na benepisyo na gamot. Tama po. Pero, nakita ba ng PhilHealth na yung 1,100 ay hindi nararamdaman ni Jose, ni Juan at ni Maria dahil merong iibang ospital na kaakibat ng pagtaas ng coverage ng PhilHealth, ini-increase nila ang presyo ng bawat gamot, commodity, or laboratory. To explain further, Mr. Chair, example, IV fluid, or in layman's term, dextrose. Sa government hospital, example, 80, 40 to 80 pesos. Pag sa private hospital, pagpalagay natin, 100 pesos. Pag service cases, 120. Kapag semi-private, pero kapag PhilHealth enrolled, nagdadagdag sila ng plus 25%. Ibig sabihin, yung presyo ng bawat item ay tinataasan kapag charged to PhilHealth. Ang katwiran ng iba dahil daw utang at matagal magbayad ang PhilHealth. But what is more surprising is that nung i-expand ng PhilHealth ang coverage, ang ginagawa nila is tinataasan yung presyo. So yung example, I just can't remember the exact figures. Example, yung coverage ng medicine was 2,400. Dinagdagan ng 1,100, naging 3,500. Ang ginawa naman, hindi naman lahat, but it's a very rampant practice. Ang ginawa ng ibang mga hospital, tinaasan nila yung presyo ng bawat gamot. So much so na yung epekto sa pasyente ay wala din. In other words, this is an issue that should really be looked into. Kapareho po ito ng medical fees and professional fees that we referred to Secretary Herbosa and to ASEC Domingo that was supposed to be complied for 1 month. Pero hanggang ngayon ay wala pa rin pong report or they have not reverted kung ano na po ang nangyari doon. That's why earlier I was emphasizing the phrase, walk the talk. Hindi po pwedeng magaling tayo sa salita, marami tayong binabatawan na magagandang salita dito sa mga hearings or briefings ng Kongreso. Pero pag lumabas na tayo sa fence or boundaries ng Kongreso, ay wala nang nangyayari. So can PhilHealth appraise us, are they observing the same pattern? Ibig sabihin, walang uniformity. Kunyari, ito, bibilhin ng pasyente. The same hospital, the same brand, the same generic, the same hospital, bibilhin ng 100 pesos. Pero dun sa chart, kapag charge to PhilHealth, magiging 150 pesos.
Mr. Chair.
Dr. Pargas.
Yes, Mr. Chair. Yes, Honorable Garin, we have heard those mga kwento po that the hospitals are actually increasing their prices as we also increase our coverage or expand our coverage.
So, what did PhilHealth do about this? Ano po ang ginawa natin? And even DOH, since the Secretary of Health sits as the chairman, ano po ang naging reaksyon natin dito?
Mr. Chair, yes, Congresswoman Garin. One is we actually have implemented the no co-payment rule, especially for those who would opt to be admitted in a ward or basic accommodation. And right now, we are also doing a staff work on how we can actually come out with a policy on co-payment. And this one is...
I'm sorry ha, Mr. Chair. Dr. Ish Pargas, when you say co-payment, ito ay binabayaran ng pasyente. Tama?
Yes po.
Okay. Pero ang nangyayari kasi, binibigyan sila ng mga reseta at sinasabihan sila, bumili kayo sa labas dahil cut off na dito sa hospital. So it does not serve the purpose. Hindi siya solusyon sa problema. Kasi no co-payment, walang charges, pero hindi po ba bumibili sila sa labas?
Yes, Mr. Chair. Yes, Congresswoman Garin. That's why also our regional investigators are doing the monitoring on this because, again, especially for those facilities which are requiring the members to, one, buy medicines outside, or two,
So can you cite a specific example na meron kayong kasong na file, meron kayong findings, or meron kayong na-apprehend? Kasi sa pagkakaalam ko, parang wala, Mr. Chair eh.
we will provide a report, Mr. Chair,
Meron ba?
from our legal. Thank you.
Pero meron ba, Mr. Chair? I mean, it's okay. Kung sabihin yung wala, we will propose solution. Kagaya nga kanina, ang sabi ni Congressman Acop, unang-una, we should know the problem. Number two, we should accept the problem. And then, we can find solutions. Kasi kung pagtatakpan natin ang problema, hindi talaga natin mabibigyan ng solusyon ang problema.
We will check, Mr. Especially on this issue, Madam Chair.
In other words, Mr. Chair, ang isang problema, I believe, meron ngang problema sa efficiencies ng PhilHealth na inaayos niya. Pero ang problema ay yung cap. And this is starting to happen also in the medical assistance program. Kapag ang pasyente, ang expenses ay charged sa MAIP, wala pong ceiling. What DOH can actually do is to come up with a ceiling for government hospitals and another ceiling for private hospitals commensurate to the room accommodation. Ward ba yan? Semi-private ba yan? Private ba yan? Or suite room ba yan? Bakit? Yung 50,000 na tulong ng gobyerno, ang ibig sabihin nun, hanggang saan makakarating? Because even if we say that government is helping a patient with catastrophic illness in a tune of 100,000, the value of assistance with that 100,000 will be curtailed if the government agencies, specifically DOH, handling this is not doing its oversight functions. Madali naman pong computein kasi nasa inyo ang FDA. Makikita nyo magkano ang landed cost, magkano ang logistical cost, magkano di po ba ang profits ng government hospital sa kanilang mga gamot at mga laboratories is pegged at 30%. So sabihin mo na maging 100% yung private hospital, kapag service pwede siyang gawing 50%. In other words, matagal na siyang problema. Ang kailangan natin ay solusyon na gawa at hindi salita. So with that, Mr. Chair, may I therefore move that the DOH and PhilHealth be mandated, number 1, to cleanse the names of enrollees so that in the succeeding years, wala ng zero PhilHealth subsidy. Ibig po sabihin, alam na natin. Kung may namamatay, tanggal. Kung may madadagdag, updated. Para kung yung perang binigay ng national government ay suwak dun sa i-enroll nyo. Further, Mr. Chair, PhilHealth should provide DBM and even Congress and Senate the number of people actually enrolled using the government subsidy. Next, Mr. Chair, PhilHealth and specifically DOH, but do not follow what the NCPAM did before, na gumawa naman ng presyo na imposible. No, dapat naman, yung totoo naman, na included naman yung taxes, reasonable profit of the businessman, and logistical cost, including breakages or wastage. In other words, maglagay kayo ng matrix. As what has been actually mandated by law, implied, no? Na dapat alam natin kung ano yung coverage. Example, specific antibiotic, specific chemotherapeutic drug, may brand, meron niyang generic, magkano siya dapat pag-charge ng private hospital? Magkano siya dapat pag-charge ng government hospital? Huwag nyo rin namang gawin ang kapareho sa COVID testing na pineg nyo at 8,500. Pero buong mundo, ang testing ay nasa 1,500 to 2,000 lang. You see the difference? It's value for money. Para kapag pinapalawak nyo ang kailangan, ang coverage ng ating mga miyembro ng PhilHealth, ay talagang may benepisyo. Hindi na yung benepisyo ay mapupunta lang sa increase in charging dun sa ating mga stakeholders. So lastly, Mr. Chair, and I believe it can be complied with, no, Asek Domingo? Yeah, DOH can comply with that.
Yes, Mr. Chair.
Do you think that can contribute to the solution of the problem?
Short of a price cap, Mr. Chair, which needs legislation, this is a very good solution kasi it reminds me of a suggested retail price, kung tama po yung pagkaintindi, Mr. Chair,
Yes.
SRP.
Pero if you remember, Asek Albert, ang nangyari, yung ginawa nila Dr. Guerrero na SRP, mas mababa pa kesa sa production cost. So, syempre, it was impossible to implement. No? Na wag naman na ganun. Lastly, Mr. Chair, the reason why I was interjecting earlier, kasi minsan, hindi na nade-delineate yung DOH at PhilHealth. What's the difference between DOH and PhilHealth? Maybe I can ask the DOH first, and then later I'll go to PhilHealth. In terms of functions.
Thank you, Mr. Chair, Honorable Green. In general terms, national government agency po yung PhilHealth, line item budgeting, technical lead and oversight of the health
Let's
sector.
talk about public health and illnesses.
Ang DOH po, by the UHC law, yung in charge sa population-based interventions, so yung mga preventive
Will
measures.
you agree with me, Mr. Chair, when I say that DOH is more of the promotive and preventive healthcare? Tama po ba?
That is correct, Mr. Chair, Honorable.
A little bit of outpatient care.
That is correct, Honorable Green, Mr. Chair.
While PhilHealth is actually in charge of curative healthcare, catastrophic illnesses.
That is
Tama po.
correct, Mr. Chair.
Ibig sabihin, karamihan po ng ating public health programs ay pinupondohan ng DOH. At ito naman kapag ikaw ay nagkakasakit na nasa ospital ka or kailangan mo ng outpatient intervention na mga mahal, kagaya ng MRI, CT scan, radiation therapy, chemotherapy, and catastrophic illnesses, yun naman ang gagawin ng PhilHealth. Because as an insurance, ayaw natin na mamulubi ang isang taong nagkakasakit. That's very clear. The delineation is clear, right?
Yes, Mr. Chair, Honorable Garin.
I believe, Mr. Chair, ang isang problema, minsan nakakalimutan ito. At ang nagiging problema, minsan may mga pumapasok at nagbabago ang administrasyon na ang PhilHealth ay ginagawang pampolitical programs. Just like I was observing before when the former Secretary Obial, ordered PhilHealth to conduct like an executive check-up assessment with medicines, I believe, to 20 million Filipinos. Pero ang gagamitin na pondo ay yung pondo ng mga enrolled members. In other words, ito kasing preventive and promotive healthcare ay pinagkakagastusan ng DOH. Ang DOH ay bumibili din ng mga gamot, bumibili ng mga wheelchairs, nagbibigay ng mga laboratory equipments, nagbibigay ng subsidy. In other words, dito pumapasok para yung PhilHealth mas ma-enhance nyo na kagaya meron ka dyan kailangan magpa-bypass, dapat halos walang bayad yan. Yung magpapatransplant, halos walang bayad yan. Yung cabbage, yung mga major operations, that should be the delineation. Kasi nag-overlap na eh. In other words, hindi kaya ng PhilHealth na lahat ng problema sa kalusugan ay siya ang sumalo. Hindi rin naman kaya ng DOH na yung mga gastusin sa loob ng ospital ay sa DOH. So if PhilHealth and DOH can delineate the tasking to avoid overlapping and duplication, then, Mr. Chair, we will have a more effective public healthcare, even private healthcare. So those are just my requests and recommendations, Mr. Chair. At sana dun sa next hearing ay mabigyan tayo ng update where we are in those requests para po matugunan na ang problemang yun. Ay, sorry Mr. Chair, last comment na lang. Earlier kasi si Asek Domingo mentioned the revival of the FEC. But the Formulary Executive Council, when they were also operational, nasa mga minimum of 3 years din eh. Yung decision nila for inclusion in the PNDF. In other words, history will tell us na hindi rin ganun unless time-bound at hindi sila consultant lamang na magmi-meet kung kailan lang. My question is, will it not be a violation of the UHC law? Kasi sa UHC law, although mali yun, I'm not saying I agree to that, masyadong in-empower yung HTAC. Tapos linagay pa sila sa DOST na hindi na ngayon mapupukpok ng DOH.
Mr. Chair, some of our legal analysts have been saying that there is no violation on the basis na yung lilagay na provision dun sa HTAC, parang silent siya when it comes to the inclusion in the formulary. Ang sinabi lang po kasi dun is yung investments in, yun yung nakalagay dun sa UHC law. Pero yung inclusion in the formulary is not mentioned.
But actually, Mr. Chair, when you say investments in healthcare, yun din yun eh, yung mga gamot na bibilhin, tama? Kasi yung HTAC, yung ina-analyze nila, yung mga gamot na bibilhin, that can be done when you are listed in the PNDF. FEC will do the same task. So I believe it will just be a duplication of inefficiency. I believe the solution there is to get a yardstick. At sabihan yung HTAC, ito yung deliverables nyo. Kapag hindi nila ma-deliver, they should be accountable. Kasi hindi naman pwede, Mr. Chair, na sasabihin nila, hindi kasi busy pa kami. And then ang gagawin nyo is mag-create ng another body. The solution there is for HTAC to have time bounds. Now, kung hindi nila ma-approve within such a time frame, it will be deemed approved. So what they should do is kung hindi compliant, i-disapprove. Huwag yung pabayaan ng ilang taon. In fact, it's not really a problem, Mr. Chair, because actually the Secretary of Health can issue an exemption. Kaya lang, ang problema nga, sobrang mabagal ang HTAC that was basically comprised of the former FEC. So we should not duplicate the inefficiencies. And it should also be clear kasi yung FEC naman, nagkakaroon naman ng confusion na hindi na nila alam na hanggang generics law sila and they do not actually deal with safety and efficacy of drugs, devices, and vaccines. Because what's happening is, when the FEC was created under the Department of Health, akala nila nagkakaroon kasi ng power play. And they were trying to do the task of the FDA. And FDA is by law mandated to deal with safety and efficacy. While FEC was created by virtue of the generics law. In other words, hindi sila yung mga Diyos. So the problem is when they lord it over, public health suffers. So Mr. Chair, just to put it on record, I don't agree that creating the FEC will be the solution. It will just be another layer of inefficiency. I believe the best problem here is to push HTAC to deliver. Let it be time-bound because they are regular employees and they can hire consultants that is actually equivalent to an FEC. Ngayon, sa mga sinasubmit sa kanila, let them give solutions in 1 year or 2 years at the maximum. It should even be 1 year. And kasi sa totoo lang, wala naman silang ibang gawin. Lessen the travels and all meetings can actually be conducted here in the DOH office or in the DOST because what happens is they travel to all these touristic destinations in Bohol, in Palawan, in Boracay, and conduct the meetings there, which becomes very difficult to get a quorum. Kasi lahat naman nanggagaling ng Manila. So, pasensya na, Mr. Chair, I took some time, but I believe I have to speak up because public health is actually a matter of urgency that should be tackled by all of us. Maraming salamat po, Mr. Chair.
Thank you. The next interpellator is the Honorable Congresswoman Stella Kimbo.
Salamat, Mr. Chair. Magandang hapon sa PhilHealth and DOH family. Sana hindi pa kayo nagsasawa sa akin. Magkasama kami hanggang halos alas 10 kagabi. Anyway, Anyway po, unang tanong, in 2024, tama po ba na gumastos ang PhilHealth or nagbayad ang PhilHealth ng 165 billion pesos in benefit payments?
Mr. Chair, Honorable Kong Stella, tama po.
And para naman sa taong 2025, ang plano ng PhilHealth is gumastos ng mas malaki. Tama po?
Tama po, Mr. Chair, Kong Kimbo po.
At dahil na rin sa mabigat na pressure mula sa Congress, sa kulit po natin, Mr. Chair, nakailang committee hearings na tayo dito, pati na rin sa Committee on Health, pati na rin sa amin sa Committee on Appropriations. Pasensya na po sa kulit namin, pero pinapakinggan lang talaga namin ang aming constituents. So, dahil dyan, mabigat ang pressure, nag-increase kayo ng case rates sa para sa maraming mga sakit. Tama po?
Yes, Mr. Chair. Yes po, Congresswoman Kim.
At dahil dyan, ang plano po ninyo na gagastusin para sa taong 2025 ay 271 billion pesos. Tama po?
Tama po, Mr. Chair, Kong Kimbo.
So una sa lahat, kami po ay nagpapasalamat. Malaki po ang increase from 165 last year to a planned spending of 271 billion for 2025. Pero ang tanong ko sa inyo is, paano po ninyo mapapatupad yan ngayon na zero subsidy mula sa Congress?
Mr. Chair, Honorable Representative Kimbo, the sources of funds for year 2025 are the following. Number one, from the direct contributors of 203 billion pesos, investment of 20 billion pesos, and the surplus 150 billion pesos. This is a total of 373 billion pesos, Mr. Chair, Honorable Representative Kimbo. Now, if we're gonna compare this one to the total approved corporate operating budget of PhilHealth of 284 billion pesos, still PhilHealth has an available funds of 89 billion pesos, Mr. Chair. This is hindi po kasama po dito ang ating na siniseparate na pondo, the reserve fund of 280.5 or 281 billion pesos, Mr. Chair, Honorable Representative Kimbo. Ma'am.
Okay. So ibig sabihin, kahit na po walang subsidy, ngayon taon ay kayang-kaya. Hindi lang po kayang-kaya, kayang-kaya na kayang-kaya. Kasi may matitirang 89 plus 280 sa inyong bank account by the end of the year. At hindi pa natin binibilang ang investment income for the year 2025, which would be roughly, if we are to make the same amount of money, so conservative na po yan, 20 billion, so meron kang 389 billion by the end of the year sa inyong bangko.
Mr. Chair, Honorable Representative Kimbo, of course, this one is the available resources for our corporate operating budget. When on the part of our assets, again, we have 492 investment portfolio available
Yes or
na siya
no
na
lang,
December.
simpleng tanong, di ba? Sabi mo, may available na 373 billion pang gastos. Ang gagastusin natin next year is
84.
84. So may matitirang 89. Pero labas pa po dyan yung 280 billion na reserves. So that is 369 billion. Di ba? Pero, tama.
Yes po.
Yes, okay, correct. Pero hindi pa natin binibilang dyan yung kinikita natin sa investments. Buong taon yun eh. So, more or less, sabihin na natin, very conservative. 20 billion, conservative po. Meron po kayong 389 billion at the least.
Mr. Chair, Honorable Congressman Kimbo, the investment income is already form part of the sources of funds that I mentioned kanina.
Hindi ba yan yung source of funds mo for 2025? Ibig sabihin, kinita mo na yan noong 2024.
Hindi po. Ito po ay projected po.
O saan mo
Kasama sa direct
Okay,
din po.
saan niyo po
projected
nilagay yung kinita po ninyo noong 2024?
Ang 2024 po na kinita na po natin will be form part po ng surplus po natin po.
Okay, o sige. So 369 billion. Malaki pa rin.
Opo.
Malaki pa rin, no?
370 billion. Opo.
Pwede bang pakilakasan?
Yes po.
Okay.
370 billion.
More or less.
More or less po.
370 billion.
Opo.
So linawin ko lang this is despite not getting a subsidy from the Philippine government in 2025. This is despite almost doubling your benefit spending in 2025. May matitira pa pong 370 billion sa ating accounting.
Opo.
Pero meron ka pang hindi kinikwento sa atin dahil meron ka pang kulang-kulang 101 billion na unused na SARO. May 80 billion na unused SARO at may 21 billion na unreleased appropriations. Tama po?
Mr. Chair, the 101 billion, these are receivable of the corporation from the Department of Budget and Management. These are allocation, part of the GAA in the year 2023 and in the year 2024. Meaning, kasama na po siya sa calculation po natin. Particularly,
Hindi siya kasama sa 203B kasi premiums yun. Hindi siya kasama sa investment income, obviously. Hindi rin siya kasama sa surplus.
Sa surplus po kasama na siya because again,
Binilang niyo siya sa surplus?
on the part of our accounting for the premium, we are adopting the accrual basis, Mr. Chair, Honorable Kimbo.
Pero
kasama na po siya doon. So receivable na lang siya po on the part of the asset. Now, if we're gonna get that money, will be form part of our asset and then ma-add up po siya doon sa ating investment portfolio po.
Okay, sigurado po kasi nung huling hearing, hindi po ganyan ang aking pagkakaintindi. Kasi every time na lang tayo nagkikita, may panibago tayong interpretation kahit na the same numbers. Okay, so ngayon, ang sinasabi niyo po ay yung unused na receivables, na manggagaling sa gobyerno ay sinama mo na sa 150 billion na surplus. Okay, so, pero gayon pa man, malaki pa rin ang 370 billion na matitira by end of the year. So, good news.
Mr. Chair.
It's a good news for everyone because makakaasa tayong lahat ng very much improved service from the PhilHealth. So, thank you for that. And then at the same time, panatag ang loob namin lahat na Pilipino na buhay ang PhilHealth in terms of funds, financial viability. Tama po?
Tama po.
Yun ang gusto natin marinig na para sa akin, that's the gist for me para sa issue na to. Kasi ang dami-dami pong, tama po si former Secretary Garin, ang dami pong natin naririnig na kung saan-saan. Pero gusto kong naririnig from you directly, SVP Limsiaco, kasi kayo talagang tagahawak ng records, financial records ng ating korporasyon. So that's good news for everyone. Okay, next po na tanong is, ano po ba ang basis for computing our premium subsidies from the national government? Can you confirm that it is the sin tax law? The train law, kasi na-amend na pala. So una, sin tax law. Should I ask ASEC Albert, sino bang mas nakakaalam? Maybe ASEC Albert, no?
Yes, we confirm that,
Yeah, so
Madam
it
Chair.
started with the sin tax law. Just as a background, we moved from ad valorem taxes, 12 pesos per pack. We moved it to a high uniform specific tax in 2013 to 25 pesos per pack. Anong dahilan? Dahil gusto natin to curb smoking. Tama?
That's correct, Mr. Chair.
And not only that, win-win siya para sa gobyerno because at the same time, nakakapag-generate tayo ng mas maraming tax revenues. Tama po?
Tama po, Mr. Chair.
Okay, so yan ang actually ang original basis sa pag-compute ng kung magkano ang maibibigay ng gobyerno sa PhilHealth taon-taon. Tama?
Tama po, Mr. Chair.
Of course, na-amend siya ng train law and so on and so forth on exactly how to compute, but that is the basis. It
That's
really
correct.
comes from the idea that we want to prevent smoking, and as a result, we increase taxes on cigarettes because to make taxes artificially expensive with high taxes ay makakapag-prevent tayo ng smoking, especially sa kabataan. So yun, pero dahil mas marami tayong nakakolekta, ang sinasabi natin, ibalik natin yan sa health system na kung saan maraming nagkakasakit dahil sa smoking. Tama ba yun?
Tama po, Madam.
And you can confirm that yung mga diseases caused by smoking are nasa top 10 causes of morbidity and mortality. Tama ba yun?
Yes, Mr. Chair, Honorable Kimbo, yung ating stroke, heart attack, cancers, nasa top 5 nga po ng ating causes of death.
Okay, so in short, taon-taon, yung kinokolekta natin na buwis galing sa benta ng sigarilyo, ayun ang basehan ng premium subsidies sa PhilHealth. Tama?
Tama po, Mr. Chair.
Okay. Ang tanong ko sa iyo, ASEC Albert, alam ko ikaw ay isang eksperto sa health policy. Sa iyong pagkakaalam, yun ba ay kung yan ang ginamit na computation ng isang private health insurance company, ay yan ba ay typical? Kasi nagko-compute ka ng premium contributions, ang basihan is tax collections. Ganun ba ang mga private health corporations? Halimbawa, may mga Sun Life, etc., etc. Ganun ba sila mag-compute ng mga premium contributions na charge sa kanilang miyembro?
Mr. Chair, Honorable Kimbo, hindi po ganun sa private.
Hindi ganon, di ba?
Ang nangyayari po sa atin dahil kinocompute
let's just do it slowly, no? So, hindi ganon. So,
Hindi
tama,
po.
I agree with you. Ano ang basehan ng typical na health insurance program or corporation sa pag-compute ng premiums nila? Anong mga basehan? Kahit na broad terms lang.
Sa pribadong sektor, tinitignan po ng kumpanya yung mga tinatawag na risk tables, kung ano man ang mga pwedeng ikadahilan ng sakit o ikamatay ng mga tao. Titignan nila kung magkano ang kailangan para masalba yung magiging miyembro nila. Tapos yun po ang sisingilin nila. Siguro may konting patong para sa kita nila, pero dun po sila nagbabase.
Yun. So it's really lahat ng mga factors na nagde-determine kung ano ang magiging expected na health spending ng tao. Tama?
Tama po.
So, ilan kaya ang magkakasakit? Ilan kaya ang mga hospital? Ano kaya ang mga sakit nila? Ano ang average cost ng mga sakit na yon kapag sila ay may ospital? Tama ba?
Tama po yun, Mr. Chair.
Yun ang nagiging basihan ng tinatawag na actuarially determined premiums na siya pong ginagamit ng mga typical na health insurance programs. Tama?
Tama po, Mr. Chair.
And as you can hear, very different siya doon sa kukunin mo ang tax collections at i-multiply natin by a certain number, yan ang ibabayad ko na premium sa PhilHealth. Tama?
Ibang-iba po. Kasi dun sa PhilHealth, kung ano yung nakikita nilang makukuha na source, yun yung nagiging basihan nung kokolektahin.
So, may sitwasyon na ang dami-dami-daming smokers. Tapos ang taas ng tax rates. Kaya tuloy, on the basis of the sin tax law, nako, ang dami-daming ireremit sa PhilHealth. Pero sa totoo lang, ang pangangailangan ng PhilHealth on the basis of yung pangangailangan ng ating mga kababayan in terms of hospitalization, health needs, etc., ay actually mas mababa. Tama?
Tama po, Mr. Chair.
So, ito ay isang dahilan kung bakit nagkakaroon talaga in the end ng surplus funds. Tama ba?
Tama po, Mr. Chair.
Ibig sabihin, kasi lagi na lang namin sinasabi, pasensya na lang po PhilHealth, na naku, ang dami niyong pondo, pero dahil for some reason or the other, ayaw niyong gastusin, or mabagal ang paggastos, ang dami niyong denied claims, ang daming return to hospital claims, etc., etc. Tuloy, ang daming natitirang pera. Di ba lagi naming sinasabi yon? Pero hindi namin napapoint out na ang isang dahilan din kung bakit maraming natitira taon-taon is because may ganoong disconnect na pataas ng pataas ang tax rates at gayon pa rin kadami ang smokers. And in fact, recently on the basis of the 2023 FNRI survey, dumami unfortunately ang smokers natin. So we can just imagine ang laki ng tax collections. Therefore, if we use the sin tax laws as the basis, talagang it should be not a surprise na magkakaroon talaga ng malaking pera ang requirement na i-remit na national government sa PhilHealth, and that would be much, much bigger than what is actually needed or what PhilHealth is capable of spending at this point in time. Do you agree with that?
Tama po yun. That's correct, Your Honor. Yung actual performance nila sa ngayon, which can be improved.
Yes. So, do you agree na siguro magandang panahon ngayon dahil ang dami-daming debates and it's good that we have debates, di ba? Okay lang naman yon. But siguro ang isang take-away natin lahat is panahon na i-review natin ang basehan ng magkano ba dapat ang i-remit ng gobyerno sa PhilHealth for purposes of fully supporting the National Health Insurance Program. Kasi kami sa Kongreso, kami, mga members, kami po ang nakakasagupa talaga ng mga nangangailangan ng hospitalization support every day of our lives. Kaya po, this is that's why emotional kami pagdating dito sa issue na to. Yun ang dahilan po, pasensya na lang. But do you agree that yan ang kailangan natin gawin sa ngayon?
Tama po yun, Mr. Chair, Honorable Kimbo. Yung patutunguhan yung language sana na kailangan baguhin. Kasi merong version, kung di po nagkakamali yung 2013 na syntax, mas flexible. Pwedeng pupunta sa PhilHealth, yung pong individual-based services. Pwedeng pupunta sa DOH or even, kung di po nagkakamali sila, Honorable ganun yung naglagay nun yung HPEP, nakasulat po yun sa original. And then dun sa more recent versions kasi, naging para bang masyadong atado na para lang doon supposedly, pero hindi nga kayang gastusin.
Alam ba natin, siguro itatanong ko kay Dr. Ish, alam ba natin, kasi Dr. Ish, ikaw yata ang namamahala ng benefit packages, alam ba natin kung magkano ang actually na ginagastos ng PhilHealth para sa mga smoking-related diseases? Like halimbawa for 2024?
Mr. Chair, I'm sorry, Honorable Kimbo. We can provide the data po, but I don't have any right
But
now.
would you confirm na I know kasi top 10 is, number 1 is dialysis, ganun ba yun?
Sa procedures po natin, number 1 is dialysis. Sa medical illnesses naman po, it's bronchopneumonia.
So, can you just submit to us, yun nga po, ano
Smoking-related
ang
diseases.
estimate po ninyo ng lahat ng ginastos po ninyo in
Smoking-related
the last
diseases.
5 years na matitease out yun naman yun sa sobrang complicated ng case rates, di ba, na smoking-related, para malaman natin. Kasi we really need to know, kasi that's the intent of the syntax law. So, yun po, that's, and sa
Yes,
next
Mr.
point
Chair.
ko naman po, ano po ang corporate budget natin? It's 284 billion, tama po?
Yes po, Mr. Chair.
And then if we subtract, kasi 270, magkano po ang para sa benefits dyan?
271, Mr. Chair.
And so magkano po matitira for admin?
12.5 more or less, Mr.
So
Chair.
12.5 billion is, in short, admin expense budget. Ito, bale, ang panueldo ninyo. Tama?
Tama po, pang-sweldo at saka pang-operation, maintenance operating expenses po.
Okay, ilan porsyento dito ang para sa sweldo and benefits of employees?
5.8 po ang PS cost po natin dito.
5.8 billion pesos. Okay. So, and ayon sa batas, merong ceiling na pwedeng igastos para sa admin expenses. Tama po? Which is,
Tama po.
magkano po ngayon ang ceiling?
Nasa 14 billion,
14
Mr.
bill
Chair. Opo.
ang ceiling for this year. At paano po, anong basis can you, based on the law,
batay sa batas po, the ceiling is computed actual premium collection of year 2024 and multiplied by 7.5%, Mr. Chair.
that's the maximum na allowed.
Yes
Tama po?
Yes po.
And pag sinabing premium collection, this is from direct contributors, meaning mga sweldado na kinakaltasan, tama po?
Including
Plus?
indirect po.
Plus, which means including yung government subsidy.
Opo.
Tama po?
Opo.
So, kung malaki ang subsidy, 100 billion, halimbawa, kasama yan dito sa basihan sa inyong admin expense. Tama po?
Opo.
So,
Mr. Chair, Kong Stella, the actual collection year 2024 based on our cash position report, nasa 203 billion pesos po. 203 billion multiplied by 7.5, nasa 15 billion po siya, not 14.
so that's the maximum na pwede. Pero
Yes po.
ang nilagay nyo lang is 12.5.
Opo.
And of that, 5.8 is for your salaries and benefits.
Yes po.
Okay. So nakabase pala siya sa premium collection.
Yes po, Mr. Chair.
So, iyon din ang dahilan kung bakit tuwing nagpupunta kayo dito sa Kongreso ay talagang pressured kayo na kailangan malaki ang makuha natin na subsidiya mula sa gobyerno. Tama?
Tama po, Mr.
Kasi
Chair.
kung halimbawa na zero kayo, ang laki ng ibabagsak ng inyong admin expense. Tama? Kasi ngayon 12.5 billion ang pwede. zero kayo this year. So next year, magkano ang magiging maximum? Ang maximum ngayon, sorry, is 15 billion, right?
Mr. Chair, if we can collect the estimated 203,
Yes.
and ito po yung pinaka-base po
Okay,
natin.
times?
Times 7.5, more or less nasa 15 billion pa rin po.
Oh, okay. So, yun ang maganda. Dahil sa, well, kumbaga, looking at the glass half full rather than half empty, ang isang magandang effect ng zero subsidy is that ngayon, nape-pressure kayong mangolekta ng premiums na direct. Tama ba ako? Kasi last year, magkano ang kinolekta ninyo na direct premiums?
Sa direct po ay nasa
100, it's definitely less than 203, tama?
yes po. From the hindi ito. The other one.
Madam Chair, if I may.
200 ano na lang, Madam Chair, 204 minus 9. That's from the direct, Madam Chair, Mr. Chair, 195 more or less, Madam,
Okay,
Mr. Chair.
so pressured kayo to increase your premium collections by about 9 billion pesos so that you're able to at least maintain your maximum ceiling. Tama po?
Yes po.
Yun. So, yun ang something that kailangan natin abangan. By next year, wala na po ako dito, so iniiwan ko po na baon sa inyo na sana tanungin ninyo next year kung ano nga, or by the end of the year, kung ano magiging premium collections nila if indeed na-hit nila yung target collections. Ang next ko po, Mr. Chair, is para lang maliwanagan tayong lahat, no? Yung ano nangyayari sa premiums kapag hindi magamit? Kasi halimbawa ako, madalang po ako sa ospital. Pero taon-taon, nagbabayad kasi salaried kami, di ba? So kami po ay subject to the 5% times 100,000 ang maximum ceiling, di ba? So 5% of 100,000 per month, naghuhulog kami ng 5,000 pesos. Times 12, 60,000 pesos. However, hindi po ako halos na ospital. So, yun ang siguro ang palaisipan ng maraming tao, especially yung younger workers. Ano ang nangyayari doon sa unused premium ko sa taon na to?
Mr. Chair.
Maybe, sige po, sino pwede magpaliwanag? Pwede bang si Asek Albert?
Yes, Mr. Chair, Honorable Kimbo. Sa isang pay-as-you-go system or parang paluwagan, kung di ka nagkasakit sa ngayon, may iba pong dapat na gumamit nung inyong binigay. Dahil ang usapan ay pag tayo naman ay tumanda at lahat naman tayo ay tumatanda, babaliktad. Merong ibang mas bata na siya namang malakas sa pangangatawan na nagbibigay ng sweldo na siya namang gagamitin natin. Or para mas madaling tandaan, sa loob ng pamilya natin, kung meron tayong lolo't lola at lahat tayo ay meron, siya yung gumagamit nung hindi natin nagagamit na hinuhulog natin.
Okay, in other words, good night na yon para sa akin, right?
Opo.
At iniisip ko na lang na sinasubsidize ko naman yung lolo at lola ko
Tama
na
po.
maaaring na-hospitalize, di ba? So, ganon. That's,
Congresswoman,
yun ang ibig. Yes,
Can I just give you 2 more questions?
yes, I'll just very quickly.
Okay, pasensya na po at medyo
Yes.
may ano lang po. May
Yes.
kompromiso lang po.
How many
Thank you po.
minutes?
5 minutes?
Okay, sige.
Okay, thank you po.
So my point being, para lang naiintindihan ng tao, kapag for 1 year naghulog ka at hindi nagamit, yun ay hindi naaasahan ng members na makuha as savings. Tama ba yun?
Tama po, hindi
Because
pwedeng
that's how-
savings.
Because
hindi
that's
pwedeng
how an insurance system works.
Tama po.
So ganon. And if in case, like in the situation of PhilHealth, ay meron pang excess funds at the end of the year, ang tanong is, paano yun mapapakinabangan ng mga Pilipino? Yun ang tanong, di ba?
Opo.
So, kaya, ayon sa batas, there are 2 things. One is, dagdagan mo pa ang benefits or babaan mo ang kokolektahan mo na premium sa susunod na taon. So, tanong, Alam naman natin na nag-expand kayo ng benefits at ginagawa niyo yan, especially this year, na bonggang-bonggang pag-increase. Pero tanong, nagbaba na ba kayo ng premiums? Press Mandy?
Not yet po. Not yet, Mr. Chair.
So, yun ang dapat natin lalong isipin. Di ba? Lando na nga sa batas yun eh, di ba? So, in fact, panawagan nga yun ni Speaker, sabi niya, pag-isipan ninyo, di ba? Pwede naman mag-moratorium dahil sa totoo lang, ang dami pang natitira na pondo. So, kasi nga, ang isang health insurance program, pero social health insurance program kayo eh. Asek Albert, magkano ba dapat ang tubo ng isang social health insurance program?
0 po ang tubo ng isang social health insurance program.
Wala dapat tubo, di ba? In fact, may reserves kayo na 280 billion, pero maximum reserves ito sa ilalim ng batas. So, a few more minutes, ubusin ko na po. Ano po ang sa ating, may special provision po tayo sa GAA 2024 na you are required to undergo or to have an actuarial validation. Ito po ba ay ginawa natin?
Mr. Chair, may I?
Yes, please. Please identify yourself.
Okay, Nerissa Santiago
Marisa
po.
Santiago.
Yes.
Okay, please.
Okay, thank you, Mr. Chair. Thank you, Honorable Kimbo. Yun po sa actuarial valuation, we had a consultant in 2024 na gumawa po at nag-review po ng aming valuation for 2024. So,
Ano ang kanyang findings?
So far po, even prior to that, meron po kami mga reviews. May mga improvement po in terms of how we will be conducting the valuation, yung mga assumptions. But in totality po, wala naman po major finding.
Wala siyang finding.
There are some for improvement din po in terms of assumptions. Kasi po, prior to this consultant, we didn't have the personal complement to do the studies to support our assumptions. So they they recommended the studies that we need to do to support the assumptions that we are using po.
So ang tagal-tagal na po natin in existence, kulang ang ating actuarial support.
When you say, Mr. Chairman, you say actuarial support, you mean the personal complement po? Yes po. It was only last year that we had additional 5 personal complement, courtesy po of the approval ng GCG in 2021.
Pero Mr. Chair, obviously, ito ay isang dahilan kung bakit tayo nasa ganitong sitwasyon na ang PhilHealth ay nagiging investment bank na at nakakalimutan ang mandato. Kasama tingin ko yon, kasama ang kakulangan ng actuarial studies at dapat regular yan eh. Kasi siya ang makakaalam kung gaano kababa ang pwedeng ibaba ng premium contributions. Kasi sa ngayon, ayon sa batas, kahit wala tayong ginagawa, pataas ng pataas ng pataas. Every year, merong automatic increases. Buti na lang hanggang 2025 na lang. But that's how it is. Pero clearly, hindi naman yan based on actuarial factors, di ba? So, sana sa susunod na hearing, bigyan nyo kami ng mas konkretong steps na gagawin ng ating management para masigurado or ma-assure kami na magkakaroon ng mas proper na actuarial management ang ating napakalaking pondo na baka umabot na ng 800 billion by the end of this year. So finally, just to wrap up, isang tanong na lang siguro kay Asek Albert, kung meron kang gripo na may tumutulong tubig at meron kang timba na sumasalo doon sa tubig at napuno na ang timba dahil nakabukas ang tubig, anong dapat natin gawin?
Para hindi humasayang yung tubig, sinasara po yung gripo.
Pero siguro, magandang gawin, bago natin isara ang gripo, palakihin ang timba. Yun naman ang gusto ng Kongreso. Kaya paulit-ulit kami naghihiring, mga kababayan. Hindi po kami nagkulang sa kasasabi po sa PhilHealth na kailangan natin palakihin ang timba. Kung kulang yung timba na yan, bumili ng another timba para makasalo ng tubig na umaapaw. Dahil nga, sige lang ng sige ang pagkolekta ng buwis at pagpasa sa inyo dahil ang basehan ay ang koleksyon ng buwis na kinokolekta sa mga hindi tumitigil na naninigarilyo. Yun ang problema po. Kaya lang, anong gagawin natin despite the fact na ang kulit-kulit na namin, ganun pa rin ang sitwasyon, pansamantala siguro, baka para ma-remind na kailangan na talagang bumili ng mas malaking timba, anong kailangan gawin, Asek Albert?
Pansamantala pong isara yung gripo.
Si DOH po nagsabi nun, hindi po kami. So, yan po ang, I will end there, Mr. Chair. Marami pa tayong pwedeng tanungin, but next hearing na lang po, Mr. Chair. Maraming salamat po.
Thank you po. Yes, Honorable Ako.
Thank you, Mr. Chair. Ito, hindi ko na po tatanungin sila sa binasa ko ngayong hapon na ito. But I would just like to know whether PhilHealth has submitted all the documents required of them by the members of this committee in the last hearing.
Comsec.
Yes, sir. PhilHealth has complied with the second and third, particularly on digitalization and collection efforts. For the first one, they submitted it just today, Your Honor. PCEO Ledesma po.
From the list, there are supposed to be
3.
from letter A to M. First one is to provide a detailed breakdown of the ratio of funds allocated to benefit payouts versus investments sourced from the 2023 and 2024 government subsidies. But anyway,
Not yet. Not
sige,
yet.
since si Chairman ay may lakad, may I ask the head of PhilHealth, sinabi po nyo kanina na yung COA ay nakaka-istorbo sa inyong mga operations. Would that be correct?
Mr. Chair, hindi naman, I think nakaka-istorbo is the wrong word.
Yung, ano ang appropriate term?
Maybe they just have certain guidelines which we at PhilHealth want to strictly adhere to.
Hindi ba dapat ganon?
Dapat ganon, Mr. Chair.
Yes, bakit nyo po, are you not supposed to operate within the guidelines of COA dahil binabantayan po nila yung public funds eh? Hindi po ba?
Yes po, ginagawa po namin yan, Mr. Chair.
Bakit po kayo nagre-reklamo? At sinasabi nyo pa na yun ang dahilan kung bakit, kung minsan, naantala yung inyong mga operations. Yun po yung i-interject ko kanina sana eh. Hindi ko na nakalimutan dahil inilista ko rito eh. Kayo po ang nagsabi nun.
What I meant, Mr. Chair, can I respond? What I meant, Mr. Chair, kasi yung sa RTH tsaka sa denied claims po, ang sinasabi po namin, very strict rin yung guidelines ng COA that we have to follow. We have to adhere to their guidelines. Kung hindi po, makakahanap sila po ng mga pagkakamali po sa amin po. Yun ang ibig ko sabihin po.
Are you trying to tell this committee that we have to relax the guidelines of COA? We're speaking of public funds here. Hindi ba dapat mas mahigpit, mas maganda?
Yes po. Actually po, more on compliance lang po. No? Not relax the guidelines po.
Okay.
Thank you po.
Thank you. There was an issue before. Ito, hindi na po galing sa akin. May nag-text na po sa akin na ito ang tatanungin ko po sa inyo. Nakalagay nga rito, pwede ask mo kung because in 2020, if I remember it right, merong controversy yung IRM. Tama po ba?
Yes po.
Yes. And cases were filed. Is that correct?
Yes po.
Yes. May I know the status kung na-close book na ito, yung issue na ito?
Mr. Chair, if I can be allowed po, kasi wala pa po ako nung 2020, no?
I know.
So, Mr. Chair, if I can be allowed to maybe ask one of my colleagues to address the queries. Okay lang ba po?
Kasi nakalagay dito, pwede ask mo kung kumusta na yung mga nakasuhan sa IRM, ano na ba yung status? May
Attorney Santos,
nanagot
would
na
you
po
like to
ba
respond?
para sa ma-close book na ito?
Mr. Chairperson, Honorable Representative Akop, for the information of the body, the officers involved during the development of the policy on IRM are present here, Mr. Chairperson. Probably, if proper, we can, so they were also respondents in cases filed. Probably, Mr. Chairperson, we can request them to update on the cases filed against them. Mr. Chairperson, please.
Yes. Asan po sila?
Are you not supposed to know that?
Mr. Chairperson, Honorable Representative Akop, I'm not a party to the cases filed, Mr.
Yeah, but
Chairperson.
that involve the funds, insofar as PhilHealth is concerned.
Yes, Mr.
Legal
Chairperson.
ka, di ba?
No,
Chief
Mr.
Operating
Chairperson.
Officer.
Dati.
Yes, Mr. Chairperson. I understand, Mr. Chairperson, but
I do not, I'm amazed why a high-ranking officer of the PhilHealth doesn't know what happened in 2020. May mga kaso na na-file dito. Yung ang constituent ko, sinasabi nga niya hindi ko na nga kayo tinatanong doon sa inihanda ko. Ang tinatanong ko na lang para masatisfy ko yung nag-text sa akin, tanungin ko kayo. And you're not going to give me an answer?
yes, Mr. Chairperson, Honorable Representative
Just,
Akop.
just give us the status of the case.
Honestly, Mr. Chairperson, I do not have information as to the status filed against the respondents or those involved during the development and implementation of IRM. But they are here, Mr. Chairperson, probably individually they can give the
Mr.
status.
Chair, I think you have the urgency for time. So may I just request that PhilHealth submits the current status insofar as this IRM fiasco is concerned?
Yes, Mr. Chairperson, Honorable Representative Akop.
Thank you. Meron din po silang sinasabi po rito recommendations. Yung mga OFWs, they are direct contributors. Tama po ba?
Yes, Mr. Chairperson.
Yes, Mr. Chair.
Honorable Representative.
Yes. Sinusunod nila yung contribution table na sweldo na isang, for example, DH sa Hong Kong, for example, ang sweldo niya 50,000 times 0.05 or 5%. So, ang amount ay 2,500 a month ang babayaran niya na premium. Tama po?
Yes, Mr. Chair.
Kaso, sabi dito, wala naman po siyang employer Hindi naman natin ma-charge yung employer dahil nasa foreign country, foreign citizen yung amo niya. Wala siyang kahati. Yun ang sinasabi niya. Bakit hindi raw hatiin yung 2,500 at yung kalahati, yun lang ang babayaran ng for OFW natin. Hindi po sa akin to. Nagte-text po sila yung mga
Mr. Chair.
nanonood
Yeah, sorry. Mr. Chair, can we ask Sir Lem, who heads our member management group, to comment, please? Sir Lem. can you
Yes,
comment?
Mr. Chair, and this is, tama po kayo, Honorable Chair, and that is one of those provisions we are proposing for the UHC amendment. Kasi sa UHC po, nakalagay po doon, ang mga migrant workers po are included as direct contributors. So yun po yung namin, one of those proposal po.
So, PhilHealth is amenable to half the amount?
Yes po, hindi ko po alam kung kailan. Yes po, we recognize po na kailangan pong tulungan.
But it needs a law.
Yes
Yun
po.
lang po ang gusto niyo sabihin.
Yeah,
We
po.
have to amend the law.
Yes po.
Thank you. The other issue is madaming claims denied since ang dahilan they were filed beyond 60 days. Tama rin po ba ito?
Yes, Mr. Chair.
Pwede po bang, are you amenable of amending the law na increase yung 60 days to 75 days? Tinatanong po nung nag-text sa akin eh. Hindi naman po akin to.
Mr. Chair, we can look into it po.
Yeah.
We can look into increasing the number of days po.
Yeah. The other issue is that there are plenty of plantilla positions that remain vacant. But they also have employees who have been under them for more than a decade. Would this be true?
May I answer?
Yeah, go ahead.
Mr. Chairperson, Honorable Representative Akop, insofar as appointment is concerned, I believe that we are updated in the filling up of vacant position, but as to whether or not there are still vacant positions, we'll submit a report as to the status of our filled in as well as a vacant position. Mr. Chairperson, Honorable Representative Akop.
Okay. Nandito po yung recommendation niya. PhilHealth is long overdue for a reorganization since the last impactful one was around 2007. I do not know if this is true. Tama?
Mr. Chair, we currently have a pending major reorganization with the GCG. Mas Manny, pakisagot lang po yung kwan. Hindi ko po katanungan Yes, Mr.
ito.
Chair.
Yes. Kasi, sabi niya, in light of the UHC Act in 2019 and all these enhancements on its health packages, the likelihood of increased claims is a certainty. How would the top brass of PhilHealth plan to address this? Kasi, kaya ko po sinasabi sa inyo ito yung galing sa ground na eh. Hindi na po galing sa amin. Ito yung kanilang observation.
Mr. Chair, so we would address it by our pending reorganization, wherein we will increase the number of manpower by 30%. And we also are moving forward with our full digitalization, Mr. Chair. Thank you, Mr. Chair.
Thank you. Mr. Chair, kailangan nyo umalis eh. That would be all. There will be another hearing where I can ask my official questions. Thank you, Mr. Chair.
Thank you po. There be no other matters to discuss. Do I hear a motion to suspend?
May I move that we suspend the meeting on PhilHealth, Mr. Chair. So move.
Is there any second to the motion? Duly seconded. Is there any objection? Hearing none, the motion is carried. The committee hearing is now suspended until further notice. Thank you.
Sayang yung basa ko. Sayang yung basa ko. Stock knowledge. O, pati COA report, nandito eh.